All right, everyone, live look here at the White House just moments away. We will also have, in case Arizona Governor Doug Ducey is right on time, we will feature that for you as long as we don't see the president. He's been sometimes anywhere from 15 to 20 minutes late. So this is the Arizona briefing that will be happening in about 12 minutes. We're going to feature that for you in just moments, everyone. Let's take you now live, though, right out here to LA County as they're doing a briefing right now.
An additional 150 ventilators in the EMS stockpile that are available for distribution to hospitals should they need them, and those are distributed only on a as-needed basis. On top of that, there's an additional 170 ventilators that are still currently being refurbished. The Department of Health Services also has an order out for additional ventilators, and those we anticipate coming in at the level of a couple hundred more over the next week or so. On top of that ICU bed capacity, that includes just the general acute care hospitals in the county. So there's also the Mercy Ship, there's also the planned beds that will come online at the LA Surge Hospital, which we announced yesterday. And to that, I'm grateful for the work of our partners, Dignity Health and Kaiser Permanente.
All right, folks, so that shot was unfortunate there because it was frozen, but here's another live look right here at the White House briefing room. It's expected to go in about 10 minutes, but you could see there's only just a couple of reporters there that we see. Still, some of them got to get there, so we'll bring that to you when that does happen in just moments. But we will be looking forward to, in double box, is Governor Doug Ducey from Arizona. We will feature him for as long as we can until we got to break away for the president. All that coming up here in just moments, everyone. You're watching live here on coronavirusnow.com. We do appreciate you joining us here today. In the meantime, let's show you some of KTVU's coverage here.
The CEO of the Lazarus Cancer Foundation. We also have Dr. Hella Bordo, who is the Assistant Professor of Medicine, Division of Hematology and Oncology at UCSF. And we also have Becky Stevens, who's a clinical trial participant. Thank you to all of you for joining us.
Thank you for having us.
This is an important conversation, and for those who are just joining and trying to figure out where this discussion is going, let me just kind of give them a brief outline. The COVID discussion has really gotten us all thinking a lot about clinical trials, about how quickly we can get treatments into the general population, about the process. I mean, we've done so much analyzing about that. So Dr. Bonar, you've written a paper really on how this COVID discussion is really going to change clinical trial participation. Dana, I know that your organization works a lot with trying to get more access to people who are going through clinical trials, specifically for cancer. And then Becky, you are on the front lines of this, understanding how to be in these trials and really how important they can be. So, you know, in the big picture, before we get to specifically how COVID is affecting this, Dana, I want to go to you. So, and let's talk about access to clinical trials and what Lazarus Cancer Foundation is doing. I mean, there's a lot of discussions, and we've talked about these discussions before about access to clinical trials, and really before this, it's been cost, it's been proper representation, and all of that making a difference in really how many people can participate and how this all works.
Yeah, so, you know, historically, cancer patients already have a lot of challenges in relation to enrolling in clinical trials, having access to clinical trials, and actually being able to get to their clinical trial. And that's why LazarX exists, to remove those barriers. COVID-19 really just adds to that complexity. Now we have patients who are already dealing with an uncertain future, having to now deal with the uncertainty of what little routine they've been able to come up with and put together in relation to fighting their disease through cancer clinical trials. And so, you know, now they're already immunocompromised. They're, you know, not being able to see their doctors in the way that they used to, and they're fearful of additional exposure. So, you know, adding a coronavirus disease on top of cancer it's just unthinkable, unimaginable for our patients.
It is scary for people who don't understand the process. I mean, I think a lot of the discussion has always been on, can you get into the clinical trial, right? Like that's been the key, and maybe don't realize, and I wanted to play this video that is just one of your guys' videos about that's the first step. First, you got to get in. First, there has to be one that's available. First, and all those things. But being a part of them, it can be a very stressful, difficult thing as well.
Yes, that is correct. By the time a patient is entering into a cancer clinical trial, they're spent in so many ways. Physically, spiritually, emotionally, and sadly, financially. And so, being able to bring patients into the fold of cancer clinical trials and allow them to have really equitable access to take advantage of medical breakthroughs in technology is great. But again, this disease just puts adds so many more complexities. And in fact, we're seeing some of our patients who would normally fly to their trials calling us and saying, I can't fly, I want to drive, but I can't, it's far away, it takes me a whole day to get there, can I stay? Now they're hesitant to stay in a hotel because of COVID-19. So it's really challenging. But I know that Dr. Borno, in having some conversations with her about our patients like Becky, UCSF has come up with some great ways to try and manage that.
So Becky, I want you to explain, I'm going to get to Dr. Borno in a second because I want her to talk about this paper that she just wrote on really kind of the changes. But Becky, give us just a really quick, description of what life is like for you. How long have you been participating in a clinical trial?
So I was diagnosed with cancer just over a year ago, and I did traditional chemotherapy for a while, and then we found that was really successful, but not successful enough to get rid of the cancer. And so we reached out to UCSF, who I had a prior relationship with, because my type of cancer is a very specific type that kind of is very difficult to treat, and not that much known about. And so we were able to hook in with UCSF, and they found a clinical trial that would work for me. So I've been on it for about 6 months. The goal of my clinical trial is stability, so to make the cancer not grow and just kind of keep it the same, and it's been really successful. Traditionally, what I do is once a month, I live about 2 hours away. I drive in to San Francisco for my appointment. They're back to back to back to back. I do all of my appointments in one day, and then I turn around and drive home on the same day. Is that kind of what you're looking for?
Yeah. And so how has COVID-19 changed the way you get your treatment?
So I'm really lucky in that mine is not, it's an oral pill that I take. And so it's not one where I need to go in specifically to be infused. So I was able to figure out a workaround with the help of UCSF and my local doctors here, where I could get my blood work taken here. I did a video visit with my doctor. I had someone come and take my vitals at my house. So I was able to kind of do everything that I usually do at UCSF remotely.
Which is great, which has probably taken a lot of stress off your shoulders. Dr. Borno, how common is her situation though, in her ability, Becky's ability to kind of transition that easily versus other patients and other types of clinical trials? Can they do the same?
I think Becky nicely summarizes what all medical oncologists are trying to do. We are operating under this imperative of risk reduction. And so for a lot of our patients, we may be deploying therapies that increase the risk of infection. And so if you think about treating patients with a therapy that increases the risk of infection in the context of a pandemic, that's terrifying. And so we constantly have to ask the question, is the need to have that patient present to a facility absolutely necessary? And weighing out the benefits of presenting to a facility versus the risks of potentially being exposed to the virus. And so I think Becky's example nicely summarizes some of the changes that have been made. So, across the healthcare system, the uptake of telemedicine has been dramatic. So we really are trying to communicate with our patients telephonically or through video visits to ascertain the information we need in order to make sure that they're safe and well and not experiencing toxicities that aren't being managed. We are rethinking whether or not a blood draw is necessary at every given time point. That's certainly part of conventional care. And then if it's necessary in the context of a clinical trial, we ask the question, where can they get that blood draw as easily as possible, as quickly as possible, with the least amount of interaction with others. And that's really underpinned by this imperative to reduce risk. And then, of course, there's the question of how do they get drug? And Becky is fortunately on an oral therapy, as she described, so being able to get the drug delivered to your home is an ideal circumstance. That's not necessarily the case for all patients who may require infusions and so have to actually physically present to a healthcare system, but we really are trying to rethink ways to make something that is usually very high touch less so in order to protect patients from the risk of exposure.
So some of the changes, I think about, in journalism, there are things that we can do, and I can do these Zoom calls. We prefer to go to you and talk to you and see labs and see things, but we can do this. Some of the things it's because we have to do. And then sometimes I think we're looking at the way we're doing things and saying, well, is this a better way to do it? Where does all this fall? I know that you really talked about this and how COVID-19 is going to change the way we look in general at clinical trials, right? It's how do we address the people we have now and how do we do this in the future? Because certainly when we're looking at COVID-19 treatments, everyone wants to speed those up and figure out how we can do that in an efficient way.
Well, I think when you're thinking about cancer clinical research, the most important thing is patient safety. Right now, we're dealing with something that is extremely high risk for our patients, which is this pandemic. And so that's definitely putting pressure to redesign the way that we deliver care. I think in some ways, pressure that is necessary and that will hopefully make us rethink the burdens we place on patients, especially the burden of travel and representing to facilities. But because we are focused on patient safety, I think that has led preferentially to in-person visits, physical evaluations, frequent blood monitoring and imaging, all to detect a potential, quote, adverse event, something bad happening to our patient and something bad happening as a result of the intervention that we're deploying, which is, the therapeutic drug. In this context, patient safety, the something bad that's on everyone's mind, of course, is the risk of infection from COVID-19. And so that is coloring and appropriately informing the way that patients are being managed, both in the context of a clinical trial, but also as part of sort of routine cancer care.
Yeah. And Dana, if I bring you back in on this, I want to, when you're talking about, I know that you focus a lot on travel expenses and how that's been difficult for patients to be involved in clinical trials. Is the upshoot of this, if we can figure out how to do more clinical trials through telemedicine, that it opens up and that maybe while this increased danger to patients is obviously causing a high level of stress, that in the long term, if we can get them into the people that they need to see, get them part of these clinical trials where travel won't be as necessary, isn't that a bonus?
It's a huge bonus, and it's one that I really hope that we can harness the value of that and really look at this terrible COVID-19 pandemic and come out on the other side with something that is really has had a positive influence on the way that cancer patients are being treated and the way that we set up our cancer clinical trials for patients. There's been, for many years now, there's been so much talk in the industry about decentralizing trials or having virtual trials or, taking the trial to where the patient is. And there are numerous articles and, webinars, everything, that addresses that. But really, there hasn't been a lot of action taken to make that happen. And I think the reason for that is that it requires so many different stakeholders to come together and unify and do something that is counterintuitive to the way that they've always done it. And COVID-19 has literally thrust us into this situation where we've had to unify with each other. We've had to come together, and we've had to work with each other in ways that we'd never consider, previously, and do so very, very rapidly.
Well, I think, yeah, I mean, the stats that your folks sent to us were saying that less than 5% of cancer patients participate in clinical trials. A fraction of those patients are minorities. More than 50% of clinical trials fail because they can't get enough patients. And that cost to travel, again, is the biggest barrier. And that's something that you guys have been fighting against, but now people are, I mean, if you're talking about they can't get enough patients in a trial, if they don't have to travel, I would imagine you would get more.
Absolutely. I think that if we can reduce the burden on the patient will be more inclined to say, yes, this is something that I want to do.
Yeah. And Becky, let me bring you in on this too. Like, while you used to drive in and get all your treatments in one day, how much better is it at home? Is it better, or would you rather
it's much better. I have 2 young children, and so not only is there stress on me, but every time I leave and I'm driving and I'm gone for the day, and we've had to figure out childcare, which is, not a big deal, but the stress on them and they're so anxious knowing I'm going, and it's a big deal. And when will I get home, and how is mom? Not having to do that would be great. And when I was looking at clinical trials, I honestly looked at certain ones and went, oh, I have to go every 2 weeks. Nope, that's going to be too hard for me. Or, oh, I have to do this and then drive in the car 2 hours after a treatment. No, that's going to be too hard for me. I had to really balance my quality of life with what clinical trial I thought was going to.
Right. What if it was in Texas? If it was a clinical trial in Texas or something? I mean, there were some that you wouldn't even consider, obviously.
Yes, and even ones that were close by, I still wouldn't consider some, because it was just too much of a toll on the whole family.
Yeah, you have a life to live. Yeah.
If it was a virtual one, that would change things drastically. Or being able to, the girls were.
All right, everybody, we are switching gears here. We're going to keep you a double box, but we're going to take you out to Arizona live right now. Governor Doug Ducey of Arizona is giving an update.
To slow the spread and taking necessary actions. This has been a really tough month in the state of Arizona. My heart goes out to everyone who has been affected by this virus. If people do not have this virus, we don't want you to contract it, and you can avoid it by following the guidance. For people who have contracted the virus, you're top of mind. We want to make sure you have all the care, comfort, and information that you need to get through this and recover. Additionally, we know this is having a big impact on people's livelihoods. So there are a number of steps we are taking to stretch and strengthen our social safety net to protect our people and to protect our economy and our future economy. On all of this, we're going to continue to use our heads, and we're going to continue to use our hearts. We know that every decision that we make impacts every person in the state of Arizona, our friends, neighbors, and loved ones. First, an update on the actions and developments of the last several days. Over the weekend, President Trump approved Arizona's request for a presidential major disaster declaration. I want to thank the President for a quick turnaround. We requested this on a Wednesday, and we had approval by Saturday morning. This action will make additional federal assets and resources available in Arizona's response efforts, and we are grateful to the administration for their continued support and responsiveness. Obtaining PPE, that's the personal protective equipment, the masks and gowns and gloves, remains a top focus of ours, and we are making progress on this front. On Saturday, we announced an agreement with Honeywell. They've committed to producing more than 6 million N95 masks over the next 12 months for Arizonans on the front lines. On the economic front, our small businesses need more help to weather this storm. So yesterday I signed an executive order putting a stop to evictions of small businesses and nonprofits facing hardship due to COVID-19. Many landlords are already working with their tenants on a path forward, and this order is an added measure of support for small businesses and nonprofits who serve Arizona so very well. Now to our latest actions. When it comes to getting the essential food and supplies Arizonans need, we're focused on keeping our supply chain strong. So today I've directed the Arizona Department of Transportation to issue new guidance allowing commercial trucks with heavier loads to operate without overweight permits. These new rules will ensure that Arizona's grocery stores, pharmacies, and medical providers remain fully supplied. Next, jobs and helping those most in need. As part of Arizona's COVID-19 relief package, today we announced $2 million to Goodwill. Their operations have obviously been impacted by COVID-19, and there are a lot of people in need right now. This funding will help put 400 Arizonans back to essential work while expanding support to those in need. We also know that obtaining unemployment benefits is something many Arizonans need right now. Our team at the Department of Economic Security is working around the clock to update our systems, handle historic levels of intake, and pull down federal dollars fast so we can get checks out the door and into people's pockets or bank accounts. In our correctional system, we continue to screen the health of correction officers prior to entrance into a corrections facility, and in-person visitations remain suspended. In total, 49 inmates have been tested for COVID-19. 42 of those tests have been returned as negative. 7 COVID-19 tests are pending results, and we'll keep you updated. The state has obtained cloth masks for every correction officer in the state. This will protect them and our inmates while preserving PPE for correction officers in the event of a COVID-19 spread in our prisons. Since my declaration of public health emergency on March 11th, I have issued 15 executive orders to tackle this crisis. Today, I'm issuing 4 more. First, protecting our elderly and most vulnerable. The Centers for Medicare and Medicaid Services recently put out new guidance to keep elderly adults safe, including conducting symptom checks of anyone entering a facility and equipping staff with PPE to the greatest extent possible. My executive order ensures Arizona nursing homes and long-term care facilities are adhering to these guidelines. The order also requires these facilities to provide an electronic visual form of communication, like FaceTime or Skype, to allow family members to have access to their loved ones. Also being issued today, an executive order to amplify reporting from our medical providers. We want detailed information about COVID-19 patients, including how many are in ICU beds. Next, preventing further community spread from other states or regions with widespread COVID-19. The CDC recently issued travel advisories for anyone coming from New York tri-state area. My third executive order today requires anyone flying into Arizona from Connecticut, New Jersey, or New York to self-quarantine for 14 days, and our Department of Health Services will be working with airports to make sure travelers are made aware of these requirements upon arrival. And finally, more help for our small businesses and local restaurants. Many restaurants have unused commodities, food and otherwise, that could be sold to generate more revenue, to pay the bills, and help with payroll. My first executive order today provides flexibility on packaging and labeling rules to give restaurants the ability to sell additional goods to the public. And please patronize your local restaurants. Get takeout or delivery and be as generous as possible in tipping your service workers. Once again, Arizona is grateful for every individual and organization that is working, partnering, and sacrificing to help others during this time. What I mention here today only touches on the surface. As Dr. Anthony Fauci with the NIH alluded to over the weekend, the social distancing measures we have implemented are making an impact. We need everyone to keep it up, and I want to thank everyone for their cooperation and responsible behavior. Next, I want to hand it over to Dr. Kara Christ for a public health update. Doctor?
Thank you, Governor, and good afternoon, everyone. Today, I'd like to provide you with an update on the latest information about our cases, testing, preparedness planning, and the latest executive orders issued by Governor Ducey. To date, in Arizona, there have been 2,575 cases of COVID-19 in all 15 counties, and tragically, 73 Arizonans have lost their lives to this disease. With widespread transmission, we know that there have likely been and currently are more cases in our community. Across the country, we're learning more about the disease and how it impacts the health of Americans. While some cases are asymptomatic, we know the devastating risk that it poses to our high-risk individuals, primarily our elderly community. Across the country, we continue to see a shortage in testing supplies, from swabs to testing reagents, and Arizona is no exception. To date, 33,375 tests have been administered in Arizona. This is a 73% increase from the 19,271 total tests administered a week ago today. While we've made great progress, testing supplies remain in short supply. I'm hoping that as the supply chain strengthens, we will be able to administer tests to get every Arizonan who wants one results. But as of now, we must continue to prioritize those tests to the most high-risk Arizonans and those on our front lines, our first responders and our healthcare providers. Remember that testing will not change your treatment, but it can provide certainty for those first responders and healthcare providers who continue to be in high demand as cases increase. We continue to build capacity within our healthcare system, working closely with local county health officials and our hospitals and healthcare systems. Today, Arizona has 16,905 hospital beds and 1,532 ICU licensed beds. We will continue to provide updates on our work with the Army Corps of Engineers and Arizona National Guard to build out our bed capacity. While modeling shows promise in terms of projected cases, we continue to plan for the worst case scenario, ensuring that every Arizonan has access to adequate care in the event of a surging demand, and that includes ventilators. Using our new enhanced surveillance data, we're tracking the health of our healthcare system. Our hospitals are currently using 64% of the state's ICU capacity, 68% of the medical surgical beds, and 25% of the state's ventilators. That's 393 ventilators in use as of this morning, and that's primarily treating needs outside of COVID-19 cases. But we have an additional 1,152 ventilators available. We've dedicated $10 million from the Public Health Emergency Fund to provide funding to hospitals for the purchase of additional ventilators. Given this investment and the additional information that we've acquired through our enhanced surveillance, the updated modeling, and regarding our current ventilator capacity, we have amended our request to the Health and Human Services for just 340 ventilators. We've taken delivery of the state's portion of the Strategic National Stockpile, but we've committed an additional $9.1 million towards procuring additional PPE. This includes an agreement with Honeywell to produce over 6 million N95 masks for the state of Arizona over the next 12 months. And thanks to the generosity of the Ben and Catherine Ivy Foundation, we've directed an additional $5 million towards PPE. Their donation to ArizonaTogether.org will allow us to purchase additional high-demand resources like masks and gowns that our healthcare providers urgently need. I'm very grateful for Governor Ducey's leadership and prioritization of public health, from school closures to prohibiting dine-in services at restaurants and the closure of bars, movie theaters, and gyms, to the stay home, stay healthy, stay connected order. The governor has acted responsibly at the right times and has used public health as a guide. 2 of the governor's executive orders are directly informed by guidance from the Centers for Disease Control and Prevention and move Arizona another step forward in mitigating the spread of COVID-19. The first order is an order protecting vulnerable residents at nursing care institutions, intermediate care facilities for individuals with intellectual disabilities, medical group homes, and residential care facilities, including assisted living facilities. We know that our elderly and those with underlying health conditions are the most vulnerable to severe COVID-19. This order ensures that the staff at these facilities come to work healthy and they use PPE appropriately, and that confirmed and potentially suspected cases are cohorted and isolated from other residents. And if facilities suspend visitation, it requires them to establish electronic visual form of communication in lieu of face-to-face visits for residents. This is really important for all residents, but especially for those at end of life or receiving hospice care. The second order requires travelers from areas with cases of COVID-19, including New York, New Jersey, and Connecticut, to self-quarantine for 14 days. We know how quickly this disease spreads. This order will help to mitigate the spread of this highly contagious disease. And in addition, today the governor issued an executive order that updates and allows us to collect additional enhanced surveillance data to be reported to the department, including intubations completed per day, the number of COVID-19 positive patients in the hospital, the number of COVID-19 positive patients in the ICU, the number of COVID-19 patients in the emergency department, and the number of COVID-19 patients who are discharged from their facility. This data will allow us to better prepare for our peak in cases and hospital demand, and it will help us identify a better recovery rate for Arizonans infected by this disease. Today marks 1 week since the governor's stay home, stay healthy, stay connected order. It's very important that we prioritize the physical distance but engage in social connectedness. While these are difficult times, more than ever, it's important to be kind, compassionate, and supportive of our fellow Arizonans. For more information on ways to stay connected and preventative measures you can take to stop the spread of COVID-19, please visit azdhs.gov. This site is updated daily at 9 a.m. with new information on COVID-19 cases. And finally, many of you have asked for additional information and statistics about the confirmed cases within Arizona. And beginning Sunday, we will update our website to release information on the confirmed cases with enhanced location information and additional new tabs that will contain information regarding deaths, supplies distributed around the state, and our enhanced surveillance data. Thank you. I'll now turn it back over to Governor Ducey.
Thank you very much, Dr. Christ. Next, I want to say that we're very grateful to Tom Betlak for agreeing to come back and lead the Department of Economic Security during the crisis. Director Betlak is a true public servant who loves Arizona, and he brings decades of experience in state government, including navigating through the Great Recession. I've asked him here today to give us the latest on his team efforts around unemployment and social services. Director Betlak.
Thank you, Governor. Excuse me. Thank you, Governor. The Department of Economic Security, or DES, is responsible for overseeing a number of different programs. Today, we're going to focus largely on the unemployment insurance program and provide an update in terms of all the efforts the department is taking and working around the clock to deal with an unprecedented demand for these services. So we have some data to give you some comparison in terms of what's transpired with unemployment insurance in terms of the requests. So if you look back just a little over a month ago, we had roughly 17,000 individuals throughout the state that were on the unemployment insurance program, and we'd see about 3,000 new applications or so within any given week. Fast forward to what's transpired within the last 3 weeks, and you can see why this is really an unprecedented demand. When you look and see, we have, over the last 3 weeks, received requests for new applications of 29,000 3 weeks ago, 88,000 new applications 2 weeks ago, and just as we reported yesterday, 129,000 new applications for last week. In comparison, during the Great Recession, at the height of the Great Recession in 2010, in terms of the number of individuals that were on the unemployment insurance program, that was about 175,000 individuals as compared to 250,000 individuals that have applied just within the last 3 weeks. I want to take this opportunity to remind individuals that have applied to make sure you're going back every week and updating your claim. That is something that's required. It is not something that we can waive, and it's critically important for individuals to do that, whether your claim has been processed or whether it's pending. Please go back on a weekly basis and provide the updated information on our online site. Obviously, in response to this unprecedented demand, there's been several different policy changes that have been done both at the state level and at the federal level. So the governor issued an executive order, one of the 15 that he mentioned earlier, in terms of providing some streamlined changes to the unemployment insurance program. So we are now able to waive a 1-week waiting period. We're also able to do some other aspects in terms of recognizing the impact of COVID-19 as it relates to individuals no longer being employed and having to come in to the program, or looking at job search programs going forward in terms of the near-term impact associated with unemployment insurance. In addition to that, at the federal level, there's been 3 significant changes. The federal government authorized increased payments of $600 per week on top of the state's $240. It created a new program for individuals that are independent contractors. These individuals may not be tied specifically to an employer, but it creates this new program to recognize this group of individuals who previously did not have access to unemployment insurance. And it also extended the benefits by an additional 13 weeks. As I mentioned earlier, the Department of Economic Security has been doing a number of things to deal with this unprecedented increase. The first is we've increased our staffing to be able to answer the calls. We recognize it is still challenging for individuals to get through. We have seen the demand just surge to, at certain points in time, 70 calls per second coming into the state lines. We went from roughly 20 individuals to over 150 individuals. We are looking to add increased staff. We are also working to partner with a private sector organization to come in and expand our call center capacity. We have increased a lot of the information on our website, including a number of FAQs to provide information for individuals. We clearly know that there's an increased demand of individuals coming into the website, not only for the online application, but also in seeking information. Most importantly, we've been working tirelessly to make sure that all of the system changes are put in place to recognize the policy adjustments that have been done to make the new payments available for those that are depending upon the unemployment insurance program. So we have completed the update of the systems that are needed to waive the 1-week reporting requirement. We are in the process this week of making the system changes so that individuals will be able to receive that additional $600. But what does that mean, for the real life in terms of what individuals are waiting for? Well, it means that if an individual was one of the 88,000 individuals that applied the week of March 29th, and if they went in and updated their weekly claim, as I described earlier, the first payment of $240 went out this week. But then that's going to be followed next week by the additional $240 that individual received, the $600 federal increase, the $240 retro for the 1-week waiting period, which we are now processing in the system, $600 additional for the week of April 5th, and $600 for the week of March 29th. So there's obviously a lot of different scenarios that play out, and we recognize that each individual faces a unique set of circumstances. But I wanted to provide that as an example to show the types of impact that all of these policy changes are having and how quickly we are planning on getting these dollars distributed. So thank you, Governor.
Thank you very much, Director Betlach. I really appreciate it. And I really also am grateful for your continued service to the state of Arizona. Next up is Kimber Lanning. She's the Executive Director of Local First Arizona. Kimber is an entrepreneur and a business leader, and someone that I greatly admire. Her organization has over 3,000 small business members statewide. She's been a champion and a voice for advocating for their needs and the hundreds of thousands of Arizonans that they employ. She's here to talk a bit about those efforts. Kimber, will you come up, please?
Thank you, Governor. So we're seeing firsthand in times of crisis that the local businesses that are deeply rooted in their communities continue to show up to provide solutions for their state. From Santan Brewing distilling 16,000 gallons of draft beer they could no longer sell into 400 gallons of medical-grade hand sanitizer, to local furniture companies such as Urban Plow making intubation boxes for healthcare workers across the U.S. Local banks are also improving once again that their resources and their presence in our community is invaluable. It's been exactly 3 weeks since I last joined the governor to announce that Arizona was now eligible for the economic injury disaster loans, and we've been able to land some significant wins since then. I want to thank Governor Ducey and his entire team for always listening and turning their ears to small businesses first. Just yesterday, with the eviction protection, rent is almost always the largest expense for a small business owner. And we know that with this protection in place, when this is all over, small businesses are going to be leading the Arizona economy again, day by day and hire by hire. Recognition is due also to Chefs Danielle Leone of the Breadfruit and Chef Silvana of Barrio Cafe and Stephanie Vasquez of Fairtrade Cafe for organizing thousands of restaurateurs across the state. While we've been reading and hearing a lot about the great businesses who are stepping up to help, we're not hearing enough about those who have already shut down or who will need to make that decision very soon. And this is why we at Local First Arizona launched the Small Business Relief Fund to offer mini grants, not loans, mini grants, to Arizona's small businesses that employ up to 3 people. They're often family owned and they rely on business income to put food on their family's table. If you have the means, we urge you to contribute to this fund. We've been able to raise $350,000 so far, and we're excited about the partnerships we've been able to form with other leaders across the state to distribute these very critical funds into the most remote regions of Arizona. For example, Want Water. It's a husband and wife team in Parks, Arizona, distributing water to remote rural households, to OxyCheck down in Tucson, distributing critical oxygen in homes where residents have medical challenges. We're hearing from businesses that you know and work with every day, beauticians and barbers, cafes and coffee shop owners, event and wedding planners, handymen and electricians, artists, musicians, and their AV and technical support, small retail shop owners, food truck operators and catering companies, physical therapists, fitness trainers, small auto mechanics, yogurt shops, dulcerias, bakeries, and in-home child care providers. And I'm just scratching the surface. These are people you know, they're your family members, they're your neighbors, and they're in crisis. These are the small business men and women who make up the economy. They make the economy run, and most of them right now are still in limbo. Federal help won't be kicking in for another 2 to 3 weeks, and we are already seeing pain points with the process and some discouragement from small business owners. As a result, we are offering one-on-one counseling for our business members across the state. You can contact us at localfirstaz.com to schedule a time to talk with our team to see if we can help you navigate the problems that you're having. I also want to announce that Community banks, once again, are stepping up, while our national banks, such as Wells Fargo, have closed the application process, and Chase Bank has only interest forms available. So I encourage you to reach out to your banker and continue to ask our big banks to step up for small businesses in Arizona the way the local community banks have. Horizon Bank, as an example, is announced that they're accepting new accounts and willing to work with you if you have not had an account with them in the past. So I'll leave you with this. Buy local whenever and however you can. Bank local, and remember who circulates money back into your home state. We've been leading this effort since 2003, and we can't find a more perfect example of the consequences of not keeping dollars in your home state than right now. To learn more about moving your money to an Arizona community bank, or to learn more about how you can help support a small family-owned business, I would encourage you to visit localfirstaz.com and follow us on social media. Thank you very much.
Thanks so much, Kimber, and thanks for the good work of Local First. I know we both have a very special place in our heart for the small business entrepreneur and the Arizonan who lives paycheck to paycheck. So I encourage people to go to ArizonaTogether.org to use the resources that Local First Arizona is providing so that we can be helpful in getting you through this crisis. I want to again say thank you to Dr. Christ, Director Betlak, and their teams for the hard work that they are doing every day and working harder than they ever have in their life. To every Arizonan, I want to close by saying that I know this has not been easy. Every aspect of our lives has been changed because of COVID-19, and we anticipate that the weeks ahead will continue to be a continual challenge and task, both personally and collectively as a state. But I also know that the people of Arizona are smart, hardworking, and resilient, and I know that they know what it means to persevere and persist. I ask everyone to continue to follow the enhanced physical distancing requirements and guidelines we've put together. They are making a difference for the state of Arizona. These are measures that are recommended by public health, and they can continue to make all the difference for our state. I'm confident that we're going to get through this. I'm certain that when we do get through it, we'll be stronger than we ever have been before. And with that, let's open it up for some questions.
Howie, Dr. Chris, I actually have a question for you. Come on down, as they say. I have put in several records requests, as have some of my colleagues, for information on your modeling. You keep talking about your modeling. Why can't you give us information the way governors of other states have on how many cases of COVID-19 you expect, how many deaths you expect? Why are we hiding that information?
So, Howie, the information that we have is really scratch paper. We're working with the universities to develop the actual modeling, but it changes every single day. So initially it was math that we were doing looking at when we didn't have a lot of data. It was 1 to 2% of the population would projected to be infected. We based then that 6% of that population off of Wuhan would need hospitalization or have severe. That put us between about 48 and 8,400 individuals. The data has gotten much better, but we continue to watch additional data and the modeling, and we use many different sources. So there's not just one source that we're looking at, but the 13,000 cases and the 13,000 additional hospital beds and the 1,500 that we're trying to put together into a document that we can release.
Okay. How many people, I realize it's a scratch paper, you're sitting in a restaurant, no, you're not sitting in a restaurant. We've seen estimates from the federal government that up to 250,000 people will die nationally. What's your best guess for Arizona?
We are trying to keep the deaths down, so I am not going to estimate a guess on how many people could eventually die.
Mark, your question?
Slightly different. I know these guys have got more model questions, but you said something at the end of your presentation that struck me as it related to enhanced location, enhanced mapping of COVID-19. Can you explain that? And is that a response in a way to the lawsuit that Canal County and Representative Townsend have filed to try to get more information about potential hotspots and learning more down to the zip code level of the COVID-19?
We always try to release as much data as we can. In this case, we are looking to develop it either to the PCA, the primary care area level, which is something that we use in public health. They're statistically significant areas of the population, or zip code. We're looking at what's going to give us better data that can be compared with other things. But that will be released on Sunday, but it is not in response to the lawsuit.
I know, just a quick follow-up, I know in Yuma, the judge down there required the health director to give more specific location information as it relates to COVID cases there. Are you looking at making that a 15-county kind of what was decided there, 15 counties?
So we will be working with our local health departments. That was a specific court order that applied to Yuma County, requiring or allowing them to give information that normally we're not allowed to give under state law. So we're reviewing that to see if that's a potential for the rest of the state.
Brandon, let's go back to the modeling and the numbers you presented to us over the last several weeks. So there's a story today that you don't need, the state does not need 5,000 ventilators. We're okay with the 500 we have. Or the 40 we have. And you said it's because there aren't enough in the national stockpile. Mm-hmm. So regarding that, is it because there aren't enough in the national stockpile, or because, as the evidence appears to suggest, we don't need them?
So it's a combination of both, Bram. So initially, when we put in that request, that was before we knew the number of ventilators in the state. We knew what the use of those ventilators was, and before we had better modeling. And then we watched New York put in a request for 30,000 and get 400 ventilators. So as we've been looking, and then our modeling got better with our worst case scenario when we use the data of needing an additional 1,500 ICU beds, which is different than some of the models that you see on the web as well. But with the 1,500, when we saw that we had 1,500 ventilators in Arizona in total, and 400 of them are used on a regular basis, that gave us 1,100 ventilators of that 1,500 we would need to get. So we need to come up with an additional 400 to meet our worst case modeling scenario.
And so 2 weeks ago, you told us we need double the existing 16,000 beds, double the existing, what was it, 1,500 ICUs. The numbers you're giving us today say nothing's changed. The state has not moved closer to achieving that worst case scenario goal. Does that tell us that we're not going to reach this worst case scenario?
So I don't think we've actually said that. So what I said was that I needed 13,000 additional hospital beds. Okay, since then we've gotten the enhanced surveillance, which has told us how many beds and how many patients and what the capacity is. So if we use a 70% capacity of the licensed healthcare beds, that leaves a remainder of the beds that can still be used. We're still looking at alternative care sites, and we're still working with the hospitals to identify additional beds, but we are still aiming for that additional 13,000 beds.
Well, Dennis Max, Howie's statement earlier, can you just explain the English?
All right, guys, we do have President Trump and his task force team stepping out. All right, guys, as you can see, we do have President Trump and his task force team stepping out, so we are going to go to that right here on News Now. If you want to continue to watch Arizona's update, all you have to do is head on over to the Fox 10 Phoenix Facebook page. That's where we're going to continue to stream Arizona's latest on the COVID-19 numbers here across our state.
Well, thank goodness she got a rash today, so it was roseola. It's good my presumptive diagnosis was correct. I don't like to make mistakes with my own grandchildren. Telemedicine. Yeah. It's working.
Probably never going to go back, right?
Never going to go back. We'll just do telemedicine.
Thank you very much. Today we continue to send our love to the great people of New York and New Jersey. We support them fully. We grieve alongside every family who has lost a precious loved one. New Yorkers are tough and strong and brave. New Jerseyites are tough and strong and brave, and they're being hit very hard right now. And for the next week, hopefully not much longer than that, it's going to start to go in the other direction. Our country is being hit hard, but some areas have done so incredibly well. We're so proud of them. They will beat this virus. We're going to beat it with the grit and the heart for which they're known and for which our country is known. And we appreciate everything that everybody is doing. We pray for Prime Minister Boris Johnson. He's become a great friend of ours. He loves this country. He loves his country. But he loves the USA, and he's always been very good to us. Whenever we had difficulty, he was with us, and we appreciate it. So we pray for Prime Minister Boris Johnson. He's going through a lot. As we intensify our military campaign against the virus, I think that it must be brought out that we have to thank the American people for continuing to follow our guidelines on slowing the spread, an expression that more and more people are thinking about. Nobody ever heard of it 2 months ago, and now everybody is talking about slowing the spread, stopping the spread. Even during this painful week, we see glimmers of very, very strong hope, and this will be a very painful week. And next week, at least part of next week, but probably all of it. Look, if one person dies, it's a painful week. And we know that's going to unfortunately happen. This is a monster we're fighting. But signs are that our strategy is totally working. Every American has a role to play in winning this war. And we're going to be winning it. We're going to be winning it powerfully. And we'll be prepared for the next one, should it happen, but hopefully it won't. Our massive airlift operation for critical supplies, it's called Project Airbridge, continued today as 5 massive flights landed in the United States packed with personal protective equipment. And our nation's heroic healthcare workers will be the beneficiaries of that. 27 more flights are scheduled in the near future over the next couple of weeks. The Army Corps of Engineers is constructing facilities that will support more than 15,000 hospital beds to treat patients in need. So they're building now approximately 15,000. They just completed the big one in New York. They just completed and are in the process of continuing in Chicago and many other places. They're incredible. The Army Corps of Engineers, we owe them a lot, what they were able to do in such a short period of time. They'll build these massive facilities, 2,000 beds in 4 days. So it's really something very special. I know I was in the construction industry, and you don't see that happen very often. I want to remind governors and emergency managers that sharing real-time data with us about equipment and their needs is very important. All of their supplies, hospital occupancy is critical. A lot of the occupancy is really getting a little bit lower than anticipated, and that's good. We sort of thought that was going to happen. And we're getting along very well with the governors. This whole situation with respect to talking to us about equipment and equipment needs, giving us a little bit of lead time, so important. All the supplies, we're getting it to everybody like they never thought possible, but we'll ensure that we can rapidly deploy federal assets where and when they're needed, especially on ventilators. We're actually getting some ventilators back. As you know, the state of California was great. They sent some back, which they won't need. and Washington State likewise. And we have some others coming back, so we're using them in areas we need them. We are pressing forward aggressively on the scientific frontier of the medical war. The companies I've spoke to, the 4 leading, I call them the genius companies. They're doing incredibly well with respect to cures and also with respect to a vaccine that's going to protect us, totally protect us. And they have some great potential. It's going to take a little while yet, but they have some great potential, some great early results. And the governor's been working hard, and we are working hard with the governors. There's been great coordination, especially over the last little while. We're giving them a lot of equipment, a lot of ventilators, but a lot of equipment of all types. And I will protect you if your governor fails. If you have a governor that's failing, we're going to protect you. But the governors are working well with us over the last period of time. Today, in our stockpile of ventilators, and again, we need the stockpile so we can immediately move them from place to place wherever the monster hits. It's a monster. We have 8,675 ventilators right now in stock, ready to move. And we have all sorts of incredible soldiers. Our military is going to move them should they be needed. In, as an example, if we need additional in New York or the New York City area, you have state, you have city, and spoke to Mayor de Blasio, and we really have a great, well-coordinated campaign with Mayor de Blasio. It's been really good. Spoke to Governor Cuomo. There's been great coordination. So if they need something, we have it. If Louisiana needs something, we have it. Same thing with Michigan, same thing with Illinois. There are certain spots that are very hot, and we'll see what happens, but we'll know pretty much we'll have time, and we'll be able to move it. In addition to the 8,675 ventilators, we have 2,200 arriving on April 13th. We have 5,500 arriving on May 4th. These are ones that we're building for the most part. And we have, as you know, great companies building them. Ford, General Motors, GE. We have really some great companies that are doing it. On May 18th, we have 12,000. On June 1st, we have 20,000. On June 29th, we have 60,000 ventilators coming, 60. So we have a total of 110,000 ventilators coming over a short period of time. I don't think we'll need them. Hopefully we won't need them. I don't think we'll need anywhere near them. But we'll have them for the future, and we'll also be able to help other countries who are desperate for ventilators. The UK called today, and they wanted to know would it be possible to get 200, and we're going to work it out. We got to work it out. They've been great partners, United Kingdom, and we're going to work it out for them. So they wanted 200. They needed them desperately. We now have 10 drugs in active trials, with 15 more soon to follow, as well as 2 vaccine candidates in active clinical trials. We'll do whatever it takes to secure needed medical supplies and bring more production of essential medicines back to our shores. We're doing that. We're bringing them back to our shores. A lot of these companies, they went a little bit haywire. They went away from this great country, and they had them produced elsewhere. So we're going to start bringing them back. And I've been talking about that for a long time, not only with medical, but lots of other things. America continues to perform more tests than any other nation in the world, and I think that's probably why we have more cases. Because when you look at some of these very large countries, I know for a fact that they have far more cases than we do, but they don't report them. We've performed 1.87 million tests to date, so that's 1,870,000 tests. Think of that, 1,870,000 tests to date. And now we're performing them at a level that nobody's ever seen before. As we announced yesterday, CVS testing sites in Georgia and Rhode Island will be using Abbott Labs' rapid 5-minute test. We're down to now 5 minutes. It's a 5-minute test so that people can get their results back very quickly. And we're actively engaging on the problem of increased impacts. This is a real problem. and it's showing up very strongly in our data on the African American community. And we're doing everything in our power to address this challenge. It's a tremendous challenge. It's terrible. And provide support to African American citizens of this country who are going through a lot, but it's been disproportional. They're getting hit very, very hard. In fact, while we have Tony here, I'd like to maybe have you come up and address that one, and then I'll continue. But if you could address that, it would be great, Tony, please.
Yeah, thank you, Mr. President. We have a particularly difficult problem of an exacerbation of a health disparity. We've known literally forever that diseases like diabetes, hypertension, obesity, and asthma are disproportionately afflicting the minority populations, particularly the African Americans. Unfortunately, when you look at the predisposing conditions that lead to a bad outcome with coronavirus, the things that get people into ICUs that require intubation and often lead to death, they are just those very comorbidities that are unfortunately disproportionately prevalent in the African American population. So we're very concerned about that. It's very sad. It's nothing we can do about it right now except to try and give them the best possible care to avoid those complications. Thank you, Mr. President.
Thank you very much. And Tony, I think you're going to have some pretty accurate numbers over the next few days, right? But they are they're very nasty numbers, terrible numbers. In total, 1,200 Abbott machines, Abbott laboratories have been fantastic, have been shipped now nationwide. Up to 500 more are being produced every week, and 50,000 testing cartridges are being manufactured per day. That means a lot of very fast tests. No nation in the world has developed a more diverse and robust testing capacity than the United States. We're dealing with other nations, helping them out because the testing is very tough for them. And our tests are very accurate. A lot of tests are out there, and they're not accurate at all. In fact, some of the tests, you don't have a clue what's going on. So we're working with other nations trying to get them help also. At a time when many Americans are experiencing increased stress, anxiety, and personal loss, we must also ensure that our country can meet the mental health needs of those struggling in this crisis. There are people struggling. They're struggling. And some people are getting to know each other, frankly. Some families are getting to know each other on a positive note, but there are a lot of people struggling. On Thursday, I'll be speaking to leaders and advocates from the mental health organizations all across our country. And we are going to be talking about resources and tools that we'll make available to them. They need help. And it's a big problem. When you take something where it was the most successful country in the world, still is, the whole world is shut down. Think of it, we're down to numbers that are incredible. As I said yesterday, I think it's 182 countries right now. 182 countries are under attack by the scourge, by this virus. But as we wage medical war on the virus, we're also speeding economic relief to our people. It's incredible. We just had a meeting that was absolutely incredible with the banks. I spoke with leaders in the banking and finance industry about our efforts to help American workers and employers. As of today, small business has processed more than $70 billion in guaranteed loans and will provide much-needed relief for nearly 250,000 businesses already. So we are going to be providing tremendous amounts of money to the small businesses of our country who have been absolutely clobbered. And they'll be keeping open, and they'll be paying their employees, and they'll be all set to go. We're going to have a rocket upward. I want to thank David Solomon, CEO of Goldman Sachs, Brian Moynihan, CEO of Bank of America, Gordon Smith, co-president, COO of J.P. Morgan Chase, Charles Scharf, CEO of Wells Fargo, Michael Corbett, CEO of Citigroup, Al Kelly, CEO of Visa, Michael Miebach, CEO of MasterCard, Noah Wilcox, CEO, Chairman of Grand Rapids State Bank, and we had numerous others also on the call, and I just appreciate them. We're way ahead of schedule, by the way. We're way ahead of schedule. The Paycheck Protection Program has been incredible. So based on the incredible success of the program, I'm announcing that I'll be asking Congress to provide an additional $250 billion for the Paycheck Protection, which will help keep Americans employed to facilitate a quick and full recovery. We're doing very well. We're looking very bipartisan. A lot of people want to do it, and the plan is amazing. You know, they're processing hundreds of thousands of loans, and this is the big banks that are doing it, the community banks. But the biggest banks right now in our country are doing it, and they're doing it for a lot of reasons. One of them is they want to help people. The WHO, that's the World Health Organization, receives vast amounts of money from the United States, and we pay for a majority, a biggest portion of their money. And they actually criticized and disagreed with my travel ban at the time I did it, and they were wrong. They've been wrong about a lot of things, and they had a lot of information early, and they didn't want to. They seem to be very China-centric, and we have to look into that. So we're going to look into it. We give a majority of the money that they get, and it's much more than the 58 million is a small portion of what they've gotten over the years. Sometimes they get much more than that. Sometimes it's for programs that they're doing, and it's much bigger numbers. And if the programs are good, that's great as far as we're concerned. But we want to look into it. World Health Organization, because they really are. They called it wrong. They called it wrong. They missed the call. They could have called it months earlier. They would have known, and. They should have known, and they probably did know. So we'll be looking into that very carefully, and we're going to put a hold on money spent to the WHO. We're going to put a very powerful hold on it, and we're going to see. It's a great thing if it works, but when they call every shot wrong, that's no good. We're in the midst of a great national struggle, one that requires the shared sacrifice of all Americans. In recent weeks, it's been remarkable to see so many companies and organizations and individuals like the banks that I just told you about, biggest banks in the world. They stepped up to help small business. They're big business, small business. The small business will someday be the big business. But the small business is 50% of our economic strength. People don't realize when you add them up, but they just rose to the occasion. Everybody's rising to the occasion. It's been incredible to watch. To honor and celebrate the extraordinary examples of patriotism and citizenship I'm asking Americans to use the hashtag America Works Together when sharing stories of how we're all working together, getting through this ordeal in a fashion that nobody would have ever thought possible. It's been incredible, and that's why the numbers are so far much better. We want to keep it that way. If you look at the original projections, if we did nothing, it would be disastrous. If we decided to do something, we closed it down, had no choice. It was a good move. That was a good move. The early China move was a good move. The early Europe move was a good move. Made a lot of good moves, but closing it down was a big statement. It was a big, important thing. But we're looking to have far fewer deaths than originally thought, and I think we're heading in that direction, but it's too early to talk about it. I don't even want to talk about it now because we just want to work, and I think that people are doing an incredible job. The doctors, the nurses, the firefighters, the police, all medical people, what they're doing, the bravery that they're displaying is just incredible. Every citizen should take immense pride in the selflessness and all of the courage and compassion of our people, the workers, the people that are working, and construction workers going into hospitals, knowing nothing about this problem other than it's dangerous, and they go in there to rebuild sections of hospitals, and you have people in really big trouble right next door. They know nothing about it. All they know is they're going to get it done. They're going to fix that wing so they can have more people in there. It's incredible. But this is a national spirit that won our independence and settled the frontier and explored the horizons of space, and that's what we're doing. I mean, this is all new territory. It unlocked the miracles of science, and we're doing that. I wish you could have heard the calls I had yesterday with these great companies that come up with cures to diseases, and the success they've had over the last 15 years is really amazing. So I just want to thank all of them. They're working very hard. They're working with UK right now, and the UK doctors hopefully helping with their great prime minister. But these people are really tremendous signs of success are staring us right in the face. I think we're going to have something that's going to be great in terms of vaccines and in terms of everything else that they're doing. Just really helping us, helping the people of our country, and helping ultimately the people of the world. So I want to thank you all for being here. I will take some questions, and then I'm going to give it over to the Vice President, and they're going to go into great detail onto what we're doing and all of the successful supplies and medical equipment that we're getting. All of the ventilators, I've said it, but you can go over it in more detail if you'd like, but we're taking in and building thousands and thousands of ventilators, and they're very high quality. I said, you got to go for the quality, and these are quality companies doing it. So, because there is a big difference between a good ventilator and a not so good ventilator, Tony, right? We've seen that. And big difference. So we're going top of the line. Steve, please.
The acting Navy Secretary submitted his resignation today, Motley. Why did that become necessary, and what role did you have in this, sir?
Well, I had no role in it. I've heard, I don't know him, but I've heard he was a very good man. And the whole thing was a very unfortunate. The captain should not have written a letter. He didn't have to be Ernest Hemingway. He made a mistake, but he had a bad day. And I hate seeing bad things happen. Man made a mistake. But, you shouldn't be writing letters, and you're in the military. You're the captain of a great ship, and you shouldn't be writing letters and sending them to many people. And then it gets out to the media. And, the question is, how did it get out to the media? So there's a lot of bad things happened there. And I had heard he did because he didn't want to cause any disturbance for our country. So that was because he wouldn't have had to resign. I would not have asked him. I don't know him. I didn't speak to him. But he did that, I think, just to end that problem. And I think in really many ways that was a very unselfish thing for him to do.
What should happen now to Commander Crozier, who left?
Well, they're going to look at that. I think Secretary of Defense, as you know, is Mark Esper, and he's very capable. And I think he's looking at that right now. They're going to just take it under regular Navy channels to see what they want to do. But he made a mistake, but he shouldn't have done that. And your secretary probably shouldn't have said quite what he said. He didn't have to resign, but he felt it would be better for the country. So I think it will end it quickly. Yeah,
Mr. President, a couple on the economic front. The $250 billion that was added today, or will be added for the small business loan program, brings it to $600 billion in total. Do you think that figure is enough? Might there need to be more down the line?
When you see hundreds of thousands of applications, don't forget they're for $3,000, for $7,000, some for a couple of million. I guess one of the banks said a couple of million. So they're for different, very varying amounts of money. And there's a limit on the top, and then there's really no limit on the bottom as to what it might be. But it's really popular. It's hundreds of thousands of applications. They really like it. What I like is it keeps these companies together, these little companies. Just like we're going to help the airlines and the big companies, we're going to help the little companies. And the banks are running. Nobody's equipped to do a thing like that, but the banks are equipped. So the banks are doing it, big banks, small banks. We have many banks, community banks. And they're processing the loans, and they'll be able to watch it and make sure it's done properly.
Talk today, sir, as well about potentially reopening the economy in the upcoming weeks. You mentioned the other day about a potential economic task force. Can you give us some sort of update as to where
we're thinking about that, but we want to open up, and we want to get it open soon. That's why I think maybe we're getting to the very top of the curve. I spoke with Governor Cuomo, and he seems to think that he's getting close, and I think a lot of people think that a lot of places are getting close. We want to start hitting the downside, and I think we're going to be doing. This is going to be a very difficult week, however. This week will be a very difficult week because that's the most difficult week when you're at that top position, and we'll see what happens. We'll see what happens.
It does open up. What can the federal government do?
Well, the federal government has done a lot, and it's going to do a lot. We want to. I really think that with the stimulus, we can be maybe even beyond. We're going to do perhaps infrastructure, which you wouldn't have gotten approved before, and now people are looking to do it. And the beauty is we're paying zero interest, or very close to zero interest. In some cases, we're paying actually zero, have no interest charge. And the dollar is very strong, and people are investing in the dollar. They want, the fact that we have the strong currency. We have the currency. Our currency is everything. And other companies, other countries want to be in our currency. So we're getting all of the investment wanting to come into the dollar. The dollar is the strength. The dollar is the whole ballgame. We have a strong dollar. Other currencies are going down, way, way down in some cases. You look at other countries, I won't mention them, but other countries are going down 22%, 25%, 28%, and it's very hard for them. That makes it much more difficult. With us, our currency is relatively now stronger than it ever was, or it was over the last few years relative to other countries. It's always relative to other countries, but our currency is very strong. So therefore, people want to invest. If we do a bond issue to do infrastructure, everybody wants a piece of that issue, even at zero interest. Yeah, please.
Thank you, sir. Did you see these memos that reportedly Peter Navarro wrote back in January? When did you see them, and how does these memos sort of square with what you've often said that nobody could have predicted this? It sounds like he was predicting it.
I didn't see him, but I heard he wrote some memos talking about pandemic. I didn't see him. I didn't look for him either. But that was about the same time as I felt that we should do it. That was about the same time that I closed it down. I asked him about it just a little while ago because I read something about a memo. I said, "Did you do a memo?" I didn't see it. I didn't ask him to show it to me. He said, "Yes, I talked about the possibility of a pandemic." Nobody said it's going to happen, but there is a possibility. There always has been a possibility, but people wouldn't talk about it. But it was right about the time that I closed it down. And interestingly, the World Health Organization was not in favor of us closing it down. And if we didn't close it down, we would have lost hundreds of thousands more lives. So we did a good thing. Yeah.
So at the time, though, when Peter Navarro did circulate those memos, you were still downplaying the threat of coronavirus in the U.S. You were saying things like, "I think it's a problem that's going to go away within a couple of days."
It will go away.
You said within a couple of days the cases will be down to zero.
Well, the cases really didn't build up for a while, but you have to understand, I'm a cheerleader for this country. I don't want to create havoc and shock and everything else, but ultimately, when I was saying that, I'm also closing it down. I obviously was concerned about it because I closed down our country to China, which was heavily infected. I then closed it down to Europe. That's a big move, closing it down from China and then closing it down from Europe and then ultimately closing it down to the UK. So, and it was right about that time. But I'm not going to go out and start screaming, this could happen, this could happen. So, again, as president, I think a president has to be a cheerleader for their country. But at the same time I'm cheerleading, I'm also closing down a very highly infected place, specifically the location, as you know, in China that had the problems. And we're closing it down, but we close it down to all of China, then we close it down to all of Europe. Those were big moves, and it was right about that time.
Sorry, sir, just a quick follow-up, Mr. President.
Did you just learn about this today?
Say it?
You learned about the memo today?
I read about it maybe a day ago, 2 days ago.
Do you feel like someone among your staff or Peter Navarro himself should have told you about the memo earlier?
No, it was a recommendation. It was a feeling that he had. I think he told certain people in the staff, but it didn't matter. I didn't see it. But I did. I closed it down. I don't remember it even being discussed. We had a meeting where there were a lot of people. Most people felt they should not close it down, that we shouldn't close down to China. But I felt we had to do it. And that was at almost the exact same time as the memo.
If you had read the memo at the time, how would that have changed the steps you took or the
I
statements
don't think it
that
would have
you made?
changed because I did. I basically did what the memo said, and the memo was, you know, the memo was pretty good memo from the standpoint that he took, I guess. I didn't see it yet.
He was saying that the U.S. would, warning that the U.S. could lose trillions of dollars and millions of lives.
Well, you're not going to lose millions of lives, but you'll lose plenty of money. But I couldn't have done it any better because it was about the same time, and I closed it down to China.
And just lastly, so you maintain confidence in him, in Peter Navarro?
Of course I maintain confidence. He wrote a memo, and he was right. And I haven't seen the memo. I'll see it later on after this. But it didn't matter whether I saw it or not because I acted on my own. I guess I had the same instincts as Peter. Peter's a smart guy, and he's a good guy, and he's done a wonderful job. But he wrote a memo, and I guess he talked to various people about it. But ultimately, I did what the memo, more or less what the memo said just about the time the memo came out. I closed it down. I took a lot of heat. The World Health Organization was very much against. They didn't like it. They actually put out statements about it. In all fairness to Joe Biden, he called me xenophobic. Like, I don't like China. I like China. I like the Chinese people are phenomenal people. So I was called xenophobic. I was called racist. How could I do a thing like this? Now, since then, Joe said that he was wrong, and he said that I was right. But I closed it down, and I was called names by some of the morning show hosts who don't have a clue what they're talking about. They're not smart people. And I was called all sorts of names when I closed it down to China. Now they try and hide that, the tape of them saying terrible things. But that was a great decision. If I didn't do it, if I didn't do that, we would have had hundreds of thousands more people dying. Yeah, please.
You talked a lot about the WHO, and I was wondering, Dr. Fauci had discussed them earlier, so if I could ask you a question about...
Well, he respects the WHO, and I think that's good, and he's worked with them for a long time. But they did give us some pretty bad play calling.
They've also, I think, given lots of countries in the world accurate coronavirus testing that's been central to your guys' data modeling. And so
that I don't know. I can only say that with regard to us, they're taking a lot of heat because they didn't want the borders closed. They called it wrong. They really called, I would say, every aspect of it wrong.
So
until
the funding freeze
I'm not happy about it. Look, we fund it. Take a look. I mean, go through step by step. They said there's no big deal, there's no big problem, there's no nothing. And then ultimately, when I closed it down, they actually said that I made a mistake in closing it down, and it turned out to be right. But at the time, they did that. So we're just going to take a look at it. We fund it, and they seem to be, I said recently in social media, I said they seem to be very China-centric. That's a nice way of saying it, but they seem to be very China-centric. And they seem to err always on the side of China, and we fund it. So I want to look into it. Yes, please.
Thanks. A quick follow-up on that. So is the time to freeze funding to the WHO during a pandemic?
No, maybe not. I mean, I'm not saying I'm going to do it, but we're going to look at it.
You did say that.
We give a tremendous... No, I didn't. I said we're going to look at it. We're going to investigate it. We're going to look at it. But we will look at ending funding. Yeah, because you know what? They called it wrong. And if you look back over the years even, they're very much... everything seems to be very biased toward China. That's not right.
I wanted to follow up. You talked about African Americans and how they've been disproportionately affected by the coronavirus.
Seems to be, unfortunately.
Do you plan on requiring the CDC, any federal agencies or state agents, public places doing tests, and private companies doing tests to collect that data on the race of the people being tested and the race of the people being treated and the outcomes?
Well, we're just seeing tremendous evidence that African Americans are affected at a far greater percentage number than other citizens of our country, because we're dealing with our country. Now we're looking at it from a worldwide standpoint. Tony Fauci is looking at it very strongly, but these numbers have started to come out, and they're very strong, and they're pretty obvious. I mean, you're talking about...
You will release that
Would you like to talk about that for a second, please?
I think one of the things that we're going to be doing with our Medicare data is to do that analysis. We're going to look back at the last month or so and look at, related type illnesses going forward. We now have a code for coronavirus, so we can actually stratify by demographic information, so we can look at race as a factor. We can also look at what the underlying health issues are as well. So we'll be providing that data very shortly. But we will be doing that analysis.
We're working on that very hard. This is something that's come up over the last, I hadn't heard this, and then over the last few days, this has come up more and more. And I don't mean by a little bit. I mean many times. It's a real thing. Now, we want to find cures. We want to find therapeutics. We want to find vaccines, because that will solve everybody's problem. But why is it that the African American community is so much, numerous times more than everybody else, and we want to find the reason to it. And Dr. Fauci, Seema, both of them, and others are working on this, and they're going to have very good, I would say over the next, in less than a week, I think you're going to have very good statistics. Couple of days.
Something specifically aimed at those communities that are being hard hit, those black communities.
Well, we're helping them a lot. But what's happening is we're trying to find out why is it that it's 3 and 4 times. Now, maybe that's not going to be the final number, but why is it 3 or 4 times more so for the black community as opposed to other people? It doesn't make sense, and I don't like it. And we're going to have statistics over the next probably 2 to 3 days, okay?
Mr. President.
Thank you. I'd like to ask a question on behalf of myself and a colleague who couldn't be here due to social distancing. Sure. Thank you.
Who are you with? Who?
With Hearst Newspapers. I'm the print cooler today. Thank you. Some banks are only providing Paycheck Protection Program loans to clients with whom they have existing banking relationships. And you spoke to banking CEOs today. I wonder if you'll ask them, these lenders, to accept applications from all small businesses, sure, not just the businesses with whom they have existing
relationships. Okay, they'll be doing that. But we're also working with small community banks, so they will be doing that. It's a question I've already spoken about. I mean, in many cases, they have long-term relationships with thousands of companies. I was amazed to see how many, you saw the number of applications. It's hundreds of thousands. It's a lot of work. But I did ask that question, and they are working on that. Yeah.
Thank you. And my second question from a colleague is Congressman Jerry Connolly, a Democrat from Northern Virginia, told the local D.C. CBS station that you personally requested the CARES Act stimulus bill be stripped of $25 billion for the Postal Service. Connolly claims that unless the USPS gets that $25 billion, the agency will be run out of money by June. He accuses you of hastening the demise of the Postal Service. Could you respond to that, please?
I'm the reason the Postal Service has lost billions of dollars every year for many, many years. I'm the demise. This is the new one. I'm now the demise of the Postal Service. I'll tell you who's the demise of the Postal Service are these internet companies that give their stuff to the Postal Service, packages, and I don't know why they're not, I don't run the Postal Service. You have a group of people, so-called independent people, and they run it. But these packages are, they lose money every time they deliver a package for Amazon or these other internet companies, these other companies that deliver. They drop everything in the post office. They say, you deliver it. And if they'd raise the prices by actually a lot, then you'd find out that the post office could make money or break even. But they don't do that, and I'm trying to figure out why. These are independent boards. They were appointed by other administrations. They're sort of long-term. They're there for a long time. And I've been talking to them also. You can look it up. Take a look. They have to raise the prices to these companies that walk in and drop thousands of packages on the floor of the post office and say, deliver it. And they make money, but the post office gets killed. Okay? So they ought to do that, and we're looking into it, and we've been pushing them now for over a year. And you know that because you've seen the stories. I'm pushing them. It's not fair for them to these great, wonderful modern companies. They walk into our old post office with all these routes that could never be built. You could never build them. They go into areas that you could never do. And they say, here, deliver this. And they lose a lot of money per package. And they have to raise their prices, but this Postal Commission doesn't do it. Now, we just got a chance to appoint a couple of people onto the commission, as I understand it, and that's good. But they have to raise their prices, otherwise they're just going to lose a lot of money. And tell your Democrat friend that he ought to focus on that, because if he focused on that, he could truly save the post office. Post office has been losing billions of dollars a year for many, many years. And have him take a look at that, because that's the way to solve the problem.
Thank you so much, Mr. President. Thank you so much. Mr. President, you say this week will be very painful, very difficult, but a few weeks ago you say this was just like a flu. What have you learned?
I didn't say 2 weeks ago it was a flu.
The question is, Mr. President, what have you learned that you could offer as an advice to foreign leaders who still are skeptical about this pandemic and who are against social distancing? What is your advice? What have you learned?
I said it was just like a flu. So the worst pandemic we ever had in this world was a flu, and it was called, you know that, it was in 1917, 1918. And anywhere from 50 to 100 million people died. That was a flu, okay? So you could say that I said it was a flu, or you could say the flu is nothing to sneeze at.
President, what can you offer as an advice to foreign leaders who are skeptical about this pandemic and who are against social distancing?
Well, I think there aren't too many of them. If you look throughout the world, and everyone, just about everyone that has practiced that is now closing up. Well, the UK was an example. Now, they talk about Sweden, but Sweden is suffering very gravely. You know that, right? Sweden did that. The herd, they call it the herd. Sweden's suffering very, very badly. It's a way of doing it, but everybody has been watching everybody else. And so far, almost every country has done it the way we've done it. We've chosen to do it. If we didn't do it that way, we would have lost hundreds of thousands of more people. Okay.
Mr. President, there's voting going on today in Wisconsin. There are reports of thousands of people waiting in hours-long lines as they've had to weigh their own personal health and their civic responsibility. Do you think that the Supreme Court was right in its decision that voting should go forward, and the absentee extension should not take place?
Yeah. Look, the Supreme Court, of course they were right, because what the Democrats wanted, and you know what this happened. I supported a man named Justice Kelly, who's Daniel Kelly, highly respected justice. And I supported him just the other day, social media. I know of him. He's just a fantastic justice. And I endorsed him. And as soon as I endorsed him, they wanted to move the election. They didn't want to move the election. As soon as I endorsed him, the Wisconsin Democrats say, oh, let's move the election to 2 months later. They didn't mind having the election until I endorsed him, which is very interesting. And now they talk about, oh, safety, safety. Well, it was 15 minutes after I put out an endorsement that they said we have to move the election. They didn't want to move the election before that. The other thing they wanted to do, which is crazy, at the end of the election, they wanted to have 1 week for proxies to come in, or mail ballots. Now, mail ballots, they cheat, okay? People cheat. Mail ballots are a very dangerous thing for this country because they're cheaters. They go and collect them. They're fraudulent in many cases. You got to vote. And they should have voter ID, by the way. You want to really do it right. You have voter ID. But the Democrats, and this was turned over in the Supreme Court yesterday, I give great credit to the court, they actually didn't want to have an election day. They wanted to have election day, and then a week after election day, you choose all these ballots come in, these mailed ballots come in. The mailed ballots are corrupt, in my opinion, and they collect them, and they get people to go in and sign them, and then they're forgeries in many cases. It's a horrible thing. And so what happened is the Democrats in Wisconsin, they had no problem with the election being today until I endorsed the Republican candidate, Justice Kelly, Daniel Kelly. And as soon as I endorsed him, they went crazy. They went crazy. And you know that's true. And now all of a sudden, because go back 2 weeks, go back 2 days. They didn't want to move the election. They were having the election. They were fine because they thought they were going to win the election. Then I endorsed him, and all of a sudden they think they're not. Now I understand there are lines that go back a long way. I hope they're going to vote for Justice Kelly. Okay.
Mr. President, do you think that Americans should with millions of pills of hydroxychloroquine donated, is there a plan or system in place to track the potential side effects?
Well, you saw
there
the
hasn't
representative.
been serious harm, so is there a plan
Look,
to
is there a
track
plan?
the side effects?
The side effects. The side effects are the least of it. You have people dying all over the place, and generally the side effects are really with the Z-Pak, having to do with the heart. The Z-Pak, that's the antibiotic, not with the hydroxychloroquine. So. A woman last night, I watched her on one of the shows, good show, Laura, and she was, she thought she was dead. She was a representative from Michigan. She was just in horrible shape for 12 days, 14 days. She thought she was dead. I think she said that her doctor said she's, it's going to be very tough. She saw me talking about this, and she asked her husband to go to the drugstore. Now, this is a Democrat representative, a person that, perhaps wouldn't be voting for me. I think she'll be voting for me now, even if she's a Democrat, even if she's a Democrat representative. And they went to the store, which I made available because we have millions of doses. We have, I think, 29 million doses of this drug. And she asked her husband, she said, please go out. I'm not going to make it. Please, you have to hear her story. Please go out, get it. He went at 10 o'clock in the evening to the drugstore. He got it. He gave it to her. Now, it's I don't say it works like this at all. 4 hours later, she awoke, and she said, I feel better. And then shortly thereafter, she felt great. This is a woman that thought she was going to die. She's a Democrat representative, highly respected woman, African-American woman. I don't know if you saw it, as you asked a question about African-American. She was an African-American woman, a great woman. Her manner of speaking, the way she told the story was beautiful. I asked my husband to go and get it. He got it. She is now okay. She was interviewed last night on television. And she thanked me. She thanked me even in a tweet. She said, I want to thank President Trump. He saved my life. Look, I don't say that happens with everybody, but that's a beautiful story. There are many of those stories. And I say, try it. Okay, please. If you're in trouble, if you're going to die, and you're going to die, you're not going to die from this pill. Now, there could be some side effects, but the side effects is really more so from the Z-Pak.
Those side effects?
No. Doctors have to recommend it. I want doctors. I'm not a doctor. I'm just saying we hear great results. And some people say, let's go to a laboratory, let's test it for a couple of years. And we got people dying in this country and all over the world right now, not in a couple of years. They're dying. As we speak, there are people dying. And I really think it's a great thing to try, just based on what I know. Again, I'm not a doctor. And I say, get a physician's approval. And they have physicians in these hospitals, great physicians, brave physicians. They also say it's good for the hospital workers to take them, that it's keeps it away, keeps it out of your system. I don't know. But there's a lot of good examples. And, we have a 1,500 case study going in New York, and it's almost complete. So it'll be very interesting to see what happens. Go ahead.
Thank you, sir.
I appreciate that woman. She was great. You have to see it to believe it. The way she spoke, it was like a miracle. And this was not a fan of mine, but she's a fan of mine now, and I'm very honored by it. Go ahead.
Thank you, sir. Can you talk about your decision to remove Glenn Fine from the Pandemic Response Accountability Committee? And does that move and some of the criticism you've leveled at IGs, how does the American public have confidence that there'll be oversight?
Well, we have a lot of IGs in from the Obama era, and as you know, it's a presidential decision. And I left them largely. Changed some, but I left them. But when we have, reports of bias, and when we have different things coming in, I don't know Fine. I don't think I ever met Fine. I heard the name.
It wasn't an Obama.
I heard the name. I don't know where he is. Maybe he was from Clinton. Okay, you check that out. Okay, maybe he's from Clinton. But we did change him. But we changed a number. We have about 7 nominations in, I believe. We put 7 very, very highly qualified people for the IG position. And, that's a decision that I could have made 3 years ago, and I could have made 2 years ago. And but we're putting in, not so much for him, we're putting in 7 names. I think it was 7 and they're going in now. Yeah.
Mr. President, when you talk about the WHO being China-centric, what exactly are you talking about? Is it because China is underplayed how many
I
victims
don't know. They
had?
seem to come down on the side of China. Don't close your borders to China. Don't do this. They don't report what's really going on. They didn't see it, and yet they were there. They didn't see what was going on in Wuhan. They didn't see it. How do you not see it? They didn't see it. They didn't report it. If they did see it, they must have seen it, but they didn't report it. Please, go ahead.
Mr. President, just turning back to the voting in Wisconsin and those long lines, who will be responsible and who should be held responsible if people get sick after they voted?
Look, all I did was endorse a candidate. I don't know anything about their lines. I don't know anything about their voting. I love the state.
But you also encourage people to get out and vote today as well. Will you take some of the responsibility if some of those people
I won the
get sick?
state, which is rare for a Republican to do, but I won the state of Wisconsin. I'm going to win it again because we've been great to the people of Wisconsin, as you know, with our policies, and they like me and I like them. But all I did was endorse a candidate that's highly qualified, very respected person, and all hell broke loose as soon as I did that. And then all of a sudden they want to change. Before I endorsed them, they didn't want to change this voting area. There was no problem with the Democrats voting until I endorsed the candidate. Then they said, let's move it 2 months. Let's move it 3 months later. Safety, 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 right? All of a sudden they want safety. Well, before I did the endorsement, they didn't talk about safety. It was fine for months. For months, it was fine. It was always going to be. And now I endorse, and they want safety. So, you know, that sounds...
Thank you. Just to follow up on that, how does the election, them holding this election in Wisconsin line up with the social distancing recommendations that have come from your administration?
There you have to ask the people that you have a Democrat in Wisconsin as governor. Ask him. That's his problem. Okay, he should be doing it. Again, some governors fail, and I won't let them fail because when they fail, I'll help. But that's run by Democrats right now. Okay? It's run by Democrats. You had a great Republican.
Is it possible to socially distance when you're voting? You're going to have crowds.
You have to speak to the governor. What you should do is call the governor of Wisconsin and ask him that question. But also ask him, how come it was okay to do this until I endorsed the candidate? And as soon as I endorsed him, these lines are formed, and I hear, Mike, the lines are through the roof. So, you know, hopefully they're going to vote for the right candidate. Yeah, please.
Can I just check in on oil again today? I was wondering.
Oil?
Yeah.
Where is it today?
Well, I was wondering if you.
No, where's the price? Give me the price.
I'm not sure, to be honest.
How can you ask a question when you don't know the price?
I'll look it up for you.
Okay, let me do somebody else then. Go ahead.
So you were highly critical of mail-in voting, mail-in ballots for voting.
I think mail-in voting is horrible.
But you voted by
It's
mail
corrupt.
in Florida's election last month, didn't you?
Sure, I could vote by mail for that.
How do you reconcile
Because I'm
that?
allowed to. Well, that's called out of state. You know why I voted? Because I happen to be in the White House, and I won't be able to go to Florida to vote.
the difference between mailing within
well, there's a
state or
big
mailing
difference
outside
between
state?
somebody that's out of state and does a ballot and everything sealed, certified, and everything else. You see what you have to do with the certifications, and you get thousands and thousands of people sitting in somebody's living room signing ballots all over the place. No, I think that mail-in voting is a terrible thing. I think if you vote, you should go. And even the concept of early voting is not the greatest because a lot of things happen. But it's okay. But you should go and you should vote. I think you should go and you should vote. You look at what they do, where they grab thousands of mail-in ballots and they dump it. I'll tell you what, and I don't have to tell you, you can look at the statistics. There's a lot of dishonesty going along with mail-in voting, mail-in ballots.
You've encouraged state officials to buy their own medical equipment. The federal officials are kind of swooping in and scooping up those orders. How are you ensuring that it's being distributed fairly? And is
well, we're getting great prices on equipment. We're getting great prices on equipment, and we're helping the states. And the governors are very thankful. Mike Pence had a call yesterday with every governor was on the call, and it was like a love fest. They're very happy. I don't know if they tell that to the press. Some of them don't. Some of them will never say good to the press, but they know we've done a great job. Not a good job, a great job.
Are you saying it's not happening? Because state officials are widely saying
No, I think sometimes it does. And what we say is, let us know, and we will immediately drop out of the bidding. Let us know, and we do that, and we drop out. Sometimes we tell them to drop out because we've got a good price. And then we'll deliver it to them.
How do you charge them?
Yeah, go ahead, behind, please. Go ahead.
Thank you, Mr. President.
No, not you. In front, please.
Some states have had trouble with getting accurate death counts, particularly because of lack of testing or no uniform.
Did you see death counts?
Yes, because of lack of testing and no uniform system to put that into.
When you say death counts, I think they're pretty accurate on the death count. Somebody dies, I think the states have been pretty accurate.
But if there's no testing.
That's a big deal, what you're just saying. No, the death counts, I think they're very, very accurate. I do say this, I think if you look at China and if you look at some of these very large countries, when you talk about cases, number of cases, I would be willing to bet they have more cases than we do, but they don't do the testing like we do. But you look at, you look at some of these certain countries, and I would be willing to bet a lot that they have more cases. But we're more accurate, and our testing is done very accurately, and we've got a good process. Did you have one? Yes, please.
Mr. President, you have been very consistently supportive of a payroll relief tax.
What payroll?
Payroll relief. Now, I know you're still busy trying to implement phase 3, but as we move towards phase 4, are there still obstacles to that? Because that would put money in American pockets, like consistently.
Yeah, you're right. I would love to see a payroll, good questions. I would love to see a payroll tax cut. And I think on behalf of the people, it would be quick. Now, it's a longer term, it's a longer time because it's over a period of a year or whatever you want to make it. But I would love to see a payroll tax cut. There are many people that would like to see it as a permanent tax cut, payroll tax cut.
What is stopping it from?
Well, the Democrats right now are stopping it.
What are their reasons?
I don't know. I don't know. Maybe they think it's good politics to stop it. But you'd get a lot of people, a lot of money immediately. The payroll tax cut would be a great thing for this country. I would like to have it regardless of this. But this would be a fantastic time to have the payroll tax cut. The Democrats are stopping it, but I don't think they're. I think there's a certain flexibility. I think it's something that we should do, both for business and the people. But this would get money into the hands of small business immediately, money in the hands of people, the workers and people, immediately, and it would be over an extended period, and it would be simple to do. It's so easy to do. It's a great tax cut, and I'd love you to speak to the Democrats, and let's get it done. So I'm going to give this now to Vice President Pence, and they're going to go over some very good statistics with everybody, and we'll have a couple of answers on that because we're working very hard on the African-American community with respect to what's going on because it's not good. I don't like it. And we're going to have some very good statistics, Tony, I think, over the next couple of days. So thank you all very much. Thank you.
Thank you all. A few updates, and then I'll introduce Dr. Deborah Birx to talk about what we're seeing around the country, what the data is telling us. But suffice it to say, as the President said several times, this is a very tough week in America. And our hearts go out to all of the families that have lost loved ones to the coronavirus. But I know I speak for the entire White House coronavirus task force when I say our hearts are with the people of the greater New York City area today. As we stand here today, in the midst of heartbreaking numbers of losses in New York City, I also want to assure the American people that there's reason for hope. As Dr. Birx will enumerate in just a few moments, despite the increase in losses, as Governor Cuomo articulated today, hospital admissions continue to decline. And in our report early this morning from Dr. Birx, we continue to see evidence of stabilization in some of the areas around the country of the most significant outbreak, the New York metro area, including New Jersey, Long Island, and Connecticut, New Orleans metro area, Detroit, Boston, Chicago, and Denver, as Dr. Birx will explain, continue to give evidence of stabilization, which in a very real sense is evidence that the American people are putting into practice the social distancing, the President's guidelines for our nation. And for that, as the President said earlier today, we thank the American people. Even in the midst of hardship and loss at a time when we've seen more than 385,000 Americans test positive for the coronavirus and more than 12,000 succumb to this illness. The evidence that Dr. Birx will describe to you will show that the American people know our future is in our hands. And so as I begin, allow me just simply to continue to urge every American to put into practice the guidance you're receiving from your state and local authorities. Take it to heart, take it seriously, share it with your family and your friends, and know that you're making a difference, America, because you truly are. Today, for my part, I spoke to over 500 small business owners in a conference call, and there I heard about their enthusiasm for the Paycheck Protection Program. And that call took place before the President had the Secretary of Treasury indicate our interest in acquiring another $250 billion for that program. As of this morning, more than $60 billion in forgivable loans that would cover 2 months of paychecks at small businesses had already been distributed, and the number is going to grow literally by the day. We also had a very productive call today with some other American heroes. You know, we all have in our hearts and in our minds our healthcare workers, and I'll speak for a moment about the supplies and resources that we're working to provide for all of them. But right below our healthcare workers are all the people that are working in critical infrastructure around the country, and some of the most important people are working in food supply. I mean, from the farmers and the ranchers to our processors, to our distributors, to our truckers, to our grocers. Americans are keeping food on the table for our fellow Americans. And let me begin by just saying what I said to some of the most prominent CEOs of meat and grain industry companies in the country, companies like Tyson Foods and Hormel today. Not just these companies, but to all the hardworking people working in food supply today, thank you. Thank you for what you're doing to keep those grocery store shelves stocked. Thank you for showing up for work every day and working hard to keep that food supply rolling in America. You know, it was more than 5 weeks ago that the President brought in all the grocery store leaders in the country, and there he received a commitment that no grocery store in America would close, and they haven't. But it's been these heroic Americans, from the farm to the fork, that have made it possible for Americans to have one less worry, and they are truly inspiring heroes. That being said, I did hear from the industry today that there have been reports of some plants having reduced capacity because of people having concerns about exposure to the coronavirus. In fact, over the last several days, there's been some incidents of worker absenteeism, and some plants have actually been forced to close temporarily. And so on behalf of the President, on behalf of our entire team, and on behalf of a grateful nation, let me just say to all of you that are working in the food industry at every level across the country, just understand that you are vital. You are giving a great service to the people of the United States of America. And we need you to continue as a part of what we call our critical infrastructure to show up and do your job, and know that we're going to continue to work tirelessly in working with all of your companies to make sure that that workplace is safe. With that being said, let me talk about the other heroes that we always mention at this podium today, that Dr. Birx and Dr. Fauci invariably mention, and that's our healthcare workers. At the President's direction, we've been working tirelessly, literally around the clock, to identify resources around the country and around the world to make sure our healthcare workers have the support that they need. With some 51 major disaster declarations, most recently Minnesota, being approved. States have stood up 27,000 National Guard, but Personnel-wise, before the end of business today, there will be more than 3,000 Department of Defense and Health and Human Service medical personnel on the ground in the greater New York City area. And those people will be redeployed once that region of the country moves through the coronavirus epidemic in that area. And we salute those extraordinary patriotic Americans for stepping forward to bring real relief to our healthcare workers. With regard to equipment, Admiral Polovchek reported to the task force throughout the course of the day today that we have continued to distribute ventilators across the country. We're sending additional ventilators from the Strategic National Stockpile. Maryland will receive 50 ventilators. Delaware will receive 50 ventilators. And that will leave more than 8,400 ventilators still in the national stockpile. One correction from yesterday. After our press briefing yesterday, FEMA made a different decision with regard to what the state of California generously made available. And the ventilators, some 500 ventilators that we again want to thank Governor Gavin Newsom and the people of California for donating to our nation's efforts. 100 of those are being deployed to New York, 100 to New Jersey, 100 to Illinois, 50 to Maryland, 50 to Washington, D.C., 50 to Delaware, and 50 to Nevada. With regard to the remainder of what we call personal protective equipment, again, we've been literally leaving no stone unturned anywhere in the country, anywhere around the world. And as Admiral Polovchek described just a couple of days ago, we've established not just an air bridge, but a control tower system modeled after military logistics out of FEMA. And while FEMA is acquiring a small portion of what's being acquired, 90% of the supplies are being routed directly into our massive distribution system. And FEMA is using the data that Dr. Birx provides to target those resources to the areas most in need. I asked them to break out a few details about resources that just in the last 5 days have been distributed, and I hope it's an encouragement to healthcare workers all across these regions and around the country about the efforts that are being made to make sure they have what they need. You can see the New York metro area, including New Jersey, just in the last 5 days, more than 6 million N95 masks, more than 6 million surgical masks. When Governor Cuomo and I last spoke, he told me there was a real challenge for medical gowns in the New York City area and in New Jersey as well, and 2.8 million gowns were distributed to that region as well. Going next to New Orleans, where again, while we see some encouragement, challenges remain in that community. Some 837,000 N95 masks for healthcare workers, 165 surgical masks, other items including almost 6 million gloves have been distributed. Detroit continues to be a real focal point. We're working closely with Governor Gretchen Whitmer as well as Mayor Mike Duggan to meet the needs of healthcare workers in Detroit. Just in the last 5 days, 1.6 million N95 masks have been routed into the healthcare system in Detroit, nearly 700,000 surgical masks, and 24 million gloves, just as a portion of what's displayed. And in the Chicago metro area, which we continue to focus on each and every day, more than 1.7 million N95 masks have been routed into their healthcare system, 900,000 surgical masks, 25 million gloves. I share these details in the hopes that healthcare workers looking on will be encouraged. At the President's direction, we are making every effort to make sure you have the resources you need to do your job, to do it safely, and to go home safe to your family, even while you provide that extraordinary and courageous care that our healthcare workers are providing literally around the clock in the midst of the coronavirus challenge. The last slide is just the cumulative numbers that we have distributed, and I'm happy in a few moments to answer any questions about that. Again, the system that we have in place is one that is essentially infusing our major distribution networks with millions of items And then FEMA is directing on a day-by-day and oftentimes hour-by-hour basis where those resources are most needed. And we'll continue to do that as the coronavirus makes its way through these communities and through communities that are very much on our watch list today. Let me just lastly say that, again, I want to thank the American people for stepping up and doing your part. We continue to be overwhelmed with one story after another where people are doing social distancing, where people are looking after one another, where they're checking in with a phone call to an elderly friend, a family member, to make sure they're okay. I mean, we are on the front end of 30 days to slow the spread. And I will tell you, as a non-scientist up here, that I see glimmers of hope in the early numbers that we're seeing come out of the greater New York City area, New Jersey, even New Orleans and Detroit and Chicago. There does appear to be, as Dr. Birx will explain in more detail, there does appear to be evidence of leveling, evidence of progress. But this is exactly the time for all of us to redouble our efforts to do everything each and every one of us can, not just to protect our own health and that of our family and our loved ones, but to do our part to ensure that we lessen the impact of the coronavirus on America as a whole, but even more importantly, that we lessen the impact on lives by ensuring that we do our part to make sure that no one that is vulnerable is unnecessarily exposed to this virus. With that, let me yield to Dr. Birx and then Seema Verma and Dr. Fauci, and we'll take all your questions.
Thank you, Mr. Vice President. So hopefully you can see from those numbers that we've taken a data-detailed approach, really bringing the power of granular data to the supply chain and moving supplies based on really what you would call burden of disease and need. If I could just start out by not just going to the numbers at the beginning, but really talking to the community of health advocates, to the community that works on the social determinants of disease and the communities of the historic Black colleges and universities. We really need to improve messaging, and I'm asking them to help us increase the messaging around this. We don't want to give the impression that the African American community is more susceptible to the virus. We don't have any data that suggests that. What our data suggest is they're more susceptible to more difficult and severe disease and poorer outcomes. And we really need to make sure that every household is aware of what it's going to take to protect the individuals in that household that have pre-existing conditions. We could call on the indigenous nations, the real tribal leaders, to also be working very closely to protect the elders of their communities. We know this is more difficult in multi-generational households, and it's really going to call for really unbelievable attention to details of hand washing and protecting others from each other, particularly if you don't feel well. This is really a call to action to the communities to make sure that we get messages appropriately out there so that everyone understands what it's going to take for us all to protect one another. And we know it can be done because we can see these changes. I wanted to go through the numbers at a high level so you understand why particularly these supplies went to these areas to begin with. We talk about attack rates or the cases per population. So in the New York, as a state, they have 7 cases per 1,000. This is the highest in the country. In New York City itself, it's closer to almost twice that in New York City. New Jersey is 4 per 1,000, Louisiana 3 per 1,000, Massachusetts 2 per 1,000, Connecticut 2 per 1,000, Michigan 1.5 per 1,000. The District of Columbia in the Baltimore area now 1.5 per 1,000, and we're watching them very closely. Pennsylvania 1 per 1,000, but we're concerned about Philadelphia. What is allowing us to move supplies based on burden of disease and need is the extraordinary West Coast that has had very low numbers, from Washington that was less than 1 per thousand, California that is less than 0.5 per thousand, and Oregon that's even less than that. And it's those states where there's large populations, because of the enormous work that they're doing to prevent expansion and spread of the virus. It's allowing resources to go to these states and these communities and these counties that need more support. And so this kind of data analysis is allowing us to make very intelligent decisions about need, but also really understanding what's happening across the country in the development of the curves, as you have heard about. And so we do see, and I know you heard me caution that over the weekend sometimes there's decreased case reporting, and so there were increases in a series of communities on Monday. We're seeing that stabilize again, and when you look over 3 days, you're starting to see that we may be actually in a series of communities outside of New York and New Jersey and Connecticut creating a much flatter graph. A much flatter curve. So you saw New York and the increase, and then you saw, we're hoping, as Governor Cuomo and the mayor has described, that they're getting to a steady state where the next outcome is going down. But we see across the country, in Detroit, in Chicago, some real, not this extreme going to 7 cases per thousand, but really staying in the more 2 cases per thousand, and a different curve parameter then, and it really shows the amazing activity of every American in those cities to really ensure that there's social distancing, and really importantly to ensure there's less socialization between households, and really ensuring that the household really remains independent and protected, and not really at this moment going out into the community or socializing anywhere but a virtual way on computers, by Zoom, by FaceTime. And I think we can really see that in the data, and it's really given us great heart. I want to finish by really talking to my laboratory directors, because you're extraordinary and you've done an amazing amount of testing. Those nearly 2 million tests that we're getting to, those were all done in the last 2 to 3 weeks. But we do have excess capacity. So if all the lab directors could look in their laboratories, if they have an Abbott M2000, if they could get that up and running, we could double the number of tests that we're doing per day. That is a high throughput. The machines are throughout the United States. There's hundreds of them. Right now, about 80% of them are idle. We're going to have a call with the laboratory directors of these laboratories to really ensure this is an automated, robotic situation that they can run. There's over 1 million tests sitting. Test kits sitting, ready to be run. We have 5 platforms of tests. This is one of our really high volume platforms, like Roche, and we're really calling on them to really increase that capacity so that we can do not only increased diagnostic testing, which I think we're doing quite well right now, but also increasing the ability to do more healthcare workers, first responders, community testing, and surveillance. And then finally, you will see, and you've heard about it happening in the UK and other places, there's a series of antibody tests out there that have not been validated. We're working right now very closely with a series of companies that know how to make these tests, that have made these tests for us for decades, for HIV, for a rapid test. They're working on that technology to bring that quality of test, which is in the 90+% sensitivity and specificity, to the American people for antibody tests. But until we get those, if you see them on the internet, do not buy them until we can give you a test that's reliable for all Americans. And we are working very hard to have that happen and bring that to the American public. Some of the tests that may be available on the internet may have very low sensitivity and specificity and give you a false reassurance that you either give you a false positive or a false negative, implying that you may be protected. So please wait until we have those tests available and validated. People are working around the clock to make those available to the American people. We all understand how important that is, because you've heard us talk about asymptomatic cases, and we really want to know how broad that is and how common that is. And so in places like New York City, where I described that they had a 7 per 1,000, sometimes 2, 3, and 4 times any other place in the United States, being able to know what the number of people who never had symptoms but do have a positive test would be really critical at this point, particularly as we plan for any reoccurrence in the fall or in future seasons. Thank you.
Great. And we have Seema Verma, Center for Medicaid and Medicare Services, will discuss what we've done to support hospitals. As we support healthcare workers, we want to make sure the institutions that are providing the environment for care are well financed, and she's got a couple of funding streams, and help is on the way. Seema.
Thank you, Mr. Vice President. And let me just start with echoing the President and the Vice President's comments about our condolences to all the people out there that have lost somebody to the coronavirus. And also, sincere appreciation and thanks to all our healthcare workers that are on the front lines. But we know that it's the impact on the healthcare system isn't just those frontline workers. Healthcare organizations across the nation are having increased expenses. They're having to spend more on supplies. You're seeing all of the supplies that are being sent to them, and that's having a direct impact on their bottom line. Many of them are also having increased expenses because they're taking advantage of some of the flexibilities that we've given them. Hospitals without walls, they're putting, you may see tents out in their parking lots where they're doing testing or screening, so they have a lot of increased expenses as well. Other healthcare organizations are not performing essential surgeries or other services. A lot of them are moving to telehealth, and that represents lost revenue for these healthcare organizations across the country. And so the President has asked us to address this issue. About 10 days ago, we put out something called accelerated payments that we do in the Medicare program, and it allows us to advance payments to providers based on their historical Medicare revenues that they receive. So just in 10 days, we've been able to provide payments to providers. We had about 25,000 requests. We've processed about 70% of these. It's happened in about 5 days, and the total on that is about $34 billion that we've managed to put into the healthcare system. But those are essentially loans. The President has asked us to go further with this and to start the implementation of the CARES Act. That provides $100 billion to the healthcare system. You've heard Secretary Azar talk about the focus on some of those dollars going towards the uninsured, but the President wants us to accelerate getting those dollars out. And so this week we will be putting out another $30 billion, which are grants. This is going to be based on Medicare revenue. There are no strings attached, so the healthcare providers that are receiving these dollars can essentially spend that in any way that they see fit. Also, this is going to be done in a very easy, simplified way for many of our healthcare providers. We actually do direct deposit with them, and so those dollars will just go right into their bank accounts. For other providers, all it's going to require is some very simple registration, and we'll be able to give them that money as well. So we're expecting that to happen this week. The other thing to note is that this is not a first-come, first-served basis. Because we are basing this on their Medicare revenue, they will get these dollars. So even if it takes a few days, there shouldn't be any panic in the system as well. The other thing to recognize here is that our priority was on getting these dollars out as quickly as possible. We heard that from the many healthcare providers across the country that weighed in on this. They said the most important thing was to get these dollars out as quickly as possible. But we recognize that in terms of getting these dollars out, because it's based on Medicare revenues, there are providers out there, pediatricians, children's hospitals, OBGYNs, even our nursing homes, that a lot of their revenue comes from other sources, Medicaid or other payer sources. And so those organizations will be addressed in the second tranche of funding, and we'll have a priority for these organizations and these types of healthcare providers. Also just want to say, so together between the loans that we've put out there with our accelerated payments and the $30 billion, that's about $64 billion for the healthcare system this week alone. And so I think, again, this is part of our effort to support the healthcare system, and also just want to, again, say thank you to all our healthcare providers out on the front lines. To all Americans, the best thing that we can do to support our healthcare providers is to adhere to those guidelines around 30 days to slow the spread. That is the best thing that we can do to support our healthcare workers. Thank you.
Johnson, please.
I just want to make a brief comment to get back to the discussion about the health disparities in the African American community, because it really is very important. And the reason I want to bring it up, because I couldn't help sitting there reflecting about sometimes when you're in the middle of a crisis like we are now with the coronavirus, it really does have ultimately shine a very bright light on some of the real weaknesses and foibles in our society. And as some of you know, the greater proportion of my professional career has been defined by HIV/AIDS. And if you go back then, during that period of time when there was extraordinary stigma, particularly against the gay community, and it was only when the world realized how the gay community responded to this outbreak with incredible courage and dignity and strength and activism, that I think that really changed some of the stigma against the gay community, very much so. I see a similarity here because health disparities have always existed for the African American community. But here again, with the crisis, how it's shining a bright light on how unacceptable that is. Because yet again, when you have a situation like the coronavirus, they are suffering disproportionately. As Dr. Berg said correctly, it's not that they're getting infected more often, it's that when they do get infected, their underlying medical conditions, the diabetes, the hypertension, the obesity, the asthma, those are the kind of things that wind them up in the ICU and ultimately give them a higher death rate. So when all this is over, and as we've said, it will end, we will get over coronavirus, but there will still be health disparities, which we really do need to address in the African American community. Thanks.
Well said. Questions for our panel, please.
Yeah, for Mr. Vice President, and then a question for Dr. Birx as well. Sure. On the ventilator issue, with 8,400 of them in the stockpile and tens of thousands more coming, why are states like California and Washington needing to send ventilators to other states, and is that smart if they might need them later on?
Well, I'm going to let Dr. Birx speak about what's happening in California and Washington, because it is a real credit to the people of both states and the leadership of both states to see the progress that we've made. We continue to witness that the numbers where the outbreak began, we all remember when this first emerged in the Seattle area, the numbers continue to be steady and low. And what we've seen the governor of California do, what we saw the governor of Washington State do, and the governor of Oregon, where the coronavirus hasn't arrived to a large extent in Oregon, I think is in keeping with the highest tradition of the American spirit. And they are understanding what I think Americans are understanding more and more, that while we tend to think of this as one large curve in our minds when it began in our country, and we long for the day that it will end, and we want to hasten that day by putting into practice all these mitigation efforts. The reality is, what these experts have explained to this layperson, is that what we're actually going to witness is a number of small curves that will cumulatively mean that curve. And for Oregon, for Washington State, for California to recognize where the need is, and then to partner with us and FEMA to make sure the resources are there at the time of the need, at the point of the need, I think is really inspiring. But Dr. Birx, do you want to speak to that?
Yeah, I want to be clear. No, we didn't ask for their ventilators. They looked at their epidemiologic curves. These states have amazing health commissioners, and I think when this is over, we'll really be. All of the models were based on something we have never attempted to do anywhere in the world. We have never attempted to do this kind of mitigation. It was always theoretic to many individuals, and now we see across the globe people mitigating against this virus, realizing that their own behaviors can change the course and future of this virus in their communities, which is really astounding, the power that gives us to actually understand that we can compete against this virus and do well. And so I think their governors and their health commissioners looked at their curves, looked at their hospitals, looked at their ICU, and looked at their needs, and then decided that they didn't need those at this time and wanted to make it available for other states that were in more of that 2 per 1,000, 3 per 1,000, 4 per 1,000, and 7 per 1,000. And I think we'll learn a lot
lot from other states and other communities to really understand how to do this better next time. And I think this is what will teach us, because we've never attempted anything like this, at least in my lifetime, where we've had, these 30 days to stop the spread. I mean, we've not ever put out information like that. So I think you heard the CDC director talk earlier today about, in the models, how different individuals thought communities would mitigate and the rate at which they would mitigate. And I think you can see that across the world, we're learning that when you give communities the information that they need to understand what's going on, and you're transparent, that communities can be part of the solution in a transparent and amazing way. And I think this kind of education and dialogue is always critical when you want communities. I think when I first started here 5 weeks ago, I said that we will win based on what the communities are able to do as a community of Americans. And I think we're all really deeply impressed about what they were able to do. So it was the governors who decided.
The testing backlog, I just had a quick follow-up question on that. How close are we to getting into that 24-hour window you've talked about being very important? And then what is the status of the self-swab test?
So we're tracking all of that very closely. I use my time here to appeal to people specifically, the health educators, the health advocates, because I know the power with them. But to my lab directors, I really need the Abbott M2000 online, because that means we can do an extra 100,000 tests a day. And there's enormous power in that. The ability to self-test, last time I had my test here, I self-tested, so it can be done. It's straightforward. It works very well with that rapid 5-minute test. But what we now have to create, and I know that's always difficult because everybody wants one of something, we now have to create a mosaic that brings together where we know every single machine is in the United States, where our gaps are, and then align resources with need and gaps in the testing, and ensure that we have the right laboratory test for the right community. So you can see there would be communities, particularly the Indian Health Service or rural communities, where that Abbott ID Now kit could be incredibly helpful, because otherwise they're shipping it all the way to a capital, maybe 3 states away, and that's going to add 2 or 3 days to the wait time, which we're trying to get away from.
Is that where we're at in the backlog, 2 or 3 days, or what would you?
It varies state by state, and we'll be talking with all of the states about really changing how we do testing in the community to really ensure that we're testing optimally. Because right now we have still focused very much on hospital diagnosis because we know it will make a difference in treatment. So these major laboratories are still putting drive-through tests at the back to all the hospital tests. And so that's where the backlog is in the drive-through tests. So I know if you're an outpatient, not an inpatient, but if you're an outpatient, that is where the delays right now are, but it's state by state. And so some states have 24-hour, 48 hours for both their outpatients and inpatients. Others have short for inpatient and longer in outpatient, and then we're trying to reconcile those two pieces.
Right. And the team is actually meeting tonight to review that, but one of the data points that we review is literally on a state-by-state basis what the turnaround time is for testing, and we continue to work that. And these Abbott laboratory devices there's 18,000 of them across the country. When you go to your doctor office and get a strep test, it's that device. All Abbott Laboratories has done, with strong and swift efforts of the FDA, is create a test to put in that for the coronavirus, and it's a 15-minute test. And so I want to renew our call to all the healthcare providers around the country is find your Abbott device, and we'll work our hearts out to get a test to you. How about in the back corner?
Mr. Vice President, thank you. One for you and then one for either of the doctors, if you don't mind. For you, sir, back to this idea of reopening up the economy, since it's not like there's a switch that you can just turn it back on. How does the administration envision this happening? Is it guidance from the White House and you hope the governors follow it? Or are you going to put it in the governor's hands or the mayor's hands? How do you envision all of that working together?
Well, the one thing I can assure you is that the president's decision in that regard is going to be informed by what the data shows and about decisions about when we can responsibly reopen America and put America back to work. I can tell you the CDC will have new guidance tomorrow that the CDC will be publishing for people who were in proximity to an individual that tested positive for coronavirus but have no symptoms. And CDC will be publishing new guidance about how those individuals and the circumstances under which they might be able to return back to work using some facial protection and monitoring their temperature, but we'll detail that for you. But what we're going to be doing over the weeks ahead is, while we focus every day at the point of the need, as the president said many times, our first mission is to save lives. And that means to slow the spread, to bend the curve, to continue to engage the American people, which they are admirably doing, to continue to put all the social distancing into practice. But there is a dual track that the president has already initiated. Some of the best minds here at the White House are beginning to think about what recommendations will look like that we give to businesses, that we give to states. But it'll all, I promise you, be informed on putting the health and well-being of the American people first. Dr. Birx?
Either for Dr. Birx or for Dr. Fauci. Or do either of you want to take that? Or?
Go ahead.
Secondly, as a lot of parents are sitting home with their kids, and they've been home with their kids for weeks now, and they're wondering, maybe resigned to the fact that maybe their kids aren't going back to school this year, but are looking ahead, what do you think summer camp holds, and what do you think the start of next school year holds, if you could look down the line? Do you think those start on time? Do you think school next year starts on time?
Can I say a word on behalf of teachers, since I'm married to one?
There you go.
My wife was all day yesterday at the elementary school she teaches at, loading up about 500 bins of art supplies for kids. And she's just one of millions of teachers across this country who find themselves having to distance teach kids. And I'm proud of Karen, but relatedly, I'm proud of every teacher in this country. Secretary of Education was here not long ago talking about our efforts to expand distance learning resources, even in K through 12. To all the teachers who are out there, we just want to say thank you. Thank you for what you're doing, for continuing learning, even in this challenging time. And to all of the kids, just because you're home doesn't mean you don't have to do your schoolwork. Keep it up.
Anticipate children being back in classes in August?
What I will tell you is I'll yield to the health experts, but that'll be part of what we're looking at in terms of guidance going forward, whether it be summer school or whether it be returning to school next fall. But the most important thing we can do is put this epidemic behind us as quickly as possible.
Well, my daughter is a school teacher, so she asked me the same question. You know, it is unpredictable, but you can get a feel for if we start talking about the things where the curve goes down and we really have minimal, how we respond and what kind of a rebound we see or don't see, I think is going to have a lot of influence, probably more immediately on things like summer camps than it does in the fall. I fully expect, though I'm humble enough to know that I can't accurately predict, that by the time we get to the fall, that we will have this under control enough that it certainly will not be the way it is now, where people are shutting schools. My optimistic side tells me that we'll be able to renew to a certain extent, but it's going to be different. Remember now, because this is not going to disappear. So we're going to have in place the capability of doing the things that we talk about all the time on this stage, to identify, to isolate, to contact trace, number one. Number two, by that time, we'll have a better feel with the antibody test about what the actual penetrance of this infection was in society. How many people have actually been infected? Who's protected? If you have antibody, it's very likely that you're protected. Who's vulnerable? Do you treat vulnerables different than you treat the people who are protected? All of these things are going to go into the decision of just how much back to the original way we'd like it to be in the fall. Bottom line is no absolute prediction, but I think we're going to be in good shape.
Dr. Fauci?
one for Dr. Fauci or Dr. Birx. Can you talk about your concerns about deaths being misreported by coronavirus because of either lack of testing or standards for how they're characterized?
So I think in this country, we've taken a very liberal approach to mortality. And I think the reporting here has been pretty straightforward over the last 5 to 6 weeks. Prior to that, when there wasn't testing in January and February, that's a very different situation and unknown. There are other countries that if you had a pre-existing condition, and let's say the virus caused you to go to the ICU and then have a heart or kidney problem, some countries are recording that as a heart issue or a kidney issue and not a COVID-19 death. Right now, we're still recording it, and the great thing about having forms that come in and a form that has the ability to mark it as COVID-19 infection, the intent is right now that if someone dies with COVID-19, we are counting that as a COVID-19 death.
Can you be sure? I mean, you hear from coroners that that's not necessarily the case. Are you sure? How can you be confident about that? And is there any concern that it skews the data that you're trying to collect in terms of projections and things like that?
Well, I think that would apply more to rural areas that may not have the same level of testing, but I am pretty confident in New York City and New Jersey and places that have these large outbreaks and COVID-only hospitals. I can tell you they are testing. New York and New Jersey together have, by proportion, are testing extraordinarily well as Washington State and Louisiana. So I don't see that there's been a barrier in testing to diagnosis.
No, I think there's so much focus now on coronavirus that, particularly if you take New York, which we all know is having a disproportionately higher proportion of the burden of the entire country is right now in New York. I can't imagine if someone comes in with coronavirus, goes to an ICU, and they have an underlying heart condition and they die, they're going to say cause of death, heart attack. I cannot see that happening, so I don't think it's going to be a problem.
How about one more?
A question for Dr. Fauci on the virus hitting Black communities the hardest. I mean, these numbers are staggering. Louisiana and other states are reporting 40 to 70% of deaths are African Americans. Do you expect that pattern to continue nationwide? Some states have not even reported their data yet.
Yeah. I can't be confident to predict patterns, but the underlying reason why that is happening doesn't change from state to state.
So you expect it to get worse?
No, I expect that when African Americans get infected, given the disproportionate disparity of the underlying conditions that lead to complications like the ones I mentioned, I expect that we will still see the pattern that when you look at the proportion of people who get into serious trouble and die, again, it's going to be disproportionate towards the African Americans. I do expect that.
And is the federal government now leading the charge in collecting this information from the states, and when will it be made public?
Yes, the answer is yes. It will be public as soon as you get enough data to be able to make a meaningful statement.
So can we expect this week or a couple of days?
The task force has assigned that to several members of the team. We're assembling that data now. It is a great concern for us, and but it's probably a good reminder that we have to be especially careful around people with serious underlying health conditions. Because we've said it many times from this podium over many weeks that the risk of serious illness from the coronavirus remains low for the average American. But for anyone from any community that has a serious underlying health condition, particularly senior citizens with serious underlying health conditions, the risk of tragedy is very real. And so we're going to be very diligent about studying this and providing information and guidance in accordance with our best scientists. But I do want to say to each and every American, the President's coronavirus guidelines for America about wash your hands, If you're sick, stay home. If you can work from home, if you're not in critical infrastructure like our incredible healthcare workers or all those heroic people working to keep food on the shelves at our grocery stores and keep medicine at the pharmacies, we ask you to work from home if you can. Avoid unnecessary travel. Avoid gatherings of more than 10 people. Use a drive-through at a restaurant. Don't go in the restaurant. Not just to protect your health, but to protect those of every community, of every background in this country who may have underlying conditions that make them susceptible to tragic outcomes. That's how we can all do our part to slow the spread and to protect our most vulnerable. And the American people are doing it. And as we continue to do that, we will hasten the day that we put the coronavirus in the past and we reopen America and put America back to work. Thank you all. We'll see you tomorrow.
And thank you to those of you who are with us here on coronavirusnow.com. Also with us on Fox 10 Phoenix's YouTube page. Just want to remind you, you can subscribe to our YouTube page. That way you can stay up to date each and every single day on the latest that happens here across our country. Hey, let's take a look at a brand new map. So usually we show you that Johns Hopkins University map. This time I want to turn to University of Minnesota. This is from the Carlson School of Management. They did post this interactive map where they are doing some hospital tracking. So as you can see, and of course it updates as we're in the middle of it. As you can see though, each state has updates on what their numbers are. So California currently has 2,509 hospitalizations. Of those, 1,085 are in the ICU, and they have had 343 deaths. So if you want to jump on their site, you can always take a look at your state and see what their numbers are. But not only do they have hospitalization tracking, they have hospitalizations to date currently in the ICU. And as you can see, states are still kind of reporting in their numbers as they continue to update here their maps. But I do want to give you a total look at those deaths here in the United States. So unfortunately, we do have many to be reported of. The biggest one, obviously, New York. They've had more than 4,700 deaths. Attributing to that number, that's over 12,000 across the U.S. You can see California there with 343 deaths. And then you take a look at some of the other states that are trailing, and just behind those, Illinois has 307, Los Angeles has 512, and Florida has 254. So again, this is a new interactive map that we'll be showing you periodically here on our News Now channel. But again, this is from the Carlson School of Management through the University of Minnesota, and it's a new way that we can show you some updated numbers and totals, especially when we're talking about those who have been hospitalized. It definitely has given us that wider look at exactly how these different states are doing. And since it's from Minnesota, let's check in on their numbers. They do have 115 current hospitalizations. Overall, they've had 223. Currently in the ICU, they have 57 people. And in total, they've had 90 visits to the ICU, and 30 deaths have been reported in Minnesota. So just wanted to give you a look at that. As we continue giving you more news here across the country, I want to remind you can always go and read the latest stories that have been happening. Those you can find on coronavirusnow.com. But one way we are impacted is definitely our eating habits. So what does nutrition look like when we have COVID-19 happening, when we're all supposed to be quarantined inside our home? Well, we did talk with an expert, and our Fox sister station KTVU has that interview for us right here on News Now.
Hey everyone, I'm Christina Rendon with KTVU Fox 2 in the San Francisco Bay Area, and today we are joined by Jane Williams, a certified integrative health and nutrition expert joining us from Florida. Thanks so much for your time today. I know these are really uncertain times, and you taking the time out of your day to help us really means a lot.
Oh, thank you so much for having me.
I just want to add as much value as I can to, just like everyone else, right? This is about serving right now and just getting messages out there that can help others. So
absolutely. And the topic we're going to speak about today is building a supportive immune system. Before we do that, though, I just want to say, it's hard to do that. I feel like right now for some people, because they go to the grocery store and they think, I can't find any food, I can't find toilet paper, I can't do this or that. What would you say to people right now who are in this state of staying at home?
right. Well, my thoughts are basics. We've got to get back to basics, number one. And I think that, we live in a world and we typically live in a routine that we can go and get what we need when we need it. So we kind of have this false reality about what's available when it's available. But I think that if we just kind of dial it back and get back to basics and think whole foods, I have yet to see in any of the grocery stores, or even talking to friends who live all over the country, that there's a lack of fresh produce. What we see happening is the frozen stuff is gone. The baked items are totally gone. The baking section is wiped out. Cereal, again, toilet paper, milk and eggs, things like that. But there's a lot of other whole food options that maybe out of convenience, we haven't looked at too much. And so I think it's an opportunity to be able to dial in a little bit and start to focus on how we can support our immune system through all of this.
Okay, then that leads us to our first main question here. How do we boost our immunity?
Yes, well, it's all about, number one, about priming our immune system. Really, that's what we want to do. So we want to support and prime our immune system because while we can't necessarily prevent being exposed to this, we can help our bodies in fighting it. And, I've been talking to a lot of people some that have gone through having this particular virus, but this really goes for any type of viruses, from COVID-19 to the flu to colds. When you prime your immune system, you're really giving it the best chance at recognizing that the viral activity going on and saying, okay, I know you guys are bad guys. I know these are bad pathogens coming in. And again, putting the right stuff in to be able to boost that. So what can we do? We can do so many things. Number one, we need to hydrate. It's so important to be hydrating right now. One of the ways that this virus is actually entering is through the mucosal lining of your nose. So if that is dry, it's not able to do the work that it typically does. So we need to hydrate. When we sleep overnight, we naturally dehydrate. So we wake up kind of at a disadvantage. So we need to make sure we're putting all of that, we're rehydrating as we start our day. And there's simple steps to do that. I mean, you can make sure that you're going to bed at night with a 32-ounce mason jar, if that's what you have, something that's glass, or, think simple, right? It's all about back to basics. So you can have that next to your bed. I personally love even hydration with benefits. So not only are you getting that water, but you're getting additional benefits with that water. Things like lemon, it's a natural detoxifier, right? So your body is constantly detoxing, but this will aid that detoxification. It kind of adds that rest and reset so that you can start your day by fueling it properly. So that's another piece. Chia seeds, they're great because they hold 10 times their weight in water. So you've got the hydration of water going on, and then you've got an additional booster of chia seeds. So I love those additional boosters in your water. Aloe vera. Aloe vera juice is another great one to add into your water. You can add a tablespoon or two to start. And that is, when you get a sunburn, you put that on your skin, right? And that soothes your skin, does the same thing with your gut lining. And so that's a really nice primer for your immune system. So that's important to remember. And it's also important to remember that 70% of our immune system is actually located in our gut. So by starting there, by focusing on the gut, that is where we're going to start to make some impact in how our body fights these things. So hydration is key. That's number one. Number two, obviously, is what we're putting into our bodies, the fuel that we're putting in every single day. So Whole foods are incredibly important. And as I said earlier, I'm not seeing that there's a lack of whole foods in grocery stores. I'm seeing that, people can get carrots and lettuce and kale and, citrus fruits, which are super high in vitamin C, all of those things that our body needs. So it's important that we're putting color into our diet because it's rich in antioxidants. We also want to make sure that we're getting foods that are high in vitamin C. That helps an inflammatory response, right? It also helps in oxidative response when those pathogens come in. So we need to make sure we're getting things like bell peppers, if that works for your body, and things like citrus fruits, oranges, grapefruits, mangoes, all those really good fruits that are super high in vitamin C. And I also think zinc is really important. And you can get some zinc from food, and it's great to combine it with vitamin C too, but you can also get it in supplement form. And that is really important in supporting your body, again, with that oxidative stress and that anti-inflammatory piece. So hydration, whole foods, right? And then what I love is fiber. Fiber is so important to not only support those good guys, the good gut bacteria in our gut, but it's also really important to keep everything moving. We want to modulate our immune system, our gut. So we need to make sure we're getting enough fiber. And there was a study out recently that showed that Americans get about 10 grams on average of fiber a day when we really need between 20 and 30 grams a day.
Oh,
That's
wow.
a huge difference. We're not getting enough. And people think, okay, how am I going to get that? How do I get all of that additional goodness in there? I feel like it's hard to do.
Sure.
And I say, you've got to eat more greens, right? That's number one. Make sure you've got greens on your plate for every single plate. Think the perfect trifecta. That's fat, healthy fiber, healthy protein at every meal. So if you have that, you're going to get more of that.
All right, guys, just going to switch gears since we do have some live events happening right here, right now. I want to go out to Hawaii. They are giving an update on coronavirus, not only with their mayor, but also law enforcement and health officials.
Sure, everybody that the Honolulu Police Department is fully operational. The citizens and a population of Honolulu, we all are safe, and that we do have plans in effect to address each situation as they come up. Thank you.
Thank you, Chief. Really appreciate it. Our first responders are doing so much, whether it be the Honolulu Police Department, Honolulu Fire Department, our EMS folks, our ocean safety folks. My heart goes out to all of them for going to work every day and protecting us, and also our medical personnel, whether it be physicians or nurses or lab technicians or everyone else, the people cleaning and feeding folks. All of them, thank you so much for what you're doing. I did want to, in terms of just figures, as of today, 59 HPD officers have been tested for COVID-19. 46 tests returned negative. 3 tests were positive, and 10 tests are still pending. Next, I wanted to talk about masks. As you know, a recommendation was made to the residents of the city and county of Honolulu last week, here in this room, that they wear masks. Strongly, strongly, strongly wear masks. And at that meeting, I showed a Sig Zane mask that was presented to me. I'm wearing my Sig Zane shirt today, but I did want to, since then, folks have made me a palaka mask. I wear palaka on the weekends, shaka for the palaka. And I have one in red, blue, and yellow. And I wear those on the weekend, and I wear the Sig Zane on the weekdays, but I wear a mask every time I go out in public. This is critical. Part of the flattening of this curve, part of the results we may be seeing is because of the discipline that we're all exercising in wearing masks. And again, I can't drive home enough the fact that besides wearing a mask when you're out in public, is do not buy an N95 mask or a surgical mask. We need those for our heroes, our medical professionals, and our first responders when they're out saving lives. So please, homemade masks like these kind and others. But again, we would like to bring up Dr. Darrell O'Carroll to talk about masks and a program that they're going to be working with local vendors. Brandon Carrizo will talk, and Zach Noyles also. But I just want to thank Dara for being here again today. I know how busy he is and coming up, and the podium is yours. Thanks.
Thank you, Mayor. Thank you for allowing us to be here. I'm here with Everyone Hawaii, which is a nonprofit organization that's helping to both educate about masks and get masks out to the public as quick as we can. I'd like to thank our communities, our first responders, and all of our essential workers and healthcare workers, and all of you out there for the massive community effort that's undergoing to flatten this curve. And my sincere condolences to everyone who has been affected by this virus already. My heart goes out to you. Forgive my appearance once again for wearing a mask. You probably won't see my face for quite some time. As a frontline medical worker, I'm exposed to COVID-19 on a regular basis, so I'm practicing my kukua to everybody here in the room by continuing to wear a mask. I know it hasn't been easy, but both as an ER physician here in our community and a member of your community as well, with family residing in the islands, I ask for your continued cooperation in practicing all of the social measures we have at our disposal to combat COVID-19. Because it's important now more than ever, as we could see a steepening of this curve, and we're going to likely hear about more of our communities falling ill, that we do everything we can to slow its spread. Because if we examine the number of positive cases that we have at the moment, it's really a snapshot of positive cases 2 to 3 weeks ago. And the reason being are several, is that this illness has a long incubation period. On average, 5 to 6 days, could be up to 14. Some reports have been up to 21. And so that's the first lag in detecting positive cases. The second lag is the lag of test results, which, as the mayor mentioned, I've had a test result that took about 9 days to come back as well. So the true number of cases in the islands is likely a lot higher than the number of positive cases that we have reported. Could be in the thousands. And so if we go back to the Polynesian Voyaging Society,
All right, it looks like for some reason Fox has switched our feed. I'm going to wait here just another minute, see if we do get it back, and it did pop back.
in this picture has a role. We've got Kaniela all the way over on the left side there, holding down the kitchen and making sure that none of the water gets in there. He's helping Leilani. You can just see her leg there, cook the rice for Uncle Gary, who's bringing up the nice chow that we all can't wait to eat. And behind Uncle Gary, you've got 3 or 4 people making sure he doesn't fall down. Because you can see now that there's some pretty rough water that we're going through. And it's also in the northern Pacific, very cold and very biting. And then you've got our 3 steerspersons trying to manage the hoy, which is not an easy task as well. So you can see everybody has a role in this photo, and everybody has a role here today on these islands to help flatten the curve. And so if we were to imagine we're on a canoe at the moment, I'd have to be quite honest, my navigators would be telling us that we're not sailing completely the right course. We're not sailing completely the best course, and I'll tell you why. I was at the grocery store 2 days ago, and I would say about only 25 to 33% of people were wearing masks. And I'm just going to be honest, that's not enough. We can do better than this. And we'll talk about how we're trying to get masks into the hands of everybody possible. Zach Noyle and Brandon will do that in a second. And so I'd like to remind everyone that because we don't yet have adequate and proven medical treatments for COVID-19, the social distancing measures, the proper hand hygiene, staying at home if you feel ill, using medical care remotely by calling first, and lastly, wearing a mask in public are the only ways available to us to combat this disease. So if we were to show that we care about our families, our crew members, if we were to care about our friends, our neighborhoods, our cities, and our state, we all need to be doing as much as we can. And so to focus in on masks, the reason why masks are, why they should be used in public is that evidence has come to light that virus can be expelled from the mouth as we speak mostly in small little droplet saliva forms. And I think we've all been at parties where we've gotten too close to people and we'll get the spray. And so it's not quite that bad, but even just speaking, small little droplets will come out. But also when you cough, but even sometimes when you breathe, just small little bits of virus will be coming out. So wearing a mask prevents me from spreading this all over this lectern and everywhere else, if I was to have it, which I don't. I've been tested negative. So a large proportion of this disease is also spread by fomites, which I could shower this lectern or this microphone with the virus, and then somebody else comes and touches it, and then now they touch their face and could contract the disease. So with fomites, you could never be around anybody who you thought was ill, yet still be infected. Probably the last reason why masks are important is that you could have, and I would say this is the most important reason, is that you could have this virus and not know it. So very, very well done studies have shown that you can be shedding this virus and giving it to others up to 3 days before you ever start beginning having symptoms. And probably the most worryingly study has shown that up to 1 in 5, people will never have symptoms at all. So you could be walking around town, showering the virus around, and never know it. So mask wearing should be a point of pride. It shows your kokua to everyone else, and that you want to do everything you can to protect your families and these islands. And so a little moment on what type of masks we have here and available. We're recommending do-it-yourself or cloth masks when you're out in the public. And usually you just like to have anything that's comfortable. And we can talk more about, and the people who are making the mask can talk more about which materials are comfortable. But it should be comfortable, fit over your nose, never below your nose, and fit snugly on the side of the face. And it should also allow you to breathe without restriction. The advantage of do-it-yourself masks when compared to surgical masks is that this surgical mask will eventually lose elasticity along the ears, and it'll fall beneath my nose, and that will become detrimental, is that you're going to be touching your face more than you should, and also your nose will be expelling possibly some virus. So that's the advantage, that do-it-yourself masks won't lose this elasticity. Some tips on maintenance of the do-it-yourself masks, if we could move to the next slide, are that how you want to do this is daily. You definitely want to perform maintenance daily, but lots of soap dissolves that fatty outer layer of the virus, kind of explodes it. Hot water or using a dryer will disinfect and kill the virus as well. If you don't have access to those, hanging in sunlight for 2 to 3 days can kill the virus. And as I mentioned, perform it daily. So it's a good idea to have 3 or 4 do-it-yourself masks at all times that you can rotate through your armamentarium. And then surgical masks really should be used for our medical workers, but we're going to do our best at Everyone Hawaii to get as many surgical masks out to you guys as possible. And these should be used only if you yourself are sick or if the household member is sick. And the fit is usually one size fits all. And the longevity, as I mentioned, is roughly around 8 to 12 hours, and that the elasticity will start to degrade. And that's when you really need to throw these away, when it starts having a poor fit. And lastly, as Mayor mentioned, our N95s. It should definitely only be used for frontline medical workers. Almost 70 physicians have died in Italy, largely due to possibly inability to have the adequate PPE. And so we need to keep our frontline workers, our medical workers, safe so we can care for you. And on a very important point is that the N95 needs an expert fit. Some N95s don't fit me, and so if you're just using an N95 you obtained from your friend, your family, and it doesn't fit properly, it's not going to perform to its best capability and should be in the hands of somebody that it fits properly in. Also, it's hard to sterilize these adequately, and there's no adequate studies that show how to do that. And lastly, probably the most important point, is that just because you are wearing a mask does not mean you can go out and party and socialize and hang out with your friends. We still have to keep our distance, and it's not a fail-safe. So I'd like to end my talk here, and I apologize if I've been speaking for a while, is with a message from 3 colleagues of mine who are in New York. And they're sons and daughters of Hawaii, and you should be very proud of them. They're on the front lines in New York at the moment. Lena Miyakawa all the way on the left, Sam Kim in the middle, and Mark Maeda. I've trained with all of them, and they're good friends of mine. And they've all reached out to me to reach out to you, to do everything you can to prevent what they're seeing in New York happening here. And so wearing a mask is part of that. Sorry, getting sort of emotional about it, but they've relayed that we need to do everything we can. And that includes wearing masks in public. So I'd like to give it over to Zach, who's going to talk about how we're going to encourage using mask use and also get those masks out to as many people as possible.
Zach, could you say your full first and last name? Thank you, Dara. Thank you very much, Dara. Thank you, Mayor, for having me. My name is Zach Noyle, and I am from Everyone Hawaii. We are a group of young generation that we want to really make a difference here in Hawaii. So I just wanted to talk a little bit about some of the projects we're doing and what we have going and how you can get involved to help us. We are working with a local chain right now, a retail chain of essential business, to bring together over 12 of our different local brands here. So the local brands are fashion brands and different ones that we can bring together that are making masks. And we want to put out a call for everyone out there to contact us and get involved and how we can put these masks together and we can bring this so that we can further the reach of the masks for the people of Hawaii. So we do have a lot of information and documents that we want to share with the brands so that you can get legal docs as well as the how-tos and the distribution from us. We will be donating masks to the vulnerable communities for every mask that these mask sellers sell. We're also supporting many various nonprofits and support groups to get these these masks as so many as we can. We've already supported Aloha Harvest, IHS, Salvation Army, Palama Settlement, YMCA, and our longshoremen. We invite our community groups looking for masks to contact us. We have masks, and our goal is to be able to get masks to everyone here in Hawaii. So please contact us, and we can get that set up, and we can help you. So thank you very much, and I'm going to call up Brandon Karisu with AIO Digital. Thank you.
Hey, thank you, Zach. Good afternoon. My name is Brandon Karisu. I'd like to briefly talk about a new independent, community-driven data collection effort called Aloha Trace. Aloha Trace is based on the concept of crowdsourcing information from the community. We are relying on Hawaii residents to contribute their information online by answering 6 questions every day or as conditions change. If not every day, as frequently as possible. The website is available at alohatrace.org, and it takes 2 minutes to complete. The questions focus on how you're feeling, what your symptoms are, if any, and more importantly, the general vicinity of your location, which could be your nearest intersection or zip code. And also high-level details on where you've been the last couple of days. So whether you're feeling well or unwell, we are hoping that everybody participates because the more data that we can capture, the better. Through this effort, we are hoping to send near real-time data to research organizations and Hawaii public health and government officials. This has been a collaborative effort between the business, science, and research communities. Aloha Trace collaborated with the University of Hawaii, the Pacific Urban Resilience Lab, PEARL, and the National Disaster Preparedness Training Center, or the NDPTC, where we took their original survey and worked with them to modify it to focus primarily on tracking the general whereabouts and interactions of those who are feeling sick or unwell. This level of granularity in the data we feel is very important, and we hope to provide the key decision makers in our state with the information that they need to keep Hawaii safe. All information collected is confidential, it's anonymous, and stored in a secure database, and will all be funneled to the University of Hawaii Pearl and the NDPTC for further research and analysis. Right now, the goal is to gather as much data from the community as possible. So we're asking for your cooperation and your participation so we can provide our public health and government officials with the data that they need to help mitigate the spread of COVID-19 in our state. So again, the website is alohatrace.org. We answer 6 questions daily, and everything is confidential, anonymous, and secure. Lastly, I also want to put this out there. If there are other software or application developers out there working on independent projects, please reach out and let's collaborate and coordinate our efforts so we can push things out faster to the community. We have a pretty good HUI in place now, comprised of individuals from different sectors, so please let's work together. Thank you.
So I wanted, before I conclude, to really thank Dr. Dara O'Carroll for his commitment in coming down a second time to talk about masks. And I have to say it was very moving when he showed the pictures of 3 local kids who are now working in New York, the epicenter of this pandemic in the United States. It made me think this past weekend when I read the New York Times, Sunday Times, there was a story about the life of this one nurse who got up at 4 o'clock every day and was sleeping in a different room from her husband to protect him and her family. And how when she showed up at work, when she's writing in her diary, it was to wash down a woman who had passed away during the night, who had shown up about 4 days before, middle-aged woman who came in sick but not real sick, with her cell phone and her laptop and other personal belongings, lipstick, pink lipstick. She went in to help put this woman in a body bag to gather her personal belongings and give them to a family who couldn't go to say goodbye to them. This is real, folks. And those 3 physicians here on the front lines, and there's physicians here who are on the front lines. If you don't wear your masks, if you don't practice good social distancing, you put these guys in danger, and the guys who are here in danger. So I'm really asking you to follow Dr. Dara O'Carroll's recommendations. Now, I wanted to thank Zach Noyles. Zach, I have a picture that he took of Pipeline. There's a lot of beautiful pictures of waves, and this is a guy he's healthy, he's is no one more strong physically, and yet he's practicing good social distancing and wearing a mask. And I want to thank him for putting together and working on Everyone Hawaii. And then Brandon Kurisu and his Aloha Trace. This past Sunday in the Honolulu Star-Advertiser, there was an article in which, just in their crowd sourcing, they found that 25% of the people they questioned felt that they could have COVID-19. And I have to say, every other night I wake up and I cough and I say, oh, I got it, or my throat is itchy, because I'm talking a lot. I got it. And I ask our guys, our managing director, our deputy managing director, chief of staff, and all of us have thought at one point or another that we may have COVID-19. So this information, and I encourage people to participate, is good information in terms of telling us where we are as a people and the fears and concerns that we have. It may not be exactly all totally scientific, but this kind of information put together can give direction to leaders, whether it be a mayor like me or a governor like Ige or doctors or others. So I really want to thank all 3 of the gentlemen who are here this afternoon to talk. In concluding, I can't stress enough testing. We've got to do testing, pragmatic, active, and targeted. Number 1. Number 2, the way we flatten the curve is through quarantine. Quarantine. Protecting our communities, our kapuna, and our homeless. And finally, social distancing here. And that requires physical distancing, but it doesn't mean that we give up on our connections, whether it be through online, whether it be through video messaging, through Zoom, phone calls, or checking in with people virtually. And even when you're out there wearing a mask, I wear a mask when I go jogging. It's a little difficult. I don't get enough oxygen into my lungs and at times. But, I jog in Manoa Valley where I live twice on Saturday and Sunday in the later afternoon. And both days I saw families out jogging, families riding bikes, practicing good social distancing with their masks on. We made eye contact. And we said, we know we're protecting each other. That got me choked up. I felt more connected in Manoa Valley running the last 2 Saturdays and Sundays than I have in a long time, because we all are on the same wavelength of wearing masks and protecting ourselves and our loved ones, starting with our families, our neighbors in our valleys, and our high-rises, so we can come out of this thing quicker. It makes me think, and I was just sitting here listening to the doctor talk. You may be in our winter right now of this pandemic, but we'll come out into our summer, and we'll come out into a brighter, stronger sun if we practice testing, quarantining, and social distancing. Before I open up to questions, I did want to also talk about Waimanalo Bay Beach Park. As you know, we're doing a field there that we've been working on for a very long time. And a couple months ago, we made the plan to begin putting in this field where people can gather. And we started yesterday. And yesterday afternoon, a small upper arm bone fragment was found, about 3 inches in length. It has full breaks in it, so it appears to have been broken at some point down the road. We know it was probably disturbed during the military occupation of this area. As you know, this area prior to World War II and during World War II was very active, and then everything was dismantled, a lot of disturbance of the soil there, and this fragment was discovered. Our work in the area of the fragment was stopped in about 100-foot area around the fragment, and they're going to be meeting today at 2 with folks from SHPE, folks from the archaeological firm that is working for the city and county of Honolulu, along with SOS stakeholders, which we want to have involved in this, to discuss next steps. For sure, it's probably going to involve shoveling and raking of this area where the fragment was found. Perhaps the area around it could be reduced in size from 100 feet to something smaller. But we want to get the evaluation and input of both those who know the most about this issue. We want to honor and protect the EV that could be located in this area. And we want to work with the community and the leaders of this community in terms of making next steps. We'll look for the input of the Oahu Burial Council along with that community, and then make decisions of how to go forward. Right now, construction continues in areas away from the bone fragment, and as we go forward, we'll make further announcements. With that, I'll open it up to any questions you may have. Perhaps if you want to talk about Waimanalo, ask your other questions first. So the folks that are here, our first responders, folks like our Deputy Chief of Police and Captain Lambert can get back, and our docs and others can get back. So maybe first on COVID-19 and then on Waimanalo Bay Beach Park. Thank you.
Okay, this first question is either for Captain Lambert or if Mark Alexander is still here. If we could touch again on the POST program, where will it be, when will it be operational, and how many tents are set up?
Thank you for that question. So the first site is Ke'ehi Lagoon, and right now we have 18 sites available, 18 tents. Capacity would be about 40 to 50 people at this first site. So we actually are operational as we speak, and we're looking to get within Ke'ehi Lagoon the 2 other sites up within the next few days.
And these questions are coming from Christina Jedra. She also asks, who is it for? Is this for only those that are symptomatic?
No, it's actually people that are not symptomatic. So for them to participate in the screening, they have to come in asymptomatic, and if they do develop symptoms within the time they're there, then they will be transported to perhaps Ka'ahi Street or the appropriate medical facility using the CARES call-in line.
So this is different than Ka'ahi Street?
Very much different from Ka'ahi Street. What we want to do is try to provide the homeless an opportunity to come somewhere safe where we can control their ability to perhaps infect the community in the event that they have it and do not know that. So again, it's for a site for them to come, to be safe, to be screened by medical professionals, and in the event they do develop symptoms, taken to an appropriate place.
And this is very short term. Will they only be there for 15 days, and where do they go after that?
So once they've gone to the 15-day self-quarantine, a voluntary self-quarantine process, then we're going to try to identify a larger site where it would have the same restriction as far as being able to come and go, but would be less restrictive in regards to the daily screenings, because they would at that point be considered low risk. That is what we would call blue site, which is a little less risky. And what we're hoping to do is invite our social providers to come out and go ahead and find people that are willing to go from shelter to shelter from that type of zone. Right now, some of our shelter services are apprehensive on taking people directly from the street out of fear of bringing COVID into the shelter. So what we're hoping to do is have the state support and the city support, great support from our mayor, to have a location where providers can safely contact individuals experiencing homelessness and correctly or appropriately direct them to a shelter.
When you say providers, will there be medical personnel on site?
So there will not be medical personnel on site. We are connected with, and we are in talks with Department of Health to perhaps have some mobile screenings being done daily. What we are going to do is we're working with the Kai Street Project to go ahead and use their screening tool, and we're going to train our officers to use them.
Will this facility be mobile like HONU?
It will not. The whole transition from post is for COVID, specifically for COVID. So what we're going to do is utilize the designated post locations until COVID runs its course, at which point we want to return the park back to the community. So when the parks reopen, we'll go ahead and give a 14-day notice for those that are participating, at which point we hope they elect shelter or some type of long-term housing. Unfortunately, if that's not a good fit for them, then we're going to have to ask them to use the park correctly, and it will close and open as normal.
This was part of the $6 million that's being repurposed. Where did that money come from?
So that came from the Ohana House funding. So for something like COVID, when we sought the money from the state, there's no way we could anticipate a pandemic coming around. So the actual funding is just getting us started. It's a pocket of money that the state has been gracious enough for us to repurpose to go ahead and buy the equipment to get these sites. We are hoping that federal monies will become available, and that way the HONU project can be replenished, at least financially, and once we get out of COVID, we can go back to our previous mission.
What was the $6 million originally intended for?
So what it is that original cost for HONU, it was $1 million in equipment, and it was $5 million in operating cost over the course of 3 years. So that's a 1.7 or so million a year to run a 24/7 operation in up to 2 locations across Honolulu. So that service, just to touch on HONU, for those that haven't heard about it, we opened in December, and in 5 months we placed about 300 people. So it's a very successful program. It's unfortunate that COVID has kind of put that program on hold, but we feel that the post will provide that type of connectivity once we add in that screening component.
And where else is the city planning to open these post sites?
So I don't want to cause unnecessary reaction. So there's multiple sites, especially in rural areas, that are being vetted by both the city and state. What we want to try to do is find isolated areas that can be easily controlled, people coming in and out. A lot of the costs in regards to these facilities are the fencing, so that we can appropriately protect the community as well as those that participate from wandering in and out of the site.
Will HONU be closing down now that the funding is being relocated?
Unfortunately, we're going to have to utilize the resources in regards to tents and personnel, so they will be repurposed, and unfortunately we're going to have to go ahead and have HONU cease operations. And again, as soon as we can get out of this COVID pandemic, we would like to return to that project.
And this is from Layla over at the Star Advertiser. The CDC says that by breaking up homeless encampments, you actually cause them to go elsewhere and spread the virus into the greater communities, such as to their families with homes. Are you afraid that you're encouraging them to leave their small encampments and spread infection further? Or are you expecting them to live in those close quarters in the already full shelters with a few tents that the city may have put up?
Right, so it's one of those, how do you answer that question, because it's different for everyone. So the CDC's guideline they basically said they do not encourage breaking up camps without having them without having somewhere for them to go. So it doesn't necessarily say you shouldn't do it. It's just making sure that you have an opportunity for them to go to an appropriate facility. We believe that the post provides that appropriate facility, and we do not feel that we've been in any violation or putting any greater risk on the community by asking people to move into a post. Bear in mind that if we leave encampments where they are, on the people on the sidewalks, I think that it's anybody who's been driving around can see that there's been an increase in Eva and other spots that the city has done a great job at restoring, and because we've had to delay some enforcement activity, we've kind of lost hold of that. I totally believe that once we are appropriate and able to start enforcement and being appropriate, we can improve public health, again, all while being fair to our homeless by providing them a safe, secure location.
The homeless individuals and HPD, those that take part, what does POST require of them?
All it requires is that they are cooperative and that they can move under their own power. Unfortunately, we do not have medical facilities. So what it is for people that can care for themselves and are willing to be compliant in regards to the 15-day self-quarantine. It's no bigger expectation than we have from our residents right now. If you're a non-essential worker, we are asking you to stay home. It's the same thing that we're going to require from our homeless, is that since you don't have a place to go, this is your place to go. This is your safe location to self-quarantine.
And Kathy, could you maybe answer how they can bring their things and store in their pets also?
Right. So the site is very low barrier. You are allowed to have pets. If it's a large, dangerous dog, unfortunately, we're going to have to muzzle them. We're going to have a transport facility. We have a great contractor who is willing to help continue on during this time. So we are able to transport people. We're hoping to perhaps maybe add on some bus services specifically for a route to get people to and from post once they go ahead and complete their 15-day screening.
And this next one is for Chief. In what ways do you plan to increase enforcement of the mayor and governor's orders?
Simply put, like I said, we've been giving warnings. We've given over 5,000 warnings. Now's the time for enforcement. We plan to issue citations, and if that violation occurs with another crime, you may be arrested for the violation as well.
And what behaviors will you focus on, or are you considering for roadblocks?
For ROPA?
Behaviors, that doesn't make sense.
Yeah, I'm sorry. Yeah, couldn't answer that one.
Okay, this is another one for Captain Lambert. Will POST provide food for the homeless?
Yes, so they'll be given 2 meals a day. There are MREs, so it's nothing fancy. It's very modest. We're actually using our current HPD stock, so it would be basically what our first responders eat, which we feel is a fair meal for our homeless.
And could you explain again what a blue site is?
So to get into the weeds a little, what we want to do is Key Lagoon would be a red screening facility, meaning that people do not have symptoms, but we want to go ahead and see within 15 days if symptoms do arise. Once they get through that red screening facility, they'll go to a blue, which they're not allowed to leave the site, but we consider it low risk. So it's basically a combination of 2 post sites working in concert. Again, what we want to do is we want to try to create a location where providers are comfortable with interacting with the homeless community, because there's a lot of unknowns when it comes to COVID. So basically, your first responders will be staffing the red site and making sure that our providers can be comfortable when someone is moved to a blue site and again continue their services there. That was the biggest concern from CDC and a lot of other federal guidelines in regards to homelessness, is the loss of connection to services. We want to go ahead and look at other systems such as the homeless management information system to make sure that providers are well aware.
All right, guys, we are going to be switching gears away from Hawaii since they are in the question answering portion of their press briefing. So we're going to go to the mayor of Los Angeles, Eric Garcetti. He's going to be starting his daily press briefing. Now, here's a look at our numbers again. According to the Johns Hopkins University site, more than 387,000 cases across the United States. Let's go to California Live.
Yeah, exactly. Okay. That's what I try to bring to my daily briefings. So I'll do it, Crystal. Good evening, Los Angeles, and thank you again for joining me. We're back here at City Hall, and I want to thank everybody again at our Emergency Operations Center last night who showed all of you out there what our tireless team is doing every single day to make sure that we meet the challenge of this crisis, of this threat, and of this moment. I'm so honored to work alongside them and to work alongside each one of you who is doing your part, whether it's staying at home, whether it's going to critical work, or whether it's helping each other out. Los Angeles is setting the bar, not just for ourselves, but around this nation and around this world, for the caring, for the cure, and for all the work we are doing together. I know a lot of people have compared this to a kind of sudden shock, a moment like a Pearl Harbor or an earthquake or a 9/11. And yet I think it's not quite the right metaphor, because this isn't about one single day and then rebuilding from it. It's a threat that gets worse every single day, one in which it is tougher and tougher on each one of us. Certainly for me, to share the numbers that I do each day. I know for those that are on the front line in our hospitals, folks that continue to provide us with food and the badly needed things that we need to continue living while we're at home. And so I know that on each one of these days, I don't breeze through these numbers just as data, but recognizing the human beings that are behind them, the everyday heroes who are driving buses and taking nurses to the hospital, the first responders who are there to answer those 911 calls, the doctors and nurses, the janitors who are working in hospitals. Every single one of us has been a hero, and I thank you for the work that you continue to do. Each day, just like the threat as it grows stronger, so does our response. And that's part of what I get the honor of sharing with you each night. That each day, whether it's more testing, whether it's expanding bed capacity, finding new spaces for hospital beds, or the work that we're doing to procure the equipment that we need for our first responders and healthcare workers, we are every day stepping up to the challenge of this and outpacing, hopefully, what this virus is doing. Each day you stay at home, you cripple this virus a little bit more. Each day we continue to grow the work that we're doing in government with help from private sector and philanthropy, everyday donations from folks like you. That helps us get ahead of the virus and look at each day with a little bit more hope. We know that each day we meet this threat is with hope and resolve, with love and with determination. So let me jump into the questions we ask each night. We ask those basic questions. How will we help each other get through today and through tomorrow? What about the anxiety around our paychecks, the rent, access to medical care? And how can we protect public health and public safety? And ultimately, how do we save lives? That is the most important question we try to answer each night. Tonight, I'll be joined by another one of the amazing field marshals in this effort, Gene Soroka, who is over here to my right, a great friend, somebody who has represented all of you, leading the busiest container port in all of the Americas, somebody who has an incredible set of experience, a breadth of experience, and a depth of knowledge to help us get our hospitals and our first responders and all of us the goods that we need to win this fight. And you'll be hearing from him in a little bit. But let's start today, as I always do, with today's data snapshot. Today was the worst day of this pandemic in our nation. Today, more people died of COVID-19 in the United States of America than any previous day. At least 1,632 of our fellow countrymen and women. And I want to send my love to everyone across this country who is grieving, from here in Los Angeles and across our county, across California, and across the United States. And of course, this dreaded virus unites us across borders, something that we know about here in this diverse city. But today it's estimated that more than 7,000 people across the globe lost their lives to COVID-19. Here locally, we added 550 confirmed positive cases of COVID-19, a 9% increase, bringing our numbers up to 6,910 confirmed cases. This was the third highest number of cases in a single day. And as I shared last night when we had just a 7% increase, a great number compared to what we've had before, I said take Monday with a little bit of a grain of salt. But even on Tuesday to see 9%, that's decent news. We don't want to see any increase, and we can't wait for the day when we actually see a decrease. But for now, it shows that the double-digit increases of just a week ago and the 20+% days that we had just 2 weeks ago have now been met. Here in the city, we increased the cases by 279 confirmed cases to a total of 3,130 cases. You can hear in the background the fire engines and the great first responders who are often the first ones to respond and to transport these cases. That represents a 9% increase here in our city, and we have 22 deaths, unfortunately, to report today in Los Angeles County, our second highest number. That brings the total number of fallen angels here in Los Angeles to 169, a 15% increase. Simply put, we are doubling our deaths still every 4 days. So for anybody who thinks that our work is done or that we can see that light just in front of us at the end of the tunnel, we still have a way to walk together, and I need your help. We're discovering more about COVID-19 every single day, and today Dr. Ferrer shared some very important information about the racial breakdown of the deaths in LA County of victims of COVID-19. And early data on deaths shows us that no group, no age group, no gender, no racial, ethnic, religious group is immune from COVID-19. But like many things in our society, this disease, especially the way it kills, is hitting folks with pre-existing conditions like diabetes, obesity, and other conditions disproportionately found in poor communities and communities of color the hardest. And second, based on initial data, the virus is disproportionately killing African Americans here in Los Angeles County. A reminder that while this virus has narrowed our sights on the immediate challenge before us, long-term racial disparities still exist. And while this is a virus that certainly doesn't pick who it infects based on the color, the effect that it has on our communities can be disproportionate. It's not just here in Los Angeles. In Chicago, Black Americans account for 68% of the city's 118 deaths, 52% of the roughly 5,000 confirmed coronavirus cases, despite just making up 30% of that city's population. Here it was 17% of the deaths in a county where African Americans are 9% of the population. And in Michigan and Illinois, two of the earliest states to produce such data, African Americans account for about a third of coronavirus cases and about 40% of deaths, even though they make up just 15% and 14% respectively of those states' total populations. And while we know that this reflects some of the pre-existing health conditions that are disproportionately affected in our communities of color, the Loyola Marymount University poll that I mentioned a couple times and whose final results we'll be looking forward to sharing next week, it showed something very interesting as well, that just 21.7% of African American respondents were very worried that they or a member of their household would get the coronavirus. And that compares to 35% of the population at large. So let me be very clear. We need every community to understand that this will affect you. Every person. If you're young, this will find you and can kill you or a loved one. If you are strong, this can find you or a loved one and kill them. And no matter what community you live in or come from, this is a threat to you. As we prepare for the peak, we continue to do the good work, though, of making sure across our hospitals and in new spaces that we have the necessary bed inventory to meet that peak. Today, I'd like to report we have 1,406 beds available in our general emergency hospitals. 258 of those are ICU beds. We have 1,010 ventilators that are ready to serve people who need them. And we also have, throughout Los Angeles, many hospitals that are stepping up to move beds around, create new spaces, and to make sure that they can meet this threat. There are 30,000 tests that we will conduct through our drive-through centers by the end of the week, on top of the 31,000 that were done in our providers and 21,000 that we have done to date through our drive-through centers. This is a good number. I was doing the statistics earlier today. If LA City were an independent state, we would be ranked 4th in the per capita tests, just behind New York, Louisiana, and Washington. LA County would be in the upper part of the middle part of the pack. We need to do better, and my goal is to get to the very top of that, to keep adding as many tests as possible. And I want to thank so many folks who signed up We had a record number of sign-ups since we announced yesterday that anybody with symptoms, and that's very important for me to state again, because some people said, oh, anybody can sign up. No, now it's anybody with symptoms can see whether there is a test available, and we've opened up the aperture to allow more folks to have them. But we're finding something interesting I wanted to share with you, that about 15 to 20% of people aren't showing up for their appointments. So if you are turned down at night or in the morning, check in again midday or in the early part of the afternoon, because we have the capacity to serve more people. And we certainly don't want to have one single test that's available that day wait until the following day. As always, you can go to coronavirus.lacity.org to find /testing, to find out whether you can get an appointment and get a test right now. We also need to protect those workers that are on the front lines, the everyday heroes that I mentioned, that are in our grocery stores and pharmacies, people who are out there working hard so that we can get the food and the medicine that we need to get through this. And that's why we're reserving, though, N95 and other medical grade masks for our doctors, nurses, medical personnel, and other first responders. But tonight, I am putting forward an order, a worker protection order, to give our non-medical essential workers more tools to stay safe and to keep us all healthy. Starting this Friday, April 10th, at midnight, Thursday night, Friday morning, all employees of many non-medical essential businesses will be required to wear cloth face coverings over their noses and mouths while at work. Employers are required to provide these face protections or to reimburse employees for their costs. This applies to workers in grocery stores, drug stores, restaurants, hotels, taxis and rideshare vehicles, and construction sites, among others, the other essential businesses. And they will soon have the protection of these cloth face coverings. We wanted to wait until these were available. We can see people now selling them on corners, online. Our capacity, thanks to the amazing apparel industry here, has expanded, and people can buy them online. I'll get to that a little bit more in a second. These businesses that we are singling out as well must also make sure that their employees have access to a clean and sanitary restroom, along with proper cleaning or cleansing products like soap and sanitizer, and allow their employees to wash their hands every 30 minutes. They're required to implement physical distancing measures as well for customers, visitors, and workers. We're also encouraging all essential retail businesses to add plexiglass barriers between cashiers and customers. We know there isn't yet enough plexiglass to go around, but we do hope to work to get as much of that as possible. Right now, this is an encouragement that we hope that employers will adopt. And every Angelino will share this responsibility with employers to keep workers and everybody else safe, which is why we are requiring customers to wear face coverings when they enter those businesses that I mentioned. If you're shopping for groceries, if you're picking up your prescription, or visiting any other essential business, you will need to cover your face. And if you're not covering your face by Friday morning, an essential business can refuse you service. And I want to thank the leaders who have been so instrumental in helping us get to this worker order. Many people worked on this. Councilmember Herb Wesson, Curran Price from the City Council as well, both who are an amazing team, together with John Grant, who leads the United Food and Commercial Workers, Local 770. Ron Herrera, who leads our Los Angeles County Federation of Labor, the California Grocers Association, who you've seen me stand with before, and workers at essential businesses across Los Angeles who go to work every day so that Angelinos can stay safer at home. We consulted and got feedback from Dr. Ferrer on this from Los Angeles County, and as always, I've included Supervisor Barger in this, and I know mayors like Mayor Garcia in Long Beach are also looking at the same language so that we can do this across LA County together. So cover up, save a life, it's that simple. My LA Protects Manufacturing initiative has seen a surge of interest from garment manufacturers across LA. As of today, I'm proud to report we have 800 companies that have signed up, and 384 local companies have already been approved for operations to meet the needs of the public for face coverings, and the more than 600 essential businesses that have requested 911,000 non-medical masks through this effort. My team has sent businesses a database of LA Protects manufacturers so they can source here locally, spend those dollars that we need to help our economy in this tough moment, put workers back to work right here, safely distanced, but in our garment industry. And we've started directly matching larger essential businesses to manufacturers. Major grocery store chains are working with Use Drive Manufacturing, which is producing non-medical masks and other items for local hospitals. And we've connected other essential businesses like La La Land, Nana, Upcycle LA with those folks that need masks as well. And they have the capacity to produce over 400,000 non-medical masks that meet the specifications that Kaiser Permanente helped us develop. That means restaurants like Sweet Green, essential stores like Home Depot, non-medical staff and patients at California Hospital Medical Center can now place an order directly with a manufacturer to get the masks that they need. We know that there are a lot of small businesses and individuals that are looking for a way to buy non-medical masks too. So if you are in need, please go to coronavirus.lacity.org/LA Protects. LA Protects isn't just about protecting people in essential industries. It's also about making sure that we can protect those who are unsheltered on our streets, and we put a strong emphasis on trying to get these face coverings onto the streets of LA where our most vulnerable, unhoused Angelenos are. Today I can report that one of our local manufacturers, 2Bs, who I want to give a special shout out to, has produced an initial batch of 2,000 non-medical masks to help keep unhoused Angelenos and outreach workers who work with them safe. Thank you for that. And the first 2 orders of non-medical masks were delivered last week, and Let's Go Uptown Apparel, another LA Protects manufacturer, is on track to produce 30,000 of these to be delivered on Friday to LASA, to YMCA, and to other homeless service providers. And finally, let me thank Reformation, who's been the lead company in really helping us do LA Protects. You've been extraordinary, whether it's developing specs, helping give advice to other companies, or marshaling this incredible network we have of manufacturers in LA. You have been absolutely incredible. We're using every resource at our disposal to keep Angelenos safe. And so now I want you to hear a little bit from Jean Soroka. As I mentioned last week, I asked Jean to step up to a special and absolutely critical role, to be for the first time our city's chief logistics officer. We've all heard the stories across the country of people battling it out to get masks, to get equipment, to get some of the ventilators that we need. All of these things have made it difficult for everyday hospitals, businesses, frontline workers to get what they need. And we wanted to ensure here in Los Angeles we are taking advantage of the brilliance that we have from Jean, from longshore workers, from logisticians, from folks that every single day provide 43% of the goods that come by sea into America through our joint ports of Los Angeles and Long Beach, to apply that brilliance to this challenge. So not only did we appoint Jean as the Chief Logistics Officer for the city, he launched a new business-to-business website as part of Logistics Victory LA, our campaign to get us what we need to fight this battle. And that's at coronavirus.lacity.org/LOVLA, like love LA without the E. So, Jean, why don't I turn it over to you to share with Angelenos what we're doing to make sure we have what we need to fight this fight. Thanks, Jean.
Thank you, Mayor. The Love LA site, which was launched today, will bring together hospitals and their specific needs, manufacturers and suppliers with what they can bring us here to our medical frontline folks, as well as what we are building in the city of Los Angeles as a stockpile of inventories. As an example, right now in LA City, we're using about 1.6 million of these N95 medical grade masks per month. In the county, it's more than 3.5 million. And our job, starting right away, is to bring more of those masks into the pipeline and build our own stockpile right here in Los Angeles. So this marketplace of sorts will be built and designed by the medical community for the medical community. And that leads us into the next area of how we're building this stockpile right now. With Mayor Garcetti's offering and the blessing of the Los Angeles City Council, we have now compiled $20 million to begin purchasing these crucial medical goods. And not only the masks, but we're looking for ventilators, exam gloves, face shields, and so many other products that are critical to our frontline medical personnel. And that starts with an order I put in, working with our General Services Department and the best buyer in the business, John Trivgoda, to get 1 million masks on the ground by the end of this week. And they will be distributed through the Love LA website to those hospitals that are in the greatest need to begin with. And that procurement is going to be very important because we're looking for other channels to to be able to bring those products in, and using the great power of the city's buying and purchasing capabilities is really where we're going next, to amp up those decades worth of relationships with our vendors and suppliers and have them focused in this particular area of the medical supplies. And our job is to expedite the goods. As the mayor mentioned, with the Port of Los Angeles and LAX, we have a keen line of sight through our technology as to where these medical shipments are. We can highlight them and speed them through our system right to our hospitals, emergency management folks, and critical care units. Those highlighted shipments will move through as quickly as possible so we can, again, keep building stock right on the front line. In addition, we're also looking at how we can bring new companies in and working specifically with the California Manufacturer and Technology Association led by Lance Hastings. We have companies that are retooling their plants and their production flows to get into the medical supplies business. So we've looked at an omni-channel take on our supply chain and what we can bring in, and hitting the ground running with so many folks that are chipping in right now, Mayor. I think we're off to a good start, but there is so much work to do to realize our vision.
Well, thank you. I hope you can see why I've always been so impressed with Gene Soroka. For those of you who don't see the studio here, that was no notes, no teleprompter. That's just off of his head, and he has done an extraordinary job marshaling these resources, bringing the brilliance that we see every single day at the port. And as I mentioned, we can do all the work in the world, but if it isn't for those longshore workers, those truck drivers, warehouse workers that are doing the work when those ships arrive, we couldn't get anything done. So big shout out to ILWU and the Teamsters and our truck drivers and everybody getting this work done. Finally, let me turn to two other last things. One is we saw finally with federal action that our federal government has brought some help to everyday Americans. The Families First Coronavirus Response Act was passed last month, which expanded unemployment benefits, it increased food assistance, it guaranteed free testing for uninsured Americans, but it also expanded paid family leave for our workers, allowing people who are 65 or older are required to quarantine or caring for a parent or child to take paid time off. But there is a major gap in the policy. It only protected businesses that employ between 51 and 500 people. In other words, Congress came up with a solution that excludes about 80% of American workers. And so now that responsibility falls to us, to fill the gap and to extend those protections to all Angelenos. That's why your city council passed an ordinance to deliver those same benefits to Los Angeles workers and businesses with more than 500 employees, allowing tens of thousands of folks to stay safer at home. These workers will receive 100% of their wages for a maximum of 10 work days. And I'm grateful to the council for their swift action on this. And especially I want to thank Council President Nuri Martinez, who led the charge. Her dedication to our city's most vulnerable is incredible. And I want to thank the entire council for leading with compassion, clarity, and courage. Building on this action, I think we can do even more to protect jobs, workers, and businesses. And as it is currently written, the ordinance doesn't credit many of the businesses that already have very progressive policies in place. It could also cause many chain, non-franchised restaurants to close and create some staffing shortages in critical industries, especially our hospitals and medical care workers. So I will be enacting an emergency order to fill in the gaps of the ordinance, and then I've been speaking to Council President Martinez, and we'll make sure that those both harmonize in the days ahead. And I look forward to that work and thank the council again for their leadership that has been the most progressive in this nation. Finally, I know that these days for all of us are not just difficult days, but traditionally these are very special and holy days. For many people of faith in our city and across the world, we're entering a holy season. Tomorrow is the first night of Passover. This Sunday is Easter Sunday, and Ramadan starts just in 2 weeks. And these are the days that we gather together to pause our lives, to spend a moment with our loved ones, and to reflect on what our year has been, to renew our faith in each other and in God, and to spend time together. This year, it's going to be very different. Seders are going to be done virtually or in small numbers. Easter Sunday won't be in church. And the iftar, breaking of the fast during Ramadan, won't be done in big community gatherings. I know that this is hard. And these holidays are moments when we're supposed to unite with our communities to find a sense of hope, even in these darkest of moments. Whether we are people of faith or hold no faith at all, I hope each of us can take meaning from what we are going through in this moment, that we need each other, that it is the connections between human beings and to something larger than ourselves that will help us light through the darkness. Exercising our freedom depends on taking responsibility for one another. So while that freedom often means being able to go out and celebrate, to go on a hike or to the beach, to gather at these holy moments, this year, those will be more private. But we can look back just as the stories of Passover teach us, and the story of Easter teaches us, and the time of Ramadan allows for us, to know that this is a time of redemption, a time of rebirth, and a time of sacrifice for each one of us, that we will be able to look back and say, we did something to save the lives of our family members, of our neighbors, and of our city. So right now, let's celebrate apart. And I wish you all the blessings as we begin these holy days. I hope that those blessings may look down on us to keep us safe and to keep us strong. And so as always, I say, let's do our part. Stay healthy, to stay safe, and to stay at home. Strength and love, Los Angeles. Thank you all. And now we'll take some questions. First question, please.
Question from the line of Mary Beth McDade with Channel 5 News. Please go ahead.
Hey, Mary Beth.
Hi, how are you?
Good, hanging in
I
there.
just turned on my TV here. So I'm looking at the IHME model that you were referring to yesterday out of University of Washington.
Correct.
And I'm just a little bit confused because as I look on here, I see that they're saying that California, state of California, that it's 7 days until peak resource use on April 14th, meaning that's going to be the peak day that we're going to need all these beds and ICU beds and ventilators. And then they're also saying that we're 10 days out until the peak projected day of the most amount of deaths on April 17th. So I'm just confused as to why I'm hearing other numbers from, I was watching the governor's press conference and the counties, and they're saying that it's going to be more in May, possibly June.
So projections are just that, Mary Beth, and there's a number of really excellent people who are working across the country, and so each one is just one snapshot and best estimate. Even those estimates, for instance, changed 4 days from an earlier estimate on April 2nd. So these are very fluid, very dynamic things. The data that the governor's projections are using do say that it will be later, and I tend to think it will be later. This is not just looking at California. This methodology was looking at all 50 states, and you can pull any one state out of their methodology. And remember, an average of a state doesn't necessarily say what will happen here in Los Angeles. Northern California had a bigger outbreak earlier than we did, so I expect ours to lag a week or two. And I think when the governor's talking about that, he's talking about the entire state. I haven't heard projections that go into June yet, but there are many that do push into later April or beginning of May. Truth of the matter is we won't know till we get through those. And as we've seen in certain places, deaths can lag because people get sick and obviously are sick for a number of days before they die. So we could have a peak in cases, or the day that has the most new cases, be earlier than the day that we have the most deaths. But there's no question, too, that the peak is not a day, peak plus one, in which everything is rosy. It's still going to be the second or third worst day. We might see it beginning to come down, but just as this built slowly, it can also go down slowly and will require us to have the discipline of a number of weeks. We try to look at this data all the time, and we're working with a number of sources to see if we can have a specific LA County projection. So hopefully if we can get that by week's end or the beginning of next week, we'll be able to share that with you as well. There's a lot of different things that go into this and a lot of things people still don't know about the coronavirus. So each model has to make assumptions that are not 100% medically correct yet, that are about how many people are spreading, what's the doubling rate, the impact of weather, all sorts of things go into these models. But the University of Washington one has very sound methodology. I would say if that is one of the earlier ones and you have later, it's a law of averages. We can expect that sometime later in this month or the beginning of next month, we will have a peak. And we should be acting like every day is the peak. Today, you should act like a peak. We heard Dr. Ferrer saying this is a good week to not head out because this is certainly when we are beginning to crest. And whether that comes this week, next week, 2 weeks, or 4 weeks from now, we should be prepared to know that this is a very critical week and stay at home as much as possible. Thanks, Mary Beth. Next question.
Next question comes from the line of Robert Lasik with NBC. Please go ahead.
Hey, Robert.
Mayor Garcetti, how are you?
Good. Hanging in there.
This has nothing to do with a timetable, but earlier today, the Los Angeles Department of Public Health told us the plans are underway for reopening, but it will be, and I'm quoting here, a gradual lifting of restrictions that will come about from this emergency order. So for those hoping to get back to work, open their businesses, open their restaurants, etc., can you elaborate what this gradual lifting of restrictions means and what this return to normalcy is going to look like in the beginning?
Sure. And I don't want to speak for the Los Angeles County Department of Public Health, but I know they're planning for. I don't think that they have a set series of dates. There's no secret room that we all go into and we have dates that we're not sharing with folks. I'm as transparent every single night with all the data that I get with everybody out there. But we are preparing, whether it's cities or the county, for, as I've told people, this is not going to be a light switch that suddenly goes on and everybody comes back to an economy that is exactly the same with as many workers and everybody comes out of their homes simultaneously. There are going to be those that are still more vulnerable because of pre-existing conditions, because of age and other factors, where there may be recommendations from county public health to continue staying at home, while other workers can head out. Now, an important part of that is our serology or blood tests. Those tests that allow within 15 minutes or less to see whether somebody is carrying the antibodies that show that they've had COVID-19. It's not necessarily a good test for finding out if somebody has it right now and is infectious. That's still the swab-based test that we're doing. But these ones would allow us to know somebody who might have not even known that they had COVID-19, but now have some built-up immunity. And that will allow us to take the advice of Los Angeles County Public Health and say some people can return. Or maybe we've been able to not just bend the curve, but flatten it down so much that most people can return to work. So we are preparing for those and starting just the initial conversations of how that could be done, watching places around the world from China to Italy to others who have either done that or are talking about that, because we do want to get people back as soon as possible. With this last caveat, as I shared last night, look at history. And a lot of places that did a good job in 1918 with the influenza epidemic, one of them was just up the coast, San Francisco. They patted themselves on the back, went back to everyday life quite quickly because they had pushed down the cases dramatically. And they saw a second surge almost right away that killed, I believe, almost as many people as the first surge. Los Angeles was a little bit more conservative in 1918 and waited longer, and we didn't have that second surge. So I think it is really important that we be conservative, but that we also acknowledge there will be steps, not just one day when suddenly the economy just flips back to where we were before. Thanks, Robert. Next question.
Our next question comes from the line of Lee Ross with Fox News. Please go ahead.
Hey, Lee.
Yeah, good evening, Mayor.
Good evening.
My question kind of follows up on those two, hopefully well, I think. It was a little more than a week ago, Mayor, that you asked Washington to issue a nationwide shelter order. Now, while that hasn't happened, it's true that most of the country is now staying at home. And at that time you said, and I'm quoting you here, this virus is nasty, it will cross borders, it ignores states, it is no longer about containment, it is about a uniformity of action. When it comes time to reopen, is it your assessment that the best way to effectuate uniformity of action is for a national call to reopen, even if it's later than some communities, perhaps Los Angeles, may want?
Look, I think we would all benefit from more uniformity at the national level and even at the global level. The World Health Organization was very clear with its warnings with COVID-19, but too many nations ignored that or didn't take it seriously enough. We need to strengthen that at the international level so that when we get guidance, it is something that countries around the world uniformly adopt and take measures against. Second, we need that in the United States so that we don't have the unevenness that we've seen where some people decide it's political, it's about your party or your geography or other things. A virus is not a political thing. A virus is a medical thing. And there's no question when we get back to restarting the country that national guidance would be very helpful. But it's also going to be about capacity. And I would love to see our nation's leaders help us not try to get the exit do the exit on our own as we've had to deal with the onslaught too often on our own. We've had to figure out how to do testing here locally. That's kind of crazy. I have firefighters and paramedics who are standing in the rain as people drive through on city facilities with tests that we bought instead of there being national leadership on that. We have states that don't have the resources, and they're going to be hit even harder than those of us who have doctors and hospitals, especially in rural areas. So we've been on our own at the beginning of this. But wouldn't it be marvelous on the outset if they said, nationally, we have helped get 350 million tests, blood tests, so that we could all know whether we've carried this, have kind of immunity passports so that people were then permitted across the country to go back to work, to go back to school, if they had that side of immunity. That's the sort of leadership that I'm absolutely looking for. But if other places don't provide that, specifically Washington, and we have capacity here, we will, as we've had to go in many parts of this, go it alone. But I think public health folks have been very clear that don't open up your city early just because you're doing well. This virus can come back, and it can come back with a fury. So we need America to do well. We need America to get through this together, and then the whole globe. Because as we've seen in China, people returning can also spike this back up or threaten to spike it back up as well. Thanks for the question, Lee. Next question.
Next question comes from the line of Emily Albert-Reyes.
Hey, Emily. How are you?
Hi, Mayor. The audio cut out just as you were describing what the change was that was being made on paid leave. Can you repeat your announcement and
Sure.
explain if there are already changes to what the council approved, why you're making those changes?
Sure. We've done this in conjunction. I spoke with Council President Martinez. I think there was some stuff, as I said a couple days ago, that was done quite quickly. I'll give you one example. There are a number of employers that already give this kind of paid leave, and they said, oh, if I already give 30 days of paid leave, does this mean I have to do 2 more weeks on top of that? And I think all of us agreed, of course not. Those have been good actors and who already provide this for their employees, they shouldn't be cut out. There's other things as well with some industries that are really on a razor's edge that have made it clear not only would they not be able to give this to anybody, they would go out of business. And so we've clarified that it's for folks that are 500 employees and larger, who have at least 500 employees in the city of Los Angeles, or above a certain number of total employees nationwide. So some of it is just the fine-tuning of that. I think we've all agreed that those are necessary, and the easiest way, since the council couldn't take that up, given the Brown Act requirements quickly, I'm putting that into an order, and then we will make those things harmonious together. Do you have a follow-up on that, or is that clear? Okay.
Next question.
Thank you. Next question.
Hi, Mayor. Good evening.
How you doing?
I wanted to ask about homeless encampments. I took a drive around the last couple of days, and I'm noticing there's still, the 3 that I noticed in the valley, in the San Fernando Valley, are still have large groups of homeless folks all together.
Yep.
And I'm wondering if you're having any success reaching out to these people, because it seems as though that they seem to sort of be kind of isolated from what's going on.
Yeah.
Also, I'm being talked to by my other people. Hold on. So the other question was about the bus drivers. We're being told by some of the bus drivers, we interviewed 2 bus drivers that said that they are really in fear for their safety and their health because of not getting enough protective equipment and protective gear. And so can you tell us what's being done in terms of mass transit to help keep those people safe? Thank
Absolutely. Let me start with that, and I want to thank our bus drivers, our train operators who are doing incredible and heroic work. I stopped in at a safe distance with my mask on and his mask on. I was talking to a bus driver on the street on the way to work yesterday. They're proud of what they're doing. There's an amazing video I think that Metro put out that shows heroes don't just wear surgical masks in an operating room. They sometimes drive the bus and take those hospital workers there, take people who are feeling sick to a hospital because that's the only transportation that they have. We've enacted a number of things, and at Metro there is personal protective equipment. I know there's worries of some whether there'll be enough. That's exactly why we have Gene Soroka doing what he's doing. This isn't just for city workers. This is for public employees, for our medical workers, for folks that are working in our shelters and other places that are vulnerable, to make sure everybody has a steady supply throughout this. And we will not leave our bus drivers behind. We will not leave our train operators behind. And those folks that are out there cleaning the stations, cleaning the equipment each night are also our heroes too. Those people are doing critical work. So we feel confident we'll be able to get that equipment for them in future days, that we have it now, and that we're being smart about rear boarding and things like that. We will not cut off public transportation. It's too critical for people who need their medicine, who need to go to the store, and who need to work as critical workers. But we have also downsized the number of trips that are taken, the hours, so that we're allowing more of those workers to work fewer hours, which also helps protect them from any dangers that they have. In terms of the first one, the homeless encampments, as you know, this is, county-wide, 60,000 plus people. So of course, this isn't, again, one of those things you snap your finger and it's done right away. But yes, we're getting very good results. Every shelter that we open is 95% filled within a day or two. The first couple of days there was hesitation. Now people are really coming in. One man who said, "This has been better than anything I've seen. I'm someplace safe. I know that I'm protected. I get my temperature checked twice a day. There's food. I know that there's somebody here who is a medical professional. And where we found anybody who's tested positive, we're able to immediately put them someplace with medical attention that's secure and isolated and quarantined. That wouldn't happen on the street. But the real solution to this is going to be, even as we've opened now 20 shelters and 4 more open this weekend, is going to be these hotel and motel rooms. And we have simply got to go quicker. I think the state is well-intentioned, the county is well-intentioned, LASA is well-intentioned, the cities are well-intentioned, and many of the hotel and motel operators are well-intentioned. But if it requires a more aggressive stance and requires some of the emergency powers I have to commandeer those rooms, we need to get people into those thousands of rooms today. So I would encourage any of the hotel and motel operators to continue helping us. There were 900 rooms last week. We're probably over 1,000 now. But those are the ones that will help quarantine people who are positive, who are on the streets, and also take people to a safe location who are at a risk of getting coronavirus, the novel coronavirus. So both of those are going to be just a giant lift. And one last point I'll make is I certainly hope, after I called for a FEMA-like response to homelessness over 18 months ago, and now because of this crisis, we're finally getting it. Our federal government, thank you, for the first time is letting us pay for and get reimbursed for putting people in hotel rooms on the streets before the crisis hits them and before they are positive. We need to make sure that that federal assistance helps us make exits from our shelters and from our hotel rooms to housing, so that these folks don't just go back to the street. Because while we're looking at statistics that maybe the number of deaths could have doubled in this crisis, I think we won't get that high, but could have doubled for all of us this year, living on the street, you already have a double chance of dying. And if we're not looking at that as a public health crisis and not bringing the resources after we get through this one to our unhoused brothers and sisters on the street, we will have failed to take advantage of this moment and to do what's right. So I'm hoping that we will see that kind of support. Next question. Thank you.
This question comes from the line of Claudia Kashuda with KNX News Radio. Please go ahead.
Hey, Claudia.
Hi, Eric. I think you touched upon this in your last answer, but there's a delay in the live stream. And
okay.
So I missed some of it. But we keep seeing reports from people, including Judge Carter, that hand washing stations don't have soap or water. He and others are raising concerns about an outbreak on Skid Row. We're seeing a growing number of positive cases among homeless people. And I know that there are ongoing efforts to negotiate deals with hotels and hotels and that they're opening emergency shelters. But we all know there's still nowhere near enough rooms or beds to get tens of thousands of people off the street. So if there is a big outbreak on Skid Row, worst case scenario, what is the plan? What action can you immediately take to get large numbers of people off the streets quickly?
So the more beds that we have, the more that we can do that. And I think there are actually plenty of rooms. We have tens of thousands of rooms in our hotel and motel inventory across this county. The goal that LASA set and that we've supported as well is 15,000. That would be unprecedented. And we were spending 18 months to build 2,000 new shelter beds, and that was the fastest pace in the nation. Imagine doing 15,000 hotel and motel rooms in just a matter of weeks. That's the stretch goal. I believe that it can be done, but we need everybody to be aligned, and we need almost a czar who is making these deals every single hour to ensure that they're there. That said, for Skid Row, absolutely, we've been looking at this from the beginning. The convention center is available. We have the 250 kind of field hospital 250-bed field hospital that'll be there, but we have another hall that we absolutely could move people to, and I'm looking for more hotels and motels near Skid Row in the downtown area. So we're hopeful. We've had a lot of people reach out. 600-person bed hotel reached out today to us about that, saying that they'd like to help out in the short term and maybe even the long term. So I do think that the inventory is there. This really requires faster signing of this from the state and county. We're here to help in any way that we can, but that will be what we do. The last piece is testing. And remember, yeah, you do see some new positives. There are more people who are housed proportionally and in absolute numbers with COVID-19 than those who are unhoused. So we have to continue to work with those doctors, those clinics, those places, including a number on Skid Row, and we brought and bought tests for this area that now are in their hands this week. There are some that were done today, so that we can make sure we see what the incidence is, and anybody who has symptoms, we can find out whether it's COVID-19 or something else. So bottom line is, this is an area since January that I've kind of been screaming for attention. I'm really glad that we've gotten millions of dollars from Sacramento and millions of dollars from Washington, D.C. Now it's about executing it, and we're here to help our Homeless Services Authority do that. Thanks. Next question.
Next question comes from the line of David Sennheiser with Los Angeles Times. Please go ahead.
Hey, Dave.
Hey there, can you hear me?
Yes, I can hear you great.
Great. So you issued this order on face covering for grocery employees and the customers who walk into those businesses. But can you talk a little bit more about enforcement? We're wondering who's going to be policing this, if it's the LAPD, how many are assigned, what are the fines, if any, for violating the order? And finally, you said businesses can deny entry to a customer who walks in without a face covering. But given that so many businesses, particularly restaurants, are still hard up for revenue, is that going to be an effective way to ensure compliance?
We think everything helps. Our idea is not to be arresting and fining people for the face coverings. Just as tomorrow, if everybody decided to jaywalk across the street, we wouldn't have close to enough law enforcement officers or city workers to stop everybody from jaywalking. So this is about self-enforcement mostly. But we do have something called ACE, which is a civil citation. And if we see places in which the workers are not doing this, or a worker is saying, my employer simply won't do this, those are referrals that can be made to the city, and we will be able to go out there and issue citations. But 99% of this, like most of the things I've said, are about our own discipline and our own self-enforcement. We're not, arresting people when they're on the streets, asking for their ID and saying, are you a critical worker, or are you permitted to be outside? We're relying on people to use their judgment, to use their own self-enforcement. And the miraculous thing that happens is when you ask people to do that, they actually do step up. We have been unafraid with businesses and others to prosecute, to be able to take folks out, but it's graduated. And we're not going to, one time, because somebody isn't doing something, go after them, fine them, or throw them in jail. We're going to help educate people, help let people know where they can get these masks, let them know about the website, let them know their rights, but also let them know their responsibilities. And we hope all Angelinos will step up and be a part of that. Looking at best practices around the country, that seems to be the best and the most realistic way to move forward. So we want people to abide by this, but it's going to be up to you in 99% of the time. Thanks, Dave. Next question. Hey, Adrian. How are you?
Good evening, Mayor. Just to follow up on that question, with this order going into effect on Friday, could catch some people flat-footed. Any consideration to, especially outside of pharmacies, having a point of sale for face coverings so that people would be able to get them there if they didn't have them?
Yeah. So there's plenty of places to get them now, whether it's folks that you see used to sell flowers or still are selling flowers. You see them on corners right now, on off-ramps. You see them online. And the LA Protects website that I mentioned, so that's coronavirus.lacity.org/LA Protects, shows places that you can get them online today. We wanted to wait until we knew that there was capacity. We feel confident that there is capacity. Instead of announcing, like a lot of other orders, this starts tomorrow, it's giving us a few days before it comes into effect. And we think that's the responsible way, and we're confident that people can get. In fact, even since we suggested it, just drive around the city, it was night and day. It wasn't 100%, but it was over 50% of people that I see in those environments. And to be clear, because a lot of people get confused, it's not when you're jogging by yourself, it's not if you're not coming within 6 feet of people, it's when we go to these environments, our grocery stores, when you might be in a taxi or ride share, when you're at a pharmacy, a construction worker, these critical places where we do come into contact with each other, that is a place where we now are telling you have to wear, and those workers must wear also a facial covering. One other note that Dr. Frere has also pointed out too, though, is be responsible about how you use them, because there's a lot of people who don't understand. Wash them at night. Don't just put them down everywhere, because you can actually pick up germs if you just put them down on surfaces when you get to work or other places. Treat them, like that you need to keep them very secure and sterile as much as possible, and then use them just in those environments where we've advised. It's not something you have to wear all the time. And I've seen a lot of people who, are walking by themselves just in the neighborhood wearing a mask. That's certainly fine, but it's not something that's mandated nor something that you need to do. And one last thing I'll say is, though we have said for folks that are using facial coverings, please don't take those N95 and surgical masks that we need. I do want folks to know that there are people who are immunocompromised out there, the general public, who do need to wear those masks. So if you are healthy, don't use those. But of course, if your doctor has told you to wear those, don't go after somebody at a grocery store who's wearing an N95 mask and say you shouldn't be wearing that. You don't know whether or not they could be immunocompromised, and they're doing that for their own protection. Thanks. Next question.
Next question comes from the line of Clarice Medinilla with Asian Journal. Please go ahead.
Hey, Clarice.
Hi, good evening, Mayor.
Good evening.
Earlier you had mentioned a very important part of this virus is that it doesn't discriminate against age, gender, or race, but as everyone within the Asian American community are acutely aware of at this point, the Asian community have been targeted in acts of hate and discrimination related to the virus at a very alarming rate. And we know about the 211 county hotline, but are there any resources or initiatives that the city has or is organizing to help people report this activity to mitigate this uptick in anti-Asian discrimination?
Absolutely, and this is something I've mentioned in other nights, and I'm really glad you raised it again, Clarice. While this virus doesn't discriminate, human beings still do, unfortunately, and we saw this early on when people weren't going to Asian and Pacific Islander-owned businesses. We've seen it in hate crimes across the country. People have been beaten up. People have been yelled at. Hate crimes are hate crimes, and so the biggest resource is the Los Angeles Police Department if you're in the city of LA, the sheriffs if you're in the county or one of the cities that use the sheriffs, or your local police department. Report these crimes, because that's what they are. They are crimes. They aren't just discrimination. They aren't just somebody's ignorance. They are crimes, and they have a consequence, and they also have penalties that are enhanced if another crime has been committed as well. There is no place in our city for this discrimination. I was appalled to hear some of our national leaders call this, all sorts of names that I won't repeat. This is a virus. This is a health crisis. It could have started anywhere in the world, and it doesn't matter where it started. It matters that across the world, we are all fighting this and fighting it together. And we have no place in Los Angeles for any hate, no discrimination, so please report that. Call LAPD and let them know if you have been the victim of a hate crime, and they will follow up with you, with detectives, and make sure that folks are brought to justice. Thank you. Next question, please.
Next question comes from the line of Alina Shakin with KPCC Public Radio. Please go ahead.
Hey, Alina. Good evening.
Hi, Mayor. Can you tell me what was it that tipped it over to issuing the order to wear face masks this week? Something that, for example, I know grocery store workers have, many of them have been wanting for weeks and weeks now.
It was.
What made it, this week there are suddenly enough masks?
So I wanted to move as quickly as possible. We were the first city in the nation to kind of push forward this advice. Many others followed, and we heard CDC finally give advice as well. So we're proud that Los Angeles continues to lead. That was in a voluntary way, and part of the reason why was I wanted to make sure that folks knew, educated themselves about the difference between regular medical masks and these facial coverings. We wanted to make sure there was capacity, so we'd been working for a couple weeks. And we have the confidence now that there is the capacity for anybody to get a facial covering. We worked and listened to the grocers, listened to the workers, listened to other folks about the best way to craft this, so it didn't just come down from City Hall. I always believe in bringing a coalition of folks together and listening to those concerns. And when we could address everybody's concerns together, but still not move backwards and say this is something important, we felt the confidence of having that today. And we wanted to give a couple days before it becomes mandatory. Look, if you can, start this tomorrow. But starting at midnight, Thursday night, Friday morning, This will now be mandatory in those situations. So it seemed like a point when we had the masks that were available, we had the education out there, and most people were already moving that way. So anything we could do to further that, a lot of people said, why not make it mandatory? Tonight we are. Thanks. Next question.
Our next question comes from the line of Abel Amadillo with Spanish Media Telemundo, Channel 52. Please go ahead.
Buenas tardes. Good evening.
Buenas tardes, alcalde. Yeah, just two questions here. It was noted today that people who are living in wealthier communities have had better access to testing, have been tested more than people that live in lower income communities. What's being done to remedy this? And you talked about the importance of these 2 weeks in terms of flattening the curve. Are you satisfied with the numbers you have seen so far?
So I'll answer both of those in English, then as I do, and I appreciate our Spanish media doing this so that we can make sure you have a set Spanish set. I'll go to Spanish and then I'll begin my Spanish remarks. And I was hoping some questions would come for Gene. He is a wealth of information, but let me also just start again by thanking Gene, allowing him to get back to the Emergency Operations Center and the great and important work that he is doing after I answer this. So in terms of the folks that are being tested that are wealthier, absolutely, that was something we saw early on. We saw the cases in wealthier communities too. Some said that maybe those communities traveled more internationally, so the spread was more accessible to them. But also, these are folks who have better access to health care. So they got through their private health care, and much of the testing goes still through providers. They were able to have access to testing early on when there weren't many tests. What did we do to remedy that? Everything that I've talked about for the last 2 weeks. Having public testing sites that don't ask about your insurance, don't ask what part of town you come from, don't ask how much money you have in the bank account, but simply allow for free you to be tested based over the last 2 weeks on whether or not you had extreme symptoms, the right age and vulnerability, now anybody with symptoms. So I'm very proud that that has leveled the playing field. Unfortunately, what that's brought is now we see numbers coming up in our middle income and lower income communities because it's more of a fair assessment. In terms of the second question, what was the second one? Could you just ask the second question one more time? Sorry. Oh, am I worried about the numbers? I think it was, right? The flattening the curve. Thank you. So, no, I mean, I'm never satisfied until we flatten the curve towards something in which we have fewer cases than we had the day before. Until we have a negative number, I won't be satisfied. But I am encouraged by all of you. I'm encouraged that we're seeing those numbers come down. I'm encouraged that we're seeing single-digit increases where we used to see double-digit increases. We'll see what happens this week. That's up to everyone that is watching. But where we had a 27% average increase 2 weeks ago per day, last week an 18% increase, which was a reduction of a third. If this week we're in single digits, that could be as much as cutting that in half. But any increase is still an increase. So let me try to answer that in Spanish. Thank you again to all of our English language viewers. I look forward to seeing you tomorrow, and strength and love as always. So hay dos preguntas.
Thank you guys for being here with us on News Now. If you haven't yet, you can subscribe to our YouTube page with Fox 10 Phoenix. That way you stay up to date each and every single day with us. Otherwise, we want to say thank you to those of you who are with us also on coronavirusnow.com. Not only with those top news stories and articles for you to read through, but also with our stream going 24/7. I want to go to a story that KTVU brought to us from the Bay Area. A Bay Area man is actually living in Wuhan, talks about his experience. Let's listen into that right here on News Now.
I'm Andre Senior at KTVU in San Francisco. I am joined now by Doug Perez, a Bay Area native who has been living in Wuhan, China, and has been through the outbreak since it began there. He joins us to share his story from there now. Welcome, Doug. Describe the first few days when this was happening.
Well, Andre, the first few days were really the scariest. You don't know what's going to happen. You have no idea really about how dangerous, COVID-19, really was. It didn't even have that name when it started out. There are no experts, even the experts, scientists and doctors, even they're unfamiliar with it. to a certain extent. So it really was, in some ways horrifying. I was also concerned about, the state. Just, I was concerned about civil disorder, having enough food, about dangers associated with venturing outside to get food, medicine, water, or what have you. Fortunately, those fears never played out. And, I'm hoping it's the same for the USA. Of course, there'll be issues, but I can only hope for the best. Now, months after, the situation's completely different. I can tell you that. I don't even think about, civil disorder or about a shortage. The situation has done a complete 180. Now I could even have, for example, fast food. I could order McDonald's and it can be at my doorstep in 15 minutes. And but in the early days of the outbreak, we'd order groceries and it would take 2, 3, maybe even 4 days for groceries to come in. And it's not safe to go outside. So, of course we were frightened. We stocked up on rice, we stocked up on masks, which I don't necessarily advise the people in California doing, because, those are needed for, workers. But I definitely advise, if you can get your hands on some masks, or, make some of your own masks, hold on to them, reuse them safely in accordance with CDC guidelines. Masks make a difference too. As a side note.
Doug, what was the first time, what was the date of the first time that this started to really, that you started to notice and things started to change?
I don't think I can't really say, can't recall the exact date, but I would say it was the day that Wuhan went on lockdown, the day that we were not allowed to leave Wuhan, the official first day of the quarantine. And my phone explodes with videos of soldiers at the airport, at the train station, not allowing anyone to leave. That's when I realized how serious this really was. And at the time, when this happened, there was talks of the evacuation and getting out of here. And I really thought that this was as bad as it was going to get. It was going to hit Wuhan hard. It would hit China and other countries, kind of the same way SARS, hit, only several dozen countries. And then eventually, went away. This really got out of control, and it's way worse than I could have imagined. That being said, in terms of my immediate security and security of my family, the security even of my friends here in Wuhan, it's no longer my chief concern. I'm more concerned about my family and friends back home, as the peak. We haven't even hit the peak in the USA, whereas we're well past the peak. Unless there's a second wave, which is something we're prepared for, but unless there's a second wave, we're in the clear right now. We're past the peak.
When this was happening, when it first started, you lived there with your girlfriend and your dog. What did you all do at that particular
and my girlfriend's brother.
And your girlfriend's brother too. What did you do at that particular point? What were you told to do right when this thing started?
Basically the same thing. Shelter in place. Don't go outside. Exactly what they're telling you guys right now. But it was compounded. It was made so much scarier that we were hearing rumors left and right, seeing videos of doctors breaking down in tears in hospitals. Messages from doctors and nurses saying, "Don't go out," begging people not to go out. So it was really, a very scary time. A very scary time. That being said, eventually we took the lockdown very seriously. Eventually things changed dramatically. Like early on in the lockdown, and this is something, again, to get back to your question, sorry for getting on a tangent, but early on in the lockdown, we had arguments. I had arguments with my girlfriend about the severity of the situation and about what actions we should take. This was such a black swan, horrendous event. You can't even imagine. You have no idea how bad it's going to get. I wasn't sure if there would even be, food in the supermarkets. With a quarantine with millions of people, there's always the possibility of food shortages. And there were some shortages, fortunately not of anything, that could lead to starvation. So, fortunately, that fear never came to fruition. But at the time I was very concerned about it. My girlfriend insisted upon relying on deliveries. On the other hand, my stance was we need to go out there, we need to get as much rice and, basic necessities to survive if the worst does happen, if this really gets bad. We had a big argument, we broke a plate. It was scary. But yeah, in the end, she actually won and we didn't go out. But in my defense, the delivery, it took a few days. And we were nervous because deliveries were taking a while. Eventually, they started coming in. Again, deliveries were still very infrequent. So we found it necessary to go outside and go shopping. And, that again, that was scary in of itself. Like they checked our temperatures at the door. People were all trying to avoid each other in the supermarket. I was in the supermarket one day, line. I was in line for maybe 45 minutes, get to the front of the line. And guess what happens? The person who, the grocery checkout lady, she starts coughing. And she's coughing a fair amount. And I've waited 45 minutes, and I think she's going to touch each and every one of my items. You know what I do? I get back in another line and wait another, 45 minutes. Because I wasn't going to let her touch my groceries. No way. No way. And this was before we had even hit the peak. This was in early February. No way. So that,
That's
and what
great.
gets me, what frustrates me, why, I don't understand, aren't, supermarket employees and delivery men, they should all have masks. I understand there's not enough masks for everyone, that's okay, but people in high contact professions where they're providing food, touching food, delivery men, they should all have masks. And I'm sure that we can, get the resources so that at least they can have some sort of protection. That way they're not spreading it to everyone, they're working with. So, I mean, that really shocks me to see that, to hear about that not every, grocery people, workers don't have masks.
Let me ask you a question. We have what they call a stay-at-home order here. What did you have in Wuhan, China in the days after this all started to happen? Was it a lockdown or stay-at-home order?
I would say that's kind of, at first, I would describe it more as a stay-at-home order. It was more voluntary at first, for sure. We were largely motivated by fear to stay in. That being said, they let us leave all the time. After a couple weeks, changed dramatically. I'd say 2 weeks. It's almost, I think, it kind of reflects the Chinese state itself. It's Leviathan. It's very big, powerful, authoritarian, and it takes a while for it to start, kick into motion. But after a few weeks, the security at our community would not let anyone out. They were really strict about it. And, and this was the same for communities everywhere, all over Wuhan. So at first, I would say it was more like California. It was more voluntary. But over a couple weeks, it changed completely. And they passed, actually, even an ordinance that everyone had to wear masks. Everyone. By law, if you're outside, in the city of Wuhan, you have to wear a mask. And there were videos going around of people in China getting arrested or, I don't want to say beaten, but, perhaps beaten by police because they weren't wearing masks and they were resisting arrest. But, I mean, there seems to be some evidence, some of which is anecdotal, that these masks made a big difference. So, I highly encourage people to make their own masks, buy just enough masks for themselves.
Did you run into...
Because we had a shortage of masks, too.
I was just going to ask you that if you had that same issue, with the same issue that we're having here, and mostly because they're trying to get those masks into the hands of healthcare workers. But what did you see there in Wuhan, China, and China in general?
There was a tremendous shortage of masks. I don't know if it's worse in the USA, but it was quite bad because everyone was wearing masks. Instead of stocking up on toilet paper, people were stocking up on masks. Us too. We didn't buy a ton, but we bought a couple of boxes, and everyone was doing that. There's also more of a culture of wearing masks, so it was a very easy kind of transition. One of the big hospitals in Wuchang, named Union Hospital, they put out a plea to the public. They said they weren't running low on masks. They were out of masks, out of PPE, protective equipment. They were completely out, and they were asking the community, for supplies. It was really bad, and actually, they were reprimanded by government officials here for doing that because, again, you kind of it caused the hospital to lose face. But they were out, and eventually they got the supplies. But for the first few weeks, they were out, and a lot of doctors and nurses died. And it's very nerve-wracking because I feel like the U.S. seems to be following in that direction. At least some places like New York. California is doing better. Fortunately, California is doing better.
As we kind of look to China, perhaps, because it sounds like what we're going through mirrors what happened with you in Wuhan.
Wuhan.
Yeah. So when did you start noticing the trend start to change?
I would say I was watching the numbers every day religiously. Of course, I question the numbers. Given the Chinese government, it's a different system. It's less transparent. It's authoritarian. So you have to take some of the numbers and reports with a grain of salt. That being said, we have nothing else to go off of. So you check the numbers every day. And what I noticed around mid-February, cases were starting to plateau. The number of deaths, the number of new infections around February, about a month after the lockdown, were starting to slow down. And then, gradually as time went on, cases fell even more. And while the government was just as restrictive as ever, and for good reason, I got to say, cases continued to fall, and eventually the situation improved. So I really feel, if I could tell anything to your viewers, it's that if you comply with the lockdown, if you take this very, very seriously, if no one goes out, if we all comply, if we wear masks, if we're all in this together, we take this seriously, I am very confident that we can, at least California and most of the USA can get through this in a couple months. Again, late January it broke out, early May, the situation improved dramatically. We're talking 2-3 months. And they took this very seriously. So it might seem impossible now. It might seem terrible. It might seem unfathomable to not work, to just stay home for a few months. But if everyone can do it, if everyone can stick together and stay home, well, not stick together, but be united, then I'm really confident we'll get through this. We saw it here, and we see it in other places too. Like if you look at the numbers in South Korea and Japan, they're already through at least the first wave.
What is the situation there on the ground right now? Are people still worried about contracting COVID-19, or are they still wearing masks? Are they still distancing from each other?
Oh, still wearing masks, of course, and much more so than before the outbreak. I mean, again, more people wear masks in general in China. It's a cultural thing, but a lot of people weren't before the outbreak. And now everyone wears masks. I'm outside, everyone wears masks. That being said, when I go outside, I'm worried. I'm seeing lots of crowds. There's some light traffic in places. Life seems to be coming back to normal very quickly. And, that's a little unnerving because it could easily spread, and it will start spreading before we have any idea. And before we have any idea, it could already be spreading now for all I know. So it's a very risky proposition to go outside. And, our community, they're letting us out. They have I don't know if you're familiar with are you familiar with the green code system? We have codes on our phones. And if you have a green code, which is a QR code, they scan it. If you have a green code, you're free to go. If, however, I have a green code, let's say I go on the metro, they find that there was an infected case on the metro, and using Bluetooth, whatnot technology, they know that I was on that metro. Guess what happens to my green code? Automatically turns to a yellow code, which means I need to go home, shelter in place. If I'm in a red code, I believe that means you're not supposed to leave for 14 days. That means you're locked down. That means a very high chance you're infected. So it's a very clever system. You have to give credit where credit is due, and since it's software, it can update automatically, instantly, and anyone can check it just by scanning it. And every time I leave the community, they check our green codes. They make sure we have a green code, and that could change on a dime if we're unfortunate enough to come into close contact with someone who is infected.
What else?
It's a clever system, actually.
What else is the Chinese government doing to prevent the spread or present a second wave, do you think? Can you tell, or are they telling you?
Well, I know some basic things. For example, at one point they opened up the buses and even the metro. Hey, Evan, They opened the metro, right? And then they closed it? Or was that just the buses? You said they opened the buses. The metro is still open? What about the buses? I thought you said they shut them down. That was a rumor? Okay. Well, that's another thing. You know, we're constantly. This is great information. My girlfriend can't speak because of obvious reasons. But I can tell you, they've opened all public transportation here, which makes me nervous. And you won't catch me on any train or bus or anything like that. People are using them. That being said, to their credit, at least they scan your QR code, and they make sure that it's a green code, and that way you can ride. In theory, it might work. I understand. Singapore, for example, they have an app. Germany has developed a similar app. It's clever. That being said, we'll see if it actually works. I can tell you from my own experience, foreigners don't have green codes here. There's not many of us, so maybe it's not a huge deal. But here's the thing. I go to the gate. I don't have a green code. I just kind of have to, I have another, I have a little form that says I'm okay. But, they want to see a green code. They look at me, we kind of talk a little bit in my limited Chinese, and they just go. And, my concern kind of is, it's great for me on the surface. Of course, I'm thinking, oh, it's great. I can go out. I can, do what I need to do, buy things, whatnot. However, if they do that enough, if it kind of becomes, more laid back, then, fancy green code, all the laws in the world won't matter if enforcement becomes lax. And that's my concern. In a couple of weeks, people will become more relaxed. And even, China can have the best set of laws on the books, but, if they're not enforcing them, then, it doesn't matter much. And that's kind of my impression of living here in China. There are many laws for everything, but a lot of them aren't enforced. And sometimes it even seems kind of arbitrary about how they enforce these laws. So I would say, again, I think the big thing is a lot of laws right now, and a lot of them make sense, I support 100%. The question is, will they continue to enforce them? And even now, I see some crowds outside already. Granted, everyone's wearing masks, but I think it's a little unnerving, because I can only imagine how many people will be outside after April 8th. April 8th being the big date that everyone's waiting for, because that's the date that people can leave Wuhan to go to other parts of China. So, I'd pay attention to what happens, around April 8th, because I feel like they're going to loosen a lot of restrictions. And, knock on wood, there's no further outbreaks, but, you have to be prepared.
I want to get your thoughts on what we're going through here now in the United States. Your parents, obviously, I spoke to them a couple of months ago. They live here right in the Bay Area. What are your thoughts as you watch this play out here in the United States?
Well, of course, I'm more afraid for my parents who are in their 70s than I am for myself right now. Even if there's a second wave here, I'm still more concerned about my parents, given the nature of the situation. That being said, I've followed the situation pretty closely, and I've compared the situation in the USA to other countries, and it seems to really vary a lot at a state level. And from what I've seen, it seems like California is doing much better than the rest of the country. And that's not a call for complacency. Quite the opposite. You have to continue to be strong and, stay inside. And I think California will have a much better outcome, a flatter curve. And I definitely think it's in part of, Gray Davis's decision to do the stay at home before, many other states even contemplated that. And I think that made a tremendous difference.
Gavin Newsom?
Washington State, they're flattening the curve. The situation is improving a lot there, and that was the first major outbreak. So there is hope, and I think you have to look kind of at a state level to see where there's hope. Granted, in some places it just seems out of control. I thank God that California and New York, California and the Bay Area where my parents are, at least that's not one of them.
How are they doing, by the way? How are their parents?
They're doing okay. They're doing okay, and I'm really psychologically I'm looking forward to day 14, because after being inside for 14 days, that if they can keep that up, they're should be okay. That means they haven't been infected. So so far they're doing pretty well. And they're lucky they have access to good health care. They're in a nice area, so I'm really happy for them. But not everyone, most people don't have that luxury. So I'm concerned, but I'm glad at least California seems to be doing pretty well relative to other parts of the country. So
I know
I'm
you were
happy
trying to
about
come. I know you were trying to come back here when this initially all started, but you were running into issues. Do you plan to try and travel back here after perhaps April 8th?
No, at the moment, no idea. I really, I have no idea. At some point, I definitely will return, but it has to be a time when the situation is all calmed down. And now it's not the time, but I definitely will at some point return. The Bay Area will always be my home. Will always be my home, no matter what. So but right here, I gotta stay with my family here. So.
All right. Doug Perez, Bay Area native living in Wuhan, China. He's been through it. And
Just want to say thanks again for being here with us on News Now. We're going to bring you another story from KTVU. This time, one photographer is taking a new approach to photos, doing a photography project on everyone's porch.
I'm Claudine Wong, joining you from the San Francisco Bay Area, and I'm excited to be joined by Elena Halverson, who is a photographer in Healdsburg, California, which is in the North Bay and wine country. Good to have you here, Elena.
Hi, thanks for having me.
Okay, so let's talk about what we're talking about. You are a photographer by trade, have been doing this for more than a decade and a half, right?
Well, about a decade, yeah.
A decade. And so, you have these pictures that I saw, and I'm just going to go right ahead and pull some of them up because they're so great. And these are what you call porch photos. I mean, we're in this world, right, where, people can't go anywhere to take these pictures that they like. These are ones that really capture. Tell me about this porch project.
So a friend had mentioned to me that she knew someone who was doing this somewhere else in the country, and I thought about it for a few days, and I was like, well, I would love to do that in my town because we have such a great sense of community in our little town of Healdsburg, and I just wanted something to capture what life was like during this shelter in place in Healdsburg.
And I love it because obviously the people that you took pictures of spent some time thinking about this, right? They wanted to express, when they will look at this picture, they don't want to say, oh, hey, I took this really cool picture in front of my house. They want to say, oh yeah, that's exactly how life was going down, in our house.
Exactly. Yes, exactly. I think that the feedback that I've gotten is that everybody is saying like, oh my gosh, it captures exactly the personality of our family right now.
Did you have to prep them for it? Because let me see if I can, this is your picture right now that's coming
no,
up.
This one's mine, yeah.
Yes, and this is what, as we leave it, and I want to go back to it really quickly, but as we talk about your family picture, I mean, you gave people some inspiration. You did yours first, and were you just telling people, hey, this is what my life looks like?
Yes. Yeah. So I, obviously the people that I've taken have done a spectrum of just showing up in their pajamas to doing like scenes. But for my family, I really wanted us to be, this is who we are right now. So, and I feel like everyone who's seen this photo has kind of been like, oh my gosh, it's all of your personalities.
Well, right. You have your little one who's dressed like a butterfly because why not?
Because you should be all the time.
You should be. Your husband's got the great hat.
Yes.
Because that goes with shorts 100%.
Totally.
That's exactly what you should be wearing. The other two, whether they're being silly. And then the art, I imagine this is shelter in place art we're looking at?
Yes, this is our shelter in place artwork. My husband put up that string so that we could display it and people walking by would have something nice to look at.
How long did it take you to come up with that? I did just now seeing the skateboard too that your other daughter is
Oh,
on.
I mean, really, we were just, this is actually didn't take very long. This is kind of, I said, oh, just show up. I told my kids, just do whatever you want to do. And this is what they wanted to do. And I tend to be a kind of a background person anyways. And so I was like more comfortable in the back there. And so.
Well, I love it too. I think, unfortunately, we all have more time right now than we maybe would want. And then no time at all. Like, I mean, it kind of goes both ways, right? Like, I feel like
I would have.
I will have time to organize that closet. Wait, I don't
But
actually have time to organize that closet because, you know, you are a perfect example. You were formerly a teacher, right?
Yes, yes.
And now currently a co-teacher with your children's teachers.
Yes. Yes.
How's that going?
You know, some days are better than others. Today was definitely more difficult, but tomorrow will be a new day.
Yes. You know, and I think that also expresses how people are feeling, you know, in terms of how they're managing this. Do you feel like this was a good outlet for people? Like they're all having fun. You can laugh about it because there are some great things about having some family time, and there are some some challenging
hard things
about having family time. That this was art is an outlet for, I would imagine, for both you and for the families that you're doing this with.
Yes, I mean, for me, it was such a wonderful, positive way to creative outlet. Obviously, I'm not doing family photo sessions right now, so this was a great way for me to still practice my art and do something that is makes the community happy. And so, and the families that I've done, it's kind of been like, this is our highlight of the day. We've been looking forward to this all day. So
yeah, I'm going to pause this photo right here because this one I think is so great. I am assuming the mom in this picture is a nurse.
Yes, she's a nurse, and actually
her RN on her.
Yes, and actually her husband, he's actually a firefighter. So they're both currently, you know, on the front lines of this. And
thank you to both of them if they're watching.
Yeah, so this was actually taken the last day before they were starting to be on opposite shifts. So I took this right before they started, where they weren't really going to see each other again. So.
And you're taking these pictures from how far away? Because
this one was probably like 25 feet away.
Yeah, and I like that the picture is shot in a way that you can actually see that, because that's part of it too, right? How you're able to take these. I mean, it's almost like you could sit in your car, right? And
yes.
Is it challenging? Because now, I mean, this looks like a cloudy day, but the light is always an issue for photographers.
You know, that has been a little bit of a challenge. I've now learned to look up people's address on Google Maps to see which way the sun will be facing, to kind of try to decide what time of day would be best to go by their house.
Yes. Well, and then you look at, I mean, each one, I like this one too, you know, I mean, I like all of them, but this one is let me see if I'm not as good at trying to press pause. Zoom recording. Okay, we had a little technical difficulty there, but we're going to resume our discussion. I'm not sure where it cut off before, but I'm going to share back to the slideshow because while I'm not as good at pausing that when I'm trying to pause it, even the tape measure there, that was a great idea.
Yes. So I really haven't given families much direction. I mean, if I kind of will pose them if they need help deciding where to sit, but besides that, I've just been kind of asking them to show up however they want to show up. So I feel like you're really getting a good representation of what their personalities are.
You know, and when you're charging people for this, I mean, is this an income generator or is this an outlet?
No, this is more of an outlet. I did it on it's definitely not an income replacement, but I did it on a sliding scale of just $0 to $25 being a max, mainly because I didn't want anybody to not be able to have their photo taken. And so, and I'm actually not keeping track of who's paying. I'm just doing it like as a lump. This will, in my books, will just be front porch photos, just because I don't want anyone to feel pressure. I really want it to be accessible to the whole community.
How many people have signed up? I mean, Healdsburg, I don't know how many people live in Healdsburg off the top of my head, but it is not,
It's
let's just say
small.
it's not the big city. You know, it is
No.
a small, it's a small town and a close community. And did a lot of people jump? You know, are you doing a handful or are you staying
Yeah,
very?
so I've done 100 so far. And then I have about, I think 30 to 40 signed up for this weekend.
Wow. That's a lot. How
So,
do you
yeah.
get through all of them? And will you just keep doing this for as long as, and how long does a sitting,
Yeah.
you know, I mean, a normal photography sitting,
Yeah.
be out there for a while.
Right. Yes. This doesn't take very long. It's like less than 5 minutes. You'll actually laugh because when I plan out a route, and when I had originally was planning them out, I was planning too much travel time because in Healdsburg, nothing takes longer than a couple minutes to get anywhere. And so I was running early. So I realized I could actually take more in the amount of time than I was thinking I could. So they take less than 5 minutes. I just kind of, the family or a couple or resident comes out, I quickly take their picture and then move on to the next one.
Yeah, I think, isn't it a great way though? I think photographers I know, not only is the income loss difficult, but the interaction. I mean, you have to
Yes.
like being, you know, in people's family space and getting to know them and being a part of that. And that loss is significant.
Yes, it definitely is. I mean, especially for the type of photography that I like to strive for and achieve, is like a very authentic representation of a family, a very lifestyle. So for me, that's probably one of the hardest things, is photographing these children, which normally I would spend so much time getting to know them and making sure they felt comfortable, is how do I do that from 25 feet with a gigantic zoom lens on my camera? So
Is it changing? I mean, you talked about how technically you've had to think about different things since you can't just adjust and move to a different light space or doing
Yes.
something else. That is it maybe also challenging you in your craft and changing you when you'll come out of this as a photographer, have a different view of the things that you have done for more than a decade?
Yeah, I totally will. I definitely, it's stretching me as an artist, and um, it really is challenging me, but in all the really wonderful ways that artists like to be challenged.
Yes. I always wonder, because you're a photographer and you have children and you have a busy house and you are also homeschooling and online distance learning at the time, are you able to take a gazillion pictures of your family during this process and how you guys are handling it? Or are you just like the rest of us
Yeah.
trying to survive?
I am just like the rest of everybody trying to survive. You know, I'm hopeful that as we get more used to this distance learning and just the routine of our day, that I'll be able to pick up my camera more with our family. But for now, I'm just like everybody else with little iPhone videos that were pictures every once in a while.
Well, I would bet that your iPhone videos are better than my iPhone videos and pictures. So you're still
I do know a few tricks.
Would you suggest this then to other photographers? Because it is one of those things that even if it took off, right, and people are like, I will give you a gazillion dollars for that picture,
right,
you can't go anywhere else outside of Healdsburg really
right,
to do it.
Right.
And so then it becomes this localized project for photographers in each one of their
Yeah.
cities. I think in my hometown, I've seen a photographer starting to do that and saying, hey, you know, if you just frequent a local business, I will shoot a picture for you, and other
Yeah.
people who are trying to
Yeah.
do this. Is this something that, I mean, for you, some people would say, well, it adds to an already stressful day, but is it a good release? I would imagine for you as well, and
It-
sort of sharing.
Yeah, it really is. I mean, I think that not only is it a great release for me and a way that I'm feeling like I'm giving back to my community, I also love that I'm documenting this time for my community. I'm planning on giving the photos. We have a small little museum here in Healdsburg, so I'm planning on giving the photos to the museum to archive. So
what a great
I
exhibit that
think,
would be, right? Especially
yeah.
maybe in 5 years when we look back at it and where we have come since then, and being able to get off our
Yes.
porches since then.
Yes,
You would hope,
right.
right?
Yeah, it would be nice. Yeah, I think that if another photographer feels led to do it, I think it's a great thing to do for your community, especially since you really are, you know, maintaining all of the social distancing and all those things. And I have found that it's just brought a lot of joy to families.
Yeah, no, I mean, I don't know any of the people really in the photos. I know you now, but
yeah,
but I've had a lot of joy just looking at them, and there is joy in this shelter in place, and I think that's what the families really have been able to pull out as they get together. And so, really beautiful work, and I appreciate you sharing those pictures with us and your story.
Thank you.
And I would love to see more porch projects in communities everywhere, because everyone's handling them in their own way and very specific to their community.
Yes.
All right, Elena, thanks so much for the talk. I appreciate it.
Yeah, thank you.
And if you want more, you can go to coronavirusnow.com. Thanks so much for joining us.
And that is the place to go if you want to continue watching our stream. We are going to be shutting it down here on the YouTube side. Before we do, though, just to look again at the University of Minnesota. This is from the Carlson School of Management. They have an interactive map up with many different tools that you can see at the top of the page here, but how many people are currently hospitalized, how many hospitalizations there's been since date, total deaths in each state. So then you can click through on your state. Wyoming does have right now being reported as 0 deaths, but again, these are still being continued to be updated by the University of Minnesota. So you can go on there and play with that, but we are going to be currently periodically bringing you this map with all these different tools and information. As you can see, though, this is the number of hospitalizations in each state. We were listening to Garcetti earlier. They do have over 2,500 people in hospitals. New York's obviously the one that's going to be the biggest number. They currently have more than 16,000 people in hospital care, and of those 16,000, more than 4,600 are in ICU. So again, this will be another tool we'll continue to bring to you here on our News Now stream. Just want to say thanks again for being here with us. If you want to continue on hearing more of these stories from across the country, you can do so on coronavirusnow.com. Until then, we're going to be signing off on the YouTube side, bringing you more stories again on coronavirusnow.com.